All right, folks, we're going to wait a few minutes because we are trying to get Zoom up and running. So you are welcome to continue to talk amongst yourselves and say hello while we wait for technology. Yes, I can turn that off. All right, good morning, everyone. It looks like Zoom is up and running in a way that we can include people outside of this room. So, good morning, everyone. Welcome to the Tuesday, January 12th, 2021 board meeting of the Placer County Board of Supervisors. Great to have you all here, and we are going to begin with a flag salute led by our county CEO, Todd Leopold. To the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Thank you. And before we move next, I'm just going to have the clerk remind folks how they can participate via Zoom during the public participation process.
The board chambers will be open to in-person attendance. In order to protect the public health and safety of our Placer County citizens, the county has limited in-person attendance to just 25% of the room's capacity. If all seats are occupied, citizens may be asked to wait outside chambers. Due to the reduced capacity, we ask that citizens only be in chambers during the item they wish to participate on and then leave to allow others to participate in chambers. For public comment, is also offered virtually through Zoom utilizing the raise hand function, which should be utilized at the time that the chair announces the item.
Thank you, Megan. And now we will have our ceremonial administration of the oath of office for our incoming supervisors. Judge Panesci, if you would come on up, please. And our new supervisors, come on up. Well, come on down. It's been an upside down world lately, right?
Thank you. Good morning. You can please raise your right hand. I state your name.
I, Suzanne Jones,
Do solemnly swear
do solemnly swear
that I will support and defend
that I will support and defend
the Constitution of the United States
the Constitution of the United States
and the Constitution of the State of California
and the Constitution of the State of California
against all enemies, foreign and domestic,
against all enemies, foreign and domestic,
that I will bear true faith and allegiance
that I will bear true faith and allegiance
to the Constitution of the United States
to the Constitution of the United States
and the Constitution of the State of California,
and the Constitution of the State of California,
that I take this obligation freely
that I take this obligation freely
without any mental reservation
without any mental reservation
or purpose of evasion,
or purpose of evasion,
and that I will well and faithfully
and I will well and faithfully
discharge the duties
discharge the duties
upon which I'm about to enter.
upon which I am about to enter.
Thank you, and congratulations to each of you.
Thank you.
Congratulations, Joan. Thank you, Judge Panesci. Appreciate you taking the time this morning to be here. And welcome to our newest supervisor, Supervisor Jones. And we'll have an opportunity in a moment, I think, for some comments. But we're going to start off with my favorite part of today's meeting, which is the selection of officers for our board to select our chair and our vice chair. So with that, since I'm chair still and I cannot make a motion, would somebody like to nominate Supervisor Wygant to be chair?
Madam Chair, it'd be my great honor to nominate the Dean of the Board, Supervisor Wygant, to be chair for the coming year.
Wonderful. And I will second that motion. And so all those in favor? Aye. And opposed? All right, motion carries. Thank you very much. And then we will also select our 2021 vice chair.
Madam Chair, I would like to nominate the Supervisor, what's your name? Gustafson, for vice chair.
Wonderful. And we have a second by Supervisor Wygant. All those in favor? Aye. All right. Well, thank you very much for serving. And I'm going to hand this over to you, Mr. Wygant.
Well, before you go anywhere, Bonnie, I have something for you as is customary, if I can open
The button is on that other side.
This is a plaque commemorating
When you
your
let us speak, you just-
challenged but distinguished year as chair of our board. Relatively new to the Board of Supervisors, you came onto the scene with just an amazing year to try to deal with. And a huge amount of activity to the board is related primarily to COVID, but other things as well. And you did a masterful job. I was so impressed. Your wisdom, your commitment, your compassion was seen during all that trying time. We set a record with board meetings, time that I've been in the office. So again, thank you. Congratulations. You set a great example.
Thank you, Robert. And with that, I am going to switch seats with you and allow you to preside over the board meeting.
Let's
Thank you.
wish us all luck. Chair height is perfect. It's a joke. Okay. Our next item is consent. We have a couple items that I think we know need to be pulled. One is 24A and I think 12B, but the board is happy to entertain pulling and discussing any of the items.
12B is department, so we're fine on that one.
Okay.
24A.
Thank you.
You're welcome.
So if anyone would request, we pull it. These are items that are intended to be approved all in one motion. But if someone wants us to discuss any of those individually, let us know. So, okay. Is there a motion on the remaining items?
Motion that we approve the remaining items.
Second?
I'll say.
Move second to approve the consent agenda as modified. Roll call, please.
Gore,
Yes.
Holmes,
Yes.
Jones. Yes. Gustafson.
Yes.
Wagner.
Yes. Okay, so next item is public comment, but a couple of things I want to mention. We will be adjourning today in memory of Ken Aston, and I'll comment on that when we adjourn. But additionally, we might have to, depending on how things go, we have a 9:30 timed item that is our seroprevalence test presented by Dr. Julie Parsonet, who's a professor as well as an epidemiologist at Stanford. She has a 10:30 class. So we're going to start that item right at 9:30 if it's acceptable. And
Chairman, do we want to go ahead and take item 24 from consent prior to moving to public comment?
yeah, thank you. But before we go any farther, we're going to take up item 24. So who's going to present that?
We have a public comment that wants to be given on that, so I will get him on the line. Raphael,
Yes.
go ahead and give your comments on item 24A.
Oh, thank you very much. Board of Supervisors, my name is Rafael Ruano. I'm an attorney with Goyer and Associates, and I come to you as counsel for the newly created Placer County Law Enforcement Management Association, which, as you know, is seeking recognition as the exclusive bargaining representative for the bulk of the law enforcement management classifications in the county. PC Lima would like to request that the board remove item 24A, which I believe you've just done, from the consent agenda. We believe that the subject matter of the proposal is best handled through the meet and confer and/or collective bargaining process between the county and its labor groups. And you've heard arguments against this proposal. I'm not here to rehash those. However, I would see prudent course for the county to table this matter until, at the very least, and in short order, we expect PC Lima has been recognized by the county and can engage in meaningful discussions on behalf of its members over the impact of the county's proposals. Thank you for the opportunity to speak, and welcome to the new Board of Supervisors in this meeting. Thank you very much.
Thank you.
No further
No other
comments on this item.
Todd, did you have a comment?
Mr. Chair,
Or-
if I might clarify, the county has received a revised petition to form a union for the management safety management. However, there is a process by which the petition is considered. That is going on right now by Todd Leopold in his position of reviewing the same. There is then a 100-day holding period, and then there has to be a vote. So in other words, there's a process by which this unionizing will go forward. It is not formed now. It is our position that it is perfectly appropriate if the board wishes to adopt this ordinance. Brett Holt is here for any other questions about this or this item.
In addition to what Karen had just mentioned, the board item before you affects more than just the individuals that are petitioning to organize as the Placer County Law Enforcement Management Agency. It includes other individuals who are not part of the proposed organized group. So therefore, they're waiting for the determination by the board as to this issue. And one clarification, it's a 30-day waiting period, not a 100-day waiting period. And then there has to be a confidential election by the proposed members of the group. Once the confidential election goes forward, and if a majority of the group agrees, then at that point, the PCLEMA would be recognized as the recognized public employee organization. Therefore, also, if the board decides not to pursue this, it would have to be renoticed and it would have to go back to the very beginning of the process. And part of the analysis went into having a decision before the board, for the board to make prior to the end of January, beginning of February, when Measure F would take effect.
So just in a nutshell, to clarify, I think what you're saying is if the board is comfortable with the intent of proceeding, there's no legal reason why we should not.
Correct.
Correct.
Any questions or comments, colleagues?
I had a question. So this is adoption of an ordinance for a 3-year, and we've discussed this and looked at all the numbers and understand the protocols. If for any reason the group forms and then wants to meet with us, we would go ahead. We could entertain that and consider changes later if we decided to. So nothing we're doing today is set in any further stone than anything else we end up doing. We can always modify later. Is that correct?
That's correct.
Okay, thank you.
Questions? Bonnie?
You know, well, it's not a question, but to clarify, right, this ordinance would allow actually increases over the next 3 years to our public safety managers, right? So we are actually providing additional funding for our safety managers who have worked very hard, law enforcement, some of the DA staff, probation staff. And I think this is a very generous contract and agreement on behalf of the board.
What is the pleasure of my colleague? Oh, you're right. Thanks.
With that, I'll
wait, is there anyone else, Megan, that would like to speak to this item? So.
Well, then, and I'll make a second.
Second to move, second and moved and seconded to.
It's been a while, huh?
Let's see,
I don't feel so bad now.
Could be a long 2021. All those in favor say aye.
Aye.
Opposed? Motion carries. Thank you. So now, at least for about 12 minutes, at the clock's right, we're going to open up the meeting to public comment. This is a time when anyone from the public can address the board on something that is not on the agenda, keeping in mind that we can take no action. So if there's anyone in the audience that would like to address public comment, please come forward. State your name for the record.
My name is David. Allen. I represent the WIT Community Complex. And I would like to, if possible, pass these out to each one of our supervisors. If somebody could do that for me, please. That must be it. Thank you. As I said, who I am, by the way, I'd like to start this with a quote from Gretchen Steinberg, president of Sacramento Modern. I know many people have heard some of these before, but you can always hear it again. It's always a mystery when an owner fails to understand the intrinsic values of these irreplaceable assets. You can't fake history, and no amount of brick veneer, slick marketing drive, or a new neighborhood nickname campaign is going to bring that mojo back once it has been removed or knocked down. Or in other words, when it is gone, it is gone. While I give our progress report, just think about the previous quote. Let that ruminate for a while. From April of 2019, when the Board of Supervisors gave the community an opportunity to come up with a plan to now, the DeWitt Community Complex has been formed as a 501c3 corporation, and even during these COVID times has been making significant financial progress toward the ultimate goal of repurposing the DeWitt Theater and its surroundings. Peaches Architecture from Roseville has been hired and has generated their renditions of the finalized version of the theater, which you should have. I have included just a sample of the endorsements that we have received. One of the architect's closing statements is the size of the auditorium space with the auditorium space with its magnificent brick walls make it a valuable resource that will be considerably less expensive to construct as a renovation project than if it were constructed as a new project. In spite of the good work that has been put forward, let me point out that we are now in a classic catch-22. Even with the necessary outside endorsements, support is a challenge to generate resources to reach the higher goals without knowledge of the county parameters. There have been a few grant rejection letters and verbal responses that basically inform us that our actions cannot be made until the county position becomes clear. Most importantly, it is very evident from our public outreach that there is a strong community support for this project as a whole to replace a portion of the community that was lost when users evicted from the Costco proposal. Going back to the April decision, what are the parameters or guidelines that the DeWitt Community Complex and the community in general needs to meet with to win the acceptance of the Board of Supervisors for us to continue? We are chasing an unknown target. Therefore, we are requesting official support and identification of these guidelines to assist in the project. Placer County is like a microcosm of California. Most of the population is in South Placer, and most of the remaining historical sites are elsewhere. The issue with the DeWitt property is that it's not a city, but is part of the county, and as such is often underrepresented for the community. I'm going to need about an extra 10 seconds. Some of you were either born here or have been here for a long time and should recognize that dichotomy. The opportunity of merging history, art, and community is not one that comes along frequently, and the DeWitt Community Complex and people of North Auburn would appreciate your support and guidance. DeWitt Community Complex is committed to completing this project, but would like to receive assurances from the Board of Supervisors of your support to help facilitate this process. Thank you very much.
Thank you for your comments.
Good morning, members of the board. Kirk Euler, resident of Granite Bay. I am here this morning to simply congratulate each and every one of you, Suzanne on assuming office, Cindy and Jim on resuming office, Robert on being elevated to the august position of chair and all the additional duties with all the additional compensation that entails. And hope you're all gentle with Robert as he kind of eases into this. You know, he's kind of new to this stuff. And most importantly, Bonnie on vacating the office of chair. Congratulations. Wish you all the best of success in the coming year.
Thanks.
Good morning.
Good morning.
Scott Vaughn from Granite Bay. It's been almost a year since I've appeared before you. I just came this morning to say, first off, thank you, Supervisor Jones, for having the courage to run this year. I know that's a big decision, and all of you know that there can be smears and things, all sorts of stuff going on. So I appreciate that you took the courage to run. Secondly, congratulations. It's difficult on a shoestring budget with just a handful of volunteers, grassroots, to make it work, and you did. So appreciate that. Third, there's still issues out there, and I hope that with the changes in the board and things coming on, that finally we can work with the board instead of being adversaries all the time, and that we don't just argue and fight. My neighborhood, the community, and the Placer residents deserve to be heard and to have their items addressed. So thank you very much, and congratulations.
Ellie, are you there?
Yes, I am.
Go ahead, give your comments for the record.
Ellie Waller, former Tahoe resident. Tahoe is my backyard. I am happy to see Anders Hauge reappointed to District 5 seat for the Planning Commission and believe some of his conflicts of interest can be mitigated, allowing him to weigh in on Tahoe issues. I am very enthused with the current North Tahoe Regional Advisory Council makeup. I'm hoping you keep all members for continuity during these unsettled times. Each brings a unique approach and are well-rounded and versed in community issues. I'm very curious why MAC meetings have been postponed. Please provide an explanation to the public why these meetings have been stopped. From the handbook introduction, the Board of Supervisors strongly encourages and appreciates the input given by the MAC. Your participation is important and we hope you enjoy playing a key role. The Board of Supervisors is the governing body of county government and is committed to providing responsive leadership, governance, effectiveness, oversight of county services, and involving citizens and communities in this process. I strongly urge that the North Lake Tahoe and Squaw Valley MAC be provided the opportunity to weigh in on the tourism bid improvement district process before the board makes their final decision. Next, looking forward to an update on the Kings Beach Town Center from the Clark Group and their payment obligations, follow Lima negotiations to build a hotel, the status of the stages at North Star, etc. And lastly, I am looking forward to the Brockway Campground project being removed from the active secret list at your next update of that document. The U.S. Forest Service purchased the land and acquired 120 acres on Brockway Summit. The press release, South Lake Tahoe, December 10th, the USDA Forest Service Lake Tahoe Basin Management Unit is pleased to announce we have completed the purchase of this significant undeveloped land on the north shore of Lake Tahoe. I'd like to put a special thanks out to the mountain area preservation people who held strong and also helped rid this project from the books. Thank you.
Thank you for your comments.
Chairman, we have no further comments.
Good. Karen, we're probably, pardon? Yes, Suzanne.
Thank you for that.
First of all, welcome again.
Thank you. Thank you very much. I'm very excited about being here. I wanted to tell all my constituents that are here and those that are viewing how much I appreciate the support and all your hard work in getting me to where I am. And I do promise to represent you to the best of my ability. And the plan is to have more community participation. So I look forward to working with my constituents. And I especially look forward to working with all of you. Thank you very much.
Thank you.
Good, good. Yes, sure. Yep.
Just had a quick report for the rest of the board. Yesterday, we got the great news that the Army Corps' new commander has approved the alignment for the Martis Valley Trail that has been worked on hard. And I want to give credit to a number of people. Congressman McClintock's office has really been a bulldog on this for about 10 years of my life that I've been watching this project. And as you know, and obviously county staff as well, and the Army Corps' commander making a change in that decision, which will greatly benefit the construction of that trail. But most especially, I wanted to thank North Star Community Service District General Manager Mike Stoudemire. Mike has been just incredible at pushing this project forward, bringing it to many elected officials, acknowledgement of the benefits of this trail being in an alignment that people will use and preserve. So it's great news. You'll be talking about the item later. I'll need to recuse on that one, but I just wanted to let you know of the Army Corps' decision. So thank you.
Great. Congratulations. Okay, so it is 9:30 now, and Todd, is Dave?
Davidson.
Where's Dave? The mask, I couldn't see.
I was hiding. Good morning. Good morning. Morning, Chair, members of the board. Dave DeFonte with the County Executive Office. Welcome, Supervisor Jones. We are here today to receive an update on Placer County's COVID-19 study being conducted by Stanford University. So as you recall, on May 5th, your board directed the CEO to work with our public health department to explore a potential seroprevalence study in the county. On May 26th, we were back to your board when you authorized the chair, Todd, the CEO, to sign agreements as necessary to conduct the study. On September 8th of 2020, the county and Stanford entered into an agreement to start that study. And ever since then, we've been working along those lines. And Dr. Parsonet is on the line today to give you an update on the study and where we stand today, including next steps. So with that, Dr. Parsonet is George DeForest Barnett Professor of Medicine and Infectious Diseases and a Professor of Epidemiology and Population Health with Stanford University. So without further ado, I believe Dr. Parsonet's on the line. And there she is.
Thank you, Dave. Welcome, Dr. Parsonet.
Yeah, thank you so much. And thank you for inviting me. Can you all hear me okay?
Yes.
I feel like I'm fading out. Okay, so I hope I have a good enough web link to continue. If there's a problem, please let me know through the chat or something. I will probably turn off my video just so I can share my slides with you. All right, so I'm going to just discuss this seroprevalence study that we're doing with Placer County, which I think is actually a landmark study that'll be important for the entire country and the state as well. So I think it was very foresightful of the board to engage in this work, which I think is going to be very interesting in the end. So the objectives of the study were to recruit a representative sample of 2,000 Placer County residents for a serosurvey. And as you recall, serologies look for evidence of past infection. They don't look for ongoing infection. They look for prior exposure. We also are going to conduct serologic testing of these 2,000 participants and then to conduct confirmatory testing of all positives and a subsample of the negative tests. We then are tasked with orienting the data to better understand this information, who's at risk, where are the risk areas, what populations, for instance, are at risk, and then to provide all the data as well as a dashboard to Placer County so you can evaluate the data better on your end. To date, we're pretty close to finishing A, and we're almost done with B. We think we'll be done with those within a month or so. And we are well on way to conducting the confirmatory testing. We're in the process of orienting the data. The data have required a lot more cleaning than we had anticipated. So it's taking us a little longer than we'd like to orient the data. And we have some aspects of the dashboard ready, but we have not delivered them yet. So just to go through the process and what's happened so far, we've sent out mailings. And the way we do this is we send out mailings, we invite people to participate, they respond to us. Once we hear a response from them, we send them the kits to test, and they can test up to 3 people per household. They then send the kits back to us. So you can imagine that this actually takes some time because mail is not instantaneous and responses are not instantaneous. So I'll give you a sense of how the timeline looks. So we sent out the mailing. The first mailing went to 5,000 different households in Placer County, and one on the 19th of October, and the second one on the 1st of November. And you can see that there are 2 peaks. There's an early peak when we first sent them out where we got a lot of people responding, and then a second peak in this area where we got a second wave of people that we invited the second time to respond. And you can just see the numbers of responses we got. It was about, depending on how you look at it, it was somewhere around 6% response. We then sent out a second mailing of 10,000 mailings on 11/30. And again, you can see we got this huge peak response early on. And what's interesting to me is we have not sent out a second mailing. We decided not to send out a second mailing to this group, but rather to do another mailing to a new group like next week. And what's interesting is despite that, we are seeing a lot of people have kept their invitations and are responding now. And I think this is due to the large increase of cases that occurred in November and December. Our original mailings were the first ones were well before the peak, and the second one was in the beginning of that peak of COVID. And now we're seeing that people are much more interested. So those who have saved their mailings are now getting back to us. So overall, 1,215 households have responded and requested 2,661 kits. And if you recall, we only wanted 2,000. So if all of those kits get of those 2,000. And we've sent kits to 1,065 households to date. There are still some that we haven't sent out. I'll mention just because of the Christmas break, we got a little bit backloaded on the mailings. Just to show you on those first two mailings where the kits went, all the blue dots are places where we mailed kits. The red dots are places, people that responded, our households that responded. So you can see that we actually have a fairly diverse segment of the population. And you can see that essentially we've represented the population relatively well. And we work quite closely with a marketing firm to try to make sure that we get all parts of the county. Let's see. These are the response rates. And you can see on the bottom right here what the response rates are. So they go from up to zero. So this is part of the dashboard, by the way. When we look at this live, this is actually a screenshot. You can click on each census tract and see how many people are in that census tract that we wrote to and how many responded. So it is actually a responsive dashboard, but this is just a clip, a video, a screenshot. And at the bottom, you can see the response rate. This particular area, which looks very light and has a low response rate, we actually, I think, sent 2 cards to. So there were no responses. And similarly, this one, we sent 2 or 3 requests to, and half of them responded. So sometimes the colors are deceiving just because we didn't send many requests to those households of the 15,000 that we mailed. But you can see overall that we're getting reasonable response rates from most of the county, and it's not too uneven across the county. It's all in the range, again, of about 5 to 15% response rates, depending on where you are. And this is just a different view of the same data where we look across the county and see, if looking at the responses, what % of the responses come from each of the census tracts. Census tracts are supposed to be approximately the same in size, so this ideally would all be the same color because every census tract would contribute the same number of people. And we're close to that. I mean, you could see that there's, sorry about that. There's fairly even representation across the county. If you notice, there are some areas that are outlined in orange, and these are areas that have higher % of Hispanic population. And as you know, the Latinx population has higher rates of COVID, and they also respond less readily often to surveys that we send to them. Our surveys are spent in English and in Spanish, and they have a lower rate. So we have targeted those populations to see if we can enrich them and get higher rates of Latinx populations participating so that we can represent them well. We don't want to just say, oh, we only had a few Hispanics in the Latinx in the population, so we can't speak for them. So we're continuing that process. There was it's not clear to me why we have over here at Kings Beach such a high number of people, but we're actually planning on not sampling that population in the next mailing that we do. So who's participated so far? We have analyzed 1,240 survey responses. As I mentioned before, we've had 2,661 requests, and actually a little bit more than that. The reason we don't have all of them with survey responses yet is because we haven't sent all the boxes out yet. We have about, I'd say about 1,200 400 or so houses that we need to send the boxes to, which represent about 1,200 people. We also have a fair number of people who send back the kits with the blood spots without actually answering the survey. So we will not end up having as many surveys as we actually have blood spots. And these are the characteristics of the population. It's the average age so far of the surveys is 53 years. I'll show you a little bit more detail in a second. 53% are female. It's a very high education level, and Placer has a fairly high education level, but this is higher than the average in Placer County. And we are underrepresenting the Latinx population, as we have been concerned about, and that's still a population that we hope to be targeting in the next mailing to raise that number somewhat. And this just goes to show you the age and sex. We specifically say we are not going to test children in the consent form and in the mailing that we send to people, but obviously people don't always read what they're mailed. So we do have 9 children in the data set. The maximum age was 93, and the mean age you can see is at this crossbar here is the median age. And then this is the interquartile range. So 75% of women are between the ages of 40 and 65, and the same for males. So it's a middle-aged population. We've logged in 992 blood spots, and 810 have been resulted that I'm presenting here. We actually have logged now over 1,000, and we've run more than 950. So we're getting substantially higher. I just haven't had time since I submitted this to update the data. I should point out, that most of these data, blood spots, are from, we do them in an order in which we get them. And because our initial mailings were in October and early November, most of the blood spots that we've gotten are from November. And so when you think about these blood spots, you have to think of them representing disease that occurred before the end of November. And probably since blood spots, serology lags 2 weeks behind testing. So when you, behind infection. So if you get infected, your serology won't turn positive for 2 weeks. Even if these are by the end of November, we're really only representing disease in the data that I'm showing in mid-November. So just remember that timing. We're going to have a lot more in December and January in the next month or two. And the real crux of it is, at that time, we had only 2% seropositive. So only 19 of the 810 were seropositive. And they range across the span of the county. So that's low. And it again shows that there is still a considerable proportion of Placer County that is at risk for infection, or at least was at risk in November. And even though we're having this surge, you will need to assume that the majority of people in the county are not immune. You're nowhere close to herd immunity, and the population remains at high risk, and that vaccination is still going to have to be a very important strategy for the county. Let's see, the page is not going. Sorry about that for some reason. There we go. This is again, just a quick picture of who's infected. The red dots are women, the blue dots are men, and anything above this line is seropositive. You can see that there's a fairly good diversity of age. There are no people here, children that were infected that gave us serology. And it represents the population that gave us blood spots. And there's really no difference between men and women. And these are the cities that are represented. Again, we have more data now, but at the time when I provide this, this is what's represented. This is an interesting graph because this is 100% of each city. This is the proportion of people in each city that is infected. So it looks like Forest Hill is some sort of hotspot, but in fact, Forest Hill gave us very few samples, and it just so happened that there was a household there that gave us samples that were positive. So, but it just gives you a sense of the proportion of those respondents. And if you look at it as a proportion of the total number from each city, it looks quite different. So if these are now show you how many people were sampled in each of these cities. So obviously Roseville had by far the most samples that we did because of the population size. And you can see the small proportion of each of these cities that's infected. And now Forest Hill doesn't look so frightening as it did before. It's just that we happened to hit a household that was infected. So things that have slowed us down are, again, I told you that we have a lot of data cleaning to do. There have been some problems with the QR coding system, that people could scan the QR code more than once. And so we have people repeating their surveys over and over again. And so we've had to just clean up all the repeat data, which has taken us some time. We also got impeded by the Christmas holidays. Stanford closes for most of December. And that slows us down a lot. It slows down mailing. It slows down, we can't do the serologies. We can't do the extraction of the blood spots. So it was a considerable hit for us in terms of getting things done as fast as we would have liked. And then, of course, coronavirus slowed us down as well, not because any of us got infected, because we didn't, but because the resources are in high demand. And when there was the big surge, and as there continues to be in Santa Clara, the labs have competing priorities. And so it just slows down the speed at which we can do the serologic testing. So I do want to just get back to saying that there's a good advantage to this delay. And the advantage to the delay is that, as I told you, we test the spots as they come in. So the most spots, the early spots are all completely tested, as you see here. And as we go forward, we've tested a smaller percentage of them. Although as we move forward, this triangle will get bigger and bigger until we encompass the entire area and get everybody. It'll turn into a rectangle, and we'll have covered everybody in those time periods. And as I mentioned also, the serologies lag by 2 weeks, the actual infections. So the blood spots that we're getting are representing infections that occurred in this time zone, okay? And this time period is a time when things were pretty quiet in Placer County and in California more generally. So the fact that we were delayed is actually, in some respects, going to give us a better picture of what's going on now at a very important time in Placer County's history of this outbreak. So, by the way, the graph in the background is from your website looking at numbers of cases on a daily basis. So just to summarize what we have approximately 2.3% and the confidence intervals of about 1.4 to 3.6% of the population in Placer County has been infected by middle of November. That equates, given a population of about 400,000 people, that equates to 9,200 people infected, with a range between 5,600 and 14,000. So that's the range of infection that we think is going on in Placer. That number is double the number of diagnosed cases that you have by a nasal swab. Double is not, and let me just say that number is likely an underestimate because the population is a somewhat higher education and does not represent the Latinx population as well as we'd like. When we adjust for those things, that approximation will rise. We expect serology to exceed the number of actual cases in every population, and that the amount it exceeds the number of diagnosed cases really is dependent on how much testing goes on. So I think Placer is doing pretty well on testing, that we are only twice the number, 2 to 3 times the number of actual diagnosed cases. So it looks like that number, that the number of times the serology exceeds the diagnosed cases by swab definitely shows that there's good amount of testing going on in Placer County. There were 60 deaths in Placer County by mid-November. And if there were 9,200 cases at that time, that makes the infection fatality rate about 0.6%. And that's very much in keeping with what's seen nationally, where the rates of, and internationally, where the infection fatality rate ranges from 0.1% in Japan to 1.5% in New York City. So so you're somewhere in the middle of the range of infection fatality rate. So that means basically a little bit more than 1 in 200 people who has infection in Placer County is dying of that infection. And I want to point out that that's considerably higher than seasonal flu, and maybe as high as six or 7 times higher than seasonal flu, depending on the season. These information can help you roll out your vaccine and understand the importance of getting the vaccine out, and also help you understand how the county is doing with respect to their medical care in terms of infection fatality rates, and also how well you're doing in terms of testing. So there's still a lot left we have to do. We're finishing up a current mailing and the serologic testing, and the data that we have now should be done by, I would say, the beginning of February. But we'd like to do an extra mailing, and we've talked about this with Supervisor Wygant and with Mr. DeFonte to try to see if we can capture the surge that you've had recently. So we're working with our marketing firm to make sure that we can target the right populations to enhance the diversity and to cover the surge and to be able to look at time trends. We are completing our confirmatory testing with a second serology. Actually, our first serology is much better than any confirmatory serology that we're going to be able to find. So that's something that we should probably, I'd like to talk about with Mr. DeFonte and the board as well, is whether that's really worth doing. And then we have to complete the epidemiologic and statistical analyses and to complete the dashboard. So those are, that's my presentation. And I'm very happy to take any questions you might have.
Thank you again, Dr. Parson. First of all, thank you for all of your insights and guidance and advice over all these months. For me, it's been extremely helpful. So I want to articulate that again. One quick question, or a couple of things, I guess, actually reflect my thought process and just hear your comments on it. It's, to me, the striking thing about what you proposed today or presented today is that to be honest with our constituents, we have quite some time to go forward before we should expect reaching herd immunity and seeing declines in spreads. And that, of course, has a lot of implications as it relates to any policy considerations we have. I was in a meeting with Dr. Oldman, public health officer, a few days ago, and he reported out how quickly our vaccines are going forward, and it sounds like with that contribution towards herd immunity, and if herd immunity is 75 to 90%, which it appears more likely now than the earlier, more optimistic thoughts, that again, springtime, early summer is a time where we should express that there will still be a significant amount of risk exposure to our population. So I'm just curious as to your thoughts about that.
Yes, I think he's right about that, all those comments. I think the vaccine, it is incredibly important to get the vaccine out. And there are a couple of reasons for that. First of all, we're nowhere near herd immunity. The second is that it appears that the vaccines provide better immunity than infection does. And we are seeing cases recurring in people who were infected months ago. In general, typically coronaviruses don't provide lifelong immunity, unlike, other types of viruses that we see that may provide, or infections that we see that might provide lifelong immunity, like measles. Coronaviruses do not provide lifelong immunity. And so those people who are infected, even in April and May and June, may not actually have immunity anymore. And the vaccine seems to be providing better immunity. There's an article out from just today from Moderna saying that they expect to have at least a year of immunity with the Moderna vaccine. So we're very hopeful that they will be more effective at providing immunity. So yes, I think that we will not be anywhere close to safe from this virus until we have a much broader coverage, and it will be over 80%, and it may be closer to 90%. I will say that getting to 90% or even 80% is going to be very challenging in any environment, because there are many people who just don't want to get vaccinated. It's quite concerning. And I think that is going to be a challenge for your county, is to show how great vaccination is at saving lives. If you remember in polio vaccination, I'm sure many of you, at least people who are my age and older, will remember getting sugar cubes with polio vaccine on it. And the long lines of people who were getting those sugar cubes with polio vaccine. People were, rushing to the doors to get their children vaccinated. And so there's a huge difference here. We have people rushing out of the doors to avoid vaccination rather than rushing into the doors to get vaccination. And I think this is, partly an issue of fear, partly an issue of who's getting infected. It's not children, it's the elderly, and a feeling that of youth that people are immune. And it's also an issue of marketing and making sure that people understand how safe it is. And that is actually much, much, much safer to get vaccinated than it is to get the infection. And I think it's also, people have to be aware that death is something very, very easy to monitor. So we're very good at saying, oh, you're not going to die of this infection. But it's also really important to communicate that a lot of people with this infection don't die, but are really sick. And they consume a lot of resources for the county. They consume a lot of resources for the health department. They cause an enormous amount of loss of work and also just a lot of suffering. There are a lot of young people. If you look at Stanford's hospitalizations, for instance, they're not elderly. They're people in their 20s, 30s, and 40s who are in ICUs and are quite sick and who are going to be sick for a while. So I think there are a lot of issues in trying to get more people vaccinated so that we can prevent that kind of suffering and prevent death. And I think that these data are suggesting that there's a lot of work that has to be done in that area.
And then my last question is, thanks for that. In our last conversation, we were drilling down a little bit into the ability you might have as it relates to the census tracts and being able to identify different populations. So when I think of my district and my community, particularly the city of Lincoln, it seems like if my colleagues wanted to ponder particular populations in their communities, they might be able to work with you as it relates to this data so we could actually target perhaps populations that should be vaccinated more early and or ones that maybe we could assist better with as it relates to education. So do you have any comments about that?
Yeah, I think we have a way to go to see that. I think we don't have enough cases yet to be able to do the targeting. Our hope is that we will, as we move forward to this final stage of the study, that we'll be able to use that kind of information. I do think that your health department probably has a pretty good sense, even by where the cases are, too, about vaccination. And you know, the decisions about vaccination are public health. They're also political and they're social, and they reflect, you know, our values as a community about what we want to accomplish. So if we want to prevent death, then obviously the people that we're going to want to vaccinate are the people at highest risk of death, and those are the elderly. If you want to to help the economy, which is obviously incredibly important, then you're going to want to vaccinate all those essential workers, all those people who are out and might get sick that are really essential to keeping the economy up and running. So all those things are very important. As a board of supervisors, I know you're considering it extremely carefully. I think the vaccine, the seroepidemiology is one part of that. It's a small part of that. And the other parts are really going to be about what is practically possible, what are our ultimate goals in getting the vaccine pushed out, what is the public health department recommending? Because I can guarantee you the public health departments are thinking so carefully about all these pros and cons. And trying to come up with a strategy that will be effective, that the population will feel it reflects their values, and that will have the highest impact.
Thank you. Questions or comments from other colleagues? Cindy? Or let's start with Bonnie and then we'll go to Cindy. Okay. I just want to share with everybody that Bonnie's name tag says Robert because I was just sitting there a while ago, so we're gonna have to work on that. Otherwise, I'm gonna be tripping up. So, Bonnie, please.
Thank you. Good morning, Dr. Parsonet, and thank you for your update. I really appreciate it. I'm a little muffled, so I'm going to do this. You know, I had an opportunity this weekend to hear from some physicians, and I understand there are a number of seroprevalency studies that have been taking place. I think there's one in Santa Clara County that's taken place, and so a couple things. I don't know if you've had an opportunity to take a look at what those results have been at this point. And I know that you still haven't done the stats on how this disease is affecting our community as far as, you know, ages of deaths. My understanding from him was that 95% of those over 70 years old survive. But those under 70 years old, it's a 99.95% survival rate. So for those under 70, the survival rate is very high. And then children are very less likely. I think he said it's less deadly for children than the flu, which is a very good thing. But I don't know if you've had a chance yet to see other studies and make a comparison. And if you could even comment on those numbers I just mentioned, that would be helpful.
Yeah, so a couple things. I'll start with the other seroprevalence studies. I'm familiar with all of them. The one that was done in Santa Clara was done by my colleagues, and it was done in May of last year. So there's no real comparison with what's going on now. So they had a seroprevalence of 1%, 1.5%. It was very low. It was very early on the outbreak. We are actually doing a serosurvey in Santa Clara and in Solano counties, in addition to Placer, although we put Placers first, so those others are lagging behind. But we hope to finish those. And the state of California, with whom we're working, and they've actually adopted this, the state has adopted more or less our platform, and they'll be looking at 9 additional counties in the state of California. So there are a lot of serosurveys around the country. They're all quite different. There's a national one that's being done by Emory that's looking at 10,000 people nationally. I have to say we're looking at 2,000 people in one county, so that's a pretty high representation compared to 10,000 for a country of 350 million people. We've also done a survey, our group has done a survey of 40,000 people nationally who are getting dialysis. That's a captured audience. We have their leftover serum, and we know how they represent the population at large. That study found 9% seroprevalence on a national level. So Placer County is lower than the national level. And that was done actually on sera from July. So it's likely to be higher on a national level. So Placer County is significantly lower in November than we were nationally in July. And if you look at the CDC website, they have a lot of national surveys of remnant serum, and Placer County, again, is significantly lower than the national level. There are places like New York, which have over 20% seroprevalence. So Placer County is looking very susceptible, let's put it that way. You talk about deaths, and I do want to say that I don't know the exact figures. Death in children and young adults, very unusual. And deaths in the elderly over 85, the rate is quite high. It's about 20% in people over the age of 85, the mortality of infection. And it goes from 20% and then it continues to drop by age. So when you get down to children, it's very low. I will point out, though, that if it's 0.6% mortality for this infection and everybody gets infected, that's a hell of a lot of people, okay? 1% of the population in the United States would be 3,500,000. If everybody got infected, you'd have 3 million deaths in the United States. That's a lot of deaths. And again, if you had that for Placer County, it would be a lot of deaths. It would be considerably more than you have now. And that does not include the long-term consequences of this infection. So we have people who are just sick for a long time. They're out of work for a long time. And we also don't know whether they're going to have long-term consequences to their heart. There have been a lot of issues about cardiac consequences to this infection and lungs. And so I think that we are going to see, we don't know yet, but we'd rather prevent it from happening. And I will point out, too, that nationally, COVID is now the 3rd leading cause of death in the United States and is the #1 leading cause of death in New Jersey. So it's not a trivial thing, and you don't want that to happen in Placer.
Sure, thank you. And I think one of the things that will be interesting to learn more about is I've been hearing that there are some drugs that can be provided to people early on in the disease that could be effective and helpful, but I know there's still studies that need to be done with those. But I appreciate your perspective and certainly the importance of vaccinating folks who are at risk. So thank you very much.
So I do want to comment on the drugs. I'd like to just make a quick comment about that. I'm an infectious disease doctor. I'm actually on the COVID service at the hospital right now and taking care of COVID patients. And I have an outpatient clinical trial to try new drugs for outpatients. We're trying a drug called Camastat. It's our 4th drug that we've tried as an outpatient. There are no good outpatient drugs right now, except for the infusion drugs, Regeneron and bamlanivimab, which is made by Lilly. And neither of those are easily accessible. So they require coming into a hospital and getting an infusion. There's no oral medication currently that can be used to prevent disease progression or transmission. And it's an area of very active interest and a lot of trials that are ongoing nationally to look at that. I also want to just just go back to what Supervisor Wygant asked also. I don't think this virus will ever go away, just so you know. We may be much better by the summer, but it will never completely go away.
Thank you.
Cindy.
Thank you, Robert. First off, Dr. Parsonet, I want to thank you. When we first embarked on this journey, we knew so little, and I feel like we still know so little in many ways, but really appreciate your expertise and really hats off to Robert, who led the charge on this to get us engaged with you and to really insist that we get the best science we could for our residents. So I really appreciate that, Robert. Was in the screening process, do you eliminate those that have already taken a positive test, known they've had the disease, or is this a completely random sample?
It's completely random. So we do get people. And again, these are some of the analyses that we're doing. There's 2 groups we ask the question twice. And we ask, do you think you had COVID? And did you definitely have COVID? When we run the serology, and did you have a diagnostic test that proved you had COVID? When we run the serology on people who say we definitely had COVID, they're positive. Okay, so those people who said I had a positive test, they're positive. For those who think they had COVID, they're usually not positive. Most of the people who say I think I had a cold back in March, they didn't have COVID, or at least there are no antibodies. So there are a lot of people who think they were infected but weren't, but the ones who knew they were infected were seeing positive serologies.
And did you have any that were completely surprised that they tested positive and had no?
Yes, absolutely. The majority of our positives are people who did not know they were infected and didn't think they were infected and say, absolutely not, I was not infected. And so yes, we see those as well. There's definitely asymptomatic transmission, and there's definitely asymptomatic people with COVID.
Absolutely. We've heard so many stories of that. One of my sons was giving blood, and that's how he found out that he had antibodies, because they're now screening that. And one of my questions, both to you and to our county staff, is how do we then calculate those folks that are being tested separately through giving blood that they have, how do we factor that into the prevalence work that you're doing?
So that's a great question. CDC is looking at those. So the CDC has has several different strategies that they're looking at. One is looking at blood donors. And so they have a national picture of blood donors. And so you can look at Placer and compare it to where other blood donors are nationally. Blood donors are not representative of the population. One of the problems, all of these serosurveys have problems, but people who donate blood are probably like your son, who are really socially motivated, good, nice people. And they don't necessarily represent the span of the population and everybody who lives in it. But there are ways to compare those on a national level. There are also remnant sera, so people who go to the hospital and have serum left over. So CDC has a big study of remnant sera, which are sera that are just being discarded from laboratory studies in hospitals. Those are also not representative because they represent sick people. So they don't represent the general population. So there are lots of different strategies for getting surveys. None of them is perfect, but if you kind of look at them in totality, you can get a sense of where you stand and what the strategies moving forward should be.
Thank you. I appreciate that and the kind words for my son. I'm proud of him too.
We expected no less. Want to open it up to the public, noting, Dr. Parson, that you have a lecture in about 20 minutes. So is there anyone here that would like to comment or ask questions and or on Zoom? No one? Thank you. So we didn't finish up, I think, with supervisor reports, if there are any.
Oh, yeah.
Thank you again, Dr. Parson, tremendously.
Oh, it's a pleasure.
So are there any other supervisor reports? Jim.
Yes, I hope you can indulge me for a little bit on a little Placer County history. I'd like to welcome Supervisor Jones. Glad to have you here. Look forward to working with you. But the last time we had a Jones on the Placer County Board of Supervisors was in 1964. And it was Supervisor Will Jones. Will Jones was a chicken farmer out in what was then called the Rock Creek District, now North Auburn. You got Rock Creek School, Rock Creek Fire Department, Rock Creek Reservoir, many others that are there. And I remember him because when he was running for the Board of Supervisors, he came to our house. I was in high school then. It was my first introduction to county government. And he was running, his platform was the damn sewer plant that they were putting in North Auburn on Charter Road. And he was opposed to it. And so, but he got elected. Anyhow, he was a one-termer. But that was his issue. And I remember him very distinctly coming and talking to my dad about it. So he got elected. So I know what you're asking. What was his legacy? Well, you're sitting in it. He was the chair of the board when this building was built. This
So it's
facility.
his fault?
Huh?
It's his fault?
Well, he has to share part of the blame because Supervisor Gustafson, our friend Bill Briner, also served on the board. So
That's why you were asking.
yeah, that's why I was asking you this morning. He's still with us,
Yes.
Bill Briner. Now, I don't know if he has any regrets about this. Anyhow, I just wanted to give you a little update about former Supervisor Jones and the effect he had on Placer County and myself particularly. Thank you.
Thanks, Jim. Bonnie.
Well, thank you for the history. Do appreciate it. And actually, back in 1966, this was sort of a modern day building. It's
Oh, it
just
was
a little
a-
bit different 50 plus years
It's our
later.
Buckminster Fuller building. I've got another story about that, but for a later time.
But I just wanted to welcome Suzanne Jones to our board. We're pleased to have you. And there's a lot to learn, but know that you've got terrific colleagues who are always willing to provide input, feedback, direction, or you can just tell us to mind our own businesses. But we're pleased to have you join us. It is terrific to have two other females on the Board of Supervisors. This is the first time this
Little
board.
scary, actually.
Oh, it's a great thing. You should have seen the photo we took earlier. You know, sort of the Rosie the Riveter look. But it really is the first time this county has had three females on the Board of Supervisors. And I think, to me, what that represents is that this county is more concerned about who a person is versus what they might look like. And I think that that's so important, that it's about them electing people who represent what they believe in. And our job is to represent our constituents and to listen and to give the best feedback that we can and represent them the best we can. And gender doesn't matter, race doesn't matter, but it really is people who are willing to serve the residents in our community. And it is really a pleasure to serve with this board. I have really enjoyed the last 2 years because we all have this like-mindedness of really serving our community and doing what's best for our community. So with that, welcome, Suzanne. It's great to have you join us.
And let me just add to
Great,
that.
great comment.
I guess that's how I got elected, because I'm not much to look at.
I'm not going to touch that one. But we will, we finished public comment, correct? There was, yeah. I'm getting better. We're going to take up our 10 o'clock timed item, Health and Human Services, and Dr. Oldham is going to present our COVID update.
Great. Good morning, Chair Wygant and members of the board.
Good morning.
Rob Oldham here with HHS to provide your board with our monthly HHS COVID response update. This morning, I'll give an update on our COVID-related data and metrics, and then we'll hand off to Mike Romero, who will talk about the topic everyone seems to want to hear about, our COVID vaccine distribution efforts. And then finally, we'll end with Mandy Sharp, who leads our Human Services Division, our largest division in HHS, who will discuss the impacts of COVID on our Human Services Division and how we've responded. So can you please bring up the slides? And next slide, please. All right, this slide shows our testing positivity rate over time. The bad news is that our current testing positivity rate is the highest it's ever been and indicates that we still have widespread community transmission here in Placer County. The good news is that this number has not gone up dramatically in the last month, indicating that perhaps the spread of COVID in our community has begun to plateau, albeit still at a very high level. Next slide, please. Similarly, this slide shows that the level of hospitalizations due to COVID also seems to be plateauing, but again, at a very high level. It's important to note that increases in hospitalizations tend to lag behind increases in cases. So while we might see a post-holiday surge in cases in the next week or so, any post-holiday surge in hospitalizations would probably come later in January. Next slide, please. So there's been a lot of attention on ICU bed capacity lately. ICU bed capacity is a little less standardized as a metric than some of the other metrics. And so it's a little harder to track and to derive meaning from this metric. But what we do know is that our hospitals are often treating patients who are very sick in their general acute care beds now. Many of these patients probably would have been admitted to the ICU 6 months ago. They're now being treated in general acute care beds. So it's a little tough to make meaningful comparisons over time, but I think it's safe to say that our ICUs in particular and critical care capacity in general are stretched as much as they've ever been, with no immediate relief in sight. Next slide, please. Here's an even more somber slide that looks at the number of deaths due to COVID by month. As you can see, we saw 3 times as many deaths from COVID in December as in November, which was previously the month with the most deaths in this pandemic. And unfortunately, January is on track to have more deaths from COVID than December. Next slide, please. Before I hand off to Mike Romero to talk about vaccinations, I'd like to once again call attention to the truly heroic work of our healthcare workers in responding to this pandemic. Even before the pandemic, they were stretched very thin with historic shortages and levels of burnout. This pandemic has forced them to continually adjust and sacrifice. Many have now been at this for 10 months, often with long, physically and emotionally draining work days, and with very few days off. We just can't thank our healthcare workers enough. If you ask our healthcare workers how we can thank them, most don't care much about praise and kudos. They just ask us to prioritize them for vaccine and take simple steps to avoid overwhelming them with very sick patients. Mask up, wash your hands, keep your distance, and avoid gatherings as much as possible. Now I'd like to hand off to Mike Romero, who, like our healthcare workers, has been leading our COVID response, working nearly every day, including nights and weekends since February. Mike continues to keep his positive attitude and collaborative spirit despite constantly fielding questions and complaints. Many of those questions and complaints have been related to our vaccine distribution lately, which I know we talked about a couple of times back in December, but a lot has changed since then, so I appreciate Mike providing us an update. Mike.
Thanks, Rob. If we can have the slides again. And the next slide, please. So our vaccine campaign began in December. It's really the thing that those of us in public health have been waiting anxiously for, as well as the residents of our community. We're currently in phase 1A, and we're implementing all 3 tiers at this time. The tiers are described there on your screen. Remember that phase 1A is an employment-based phase, focusing primarily on healthcare providers and high-risk congregate settings, such as skilled nursing, long-term care, residential care facilities. We anticipate moving into phase 1B in the coming weeks. Next slide, please. So we are implementing phase A, and this is something I'm very proud of. This is how we're going to get the 4 hospitals, of course, the as well as Tahoe Forest Hospital District, since it serves Eastern Placer. They're vaccinating their workforce. In fact, some of you may have received some notifications from Sutter or Kaiser. They're starting to advertise a vaccine for their members or their patients over 75 years of age. So they're starting to move into phase 1B. In addition to the hospital systems, we're partnering with pharmacies, and CVS and Walgreens, they're vaccinating staff and residents at skilled nursing, assisted living, and residential care facilities. This started in late December and is going to continue into February of first and second doses. In addition, Chappaday, Indian Health, and Western Sierra Medical Clinic in Auburn, they're beginning to vaccinate their staff in some of the phase 1A groups. What I'm really excited to say is that today we have 8 Safeways administering vaccine, Safeways from Lincoln to Kings Beach, focusing again on phase 1A groups. And of course, we have our own vaccine clinic in South Placer run by Health and Human Services. And we'll continue to pursue and develop additional partnerships with healthcare providers, primary care providers, and additional pharmacies to increase the geographic availability of vaccine, utilizing the existing vaccine administration infrastructure. The pharmacy partnership gives us a much bigger spread than we can do by ourselves. Next slide, please. So to date, we've received over 14,000 first doses, most of which has gone to the hospitals. In fact, the hospitals are beginning to utilize their second doses now on their workforce. The partnership with Safeway, just to give a perspective, what's that going to do to our community? For our community, they're going to vaccinate about 2,400 residents per week. Our South Placer clinic location, we're on pace to vaccinate something over 3,000 persons per week. And we're going to continue to scale up our vaccine response in anticipation of receiving additional allocations of vaccine in the future. This scaling, it may include increasing the number of lanes, shifts, and locations over time. And with that, let's go back to Dr. Oldham. Thank you.
Great. Thanks again, Mike. And now I'd like to introduce Mandy Sharp, who will close us out. Again, Mandy leads our Human Services Division, our largest division in HHS. Mandy will discuss the impacts of COVID on our Human Services Division and how we've responded. Mandy.
Good morning. I am Mandy Sharp. I'm the Human Services Director in HHS, and I would like to say welcome to our new Board of Supervisors, Supervisor Jones, as well as the rest of the board. Thank you for the chance to share some pandemic service information and also a bit about who Human Services serves and where our programs fit in the array of programs within HHS, especially during this difficult year. We are the largest division, as mentioned. We have about 240 staff and 3 offices, and I'm going to go through some of our different program areas on this slide. Nearly 15% of all people in Placer County get help from one or more of our programs. In our Veterans Housing and Human Services programs, we serve thousands of people and service members who are vulnerable and need connection to programs that they're eligible to receive. During 2020, this meant providing services to many who never had needed our help in the past. Our programs and services help prevent people from falling into a crisis situation. Primarily, they are here to provide safety and stability with a hand up to return families and individuals to self-sufficiency so they can thrive as contributing citizens in the community. Our largest program area listed at the top right is Medi-Cal health coverage. 1 in 7 Placer residents are covered through Medi-Cal, 24,000 of whom are children. This year, pandemic coverage directives mean customers have maintained their coverage without discontinuance. Our Medi-Cal team during the pandemic year processed roughly 12,000 applications, while increasing our timeliness and accuracy rates to their highest point since the Affordable Care Act began. Moving to veterans, we provided 11,500 client contacts and helped secure $107 million in entitled benefits to veterans and their families. During this pandemic year, we saved veterans and their families more than $2 million in college fees and tuition. We have more accredited veteran reps in our VSO in this county than in any prior year. In our CalWorks program, we serve vulnerable families with children and provide a number of services. And we're happy and proud to report that participants secured 592 jobs with 378 employers through CalWorks programs. We've also helped local employers with more than $275,000 in wage supports during our pandemic year for hiring customers through our subsidized employment program. On the top of the slide on the left, you see the Housing Authority programs managing nearly 300 VASH, Mainstream, and Housing Choice vouchers. And with our partners at CEDRA and 211, launching a new emergency rental assistance eviction program, eviction prevention program, where we've seen our Housing Authority continue as a high-performing housing authority 11 years in a row. We've also provided CalFresh benefits, which are supplemental nutrition assistance through CalFresh, and Pandemic CalFresh, and funded CBOs and food banks as partners in the food safety net in Placer County. Across the board, Veterans Housing and Human Services application processing exceeds timeliness and accuracy standards even during this pandemic year. Next slide, please. Our lobbies and programs remained open with the VSO and Human Services staff serving more than 7,000 people in person during COVID months. Many of our call center and Business Advantage Network workers launched and staffed the COVID-19 call center. Thank you for recognition by our own Supervisor Jim Holmes, but also by the County Welfare Directors Association during an annual conference this year. We're proud that the skills of this talented call center and band staff were able to help provide comfort and answers, fielding more than 3,000 inquiries about COVID-19 before 211 went live. Those same call center workers typically take calls for human services as people call in asking for assistance or what they may be entitled or eligible to. That call center took an increased level of calls per worker during COVID months, amounting to approximately 110,000 calls. Next slide, please. So housing is one of our major supportive services. And most of our housing services assist people by preventing eviction or assisting low-income families retain stable housing or secure housing that they can afford, which is a little different than some of my partners in other HHS programs. Our tenant-based rental assistance, TBRA, has already helped more than 20 families, and it only started just in October with back rent and eviction prevention for people who lost income due to COVID-19. And we're hopeful that additional funding streams are coming soon to expand this program that supports both tenants and landlords. Our housing support in CalWorks was awarded additional funding in 2021 in anticipation of growing need. In 2020, we served 63 families with children and are on track to serve 25% more families in 2021. Next slide, please. My last slide highlights some of our food programs and services. During COVID, we have seen a major increase in the need for food and an increase in hunger and poverty. During COVID, we have seen application volume increases in single months of more than 100% of application rates over prior years, with an average of 24% increase in applications between the period of March and October. Many of those folks have never asked for help before. We serve roughly 15,000 people providing CalFresh benefits, and we've also created and managed with our staff working to help the pandemic relief with a temporary home-based meals program for delivering to at-risk seniors Our staff continue to manage the meals program for guests in the Project Room Key hotels, where we've delivered more than 50,000 meals to date to homebound, recovering, COVID positive, or at-risk individuals in partnership with local restaurants and the Salvation Army. Thank you again for the opportunity to share the work of our division during COVID months. We're happy and proud that we are essential workers serving the needs of the most vulnerable residents and those who have proudly served our country.
Great. Thanks so much, Mandy. Thanks so much for the work that you and your division are doing. So please pass along our thanks. And with that, I will open up to questions. Thanks.
First of all, thanks to all three of you for your presentation and your great work. Board members, Jim, do you have a question?
Yeah, first of all, I want to thank Dr. Oldham and Mandy and Michael Romero for the presentation. This has been an ongoing issue that we just keep dealing with. I've got the first phase, the first shot of the vaccine Friday after I waited when everybody else was done. The question is, once I am get my second vaccinated and I'm immune, am I still, can I still pass on the disease to someone else?
Yeah, great question, Supervisor Holmes. And yeah, so, and by the way, something that Mike didn't talk much about, but we're very proud of, is that we actually have not today had to waste a single vaccine. And so one of the things as we've been running our vaccination clinic in South Placer, and we're getting some experience with estimating exactly how many vaccines we have, and some of the vials have extra doses in them. So at the end of the day, occasionally we'll have an extra dose. So yeah, thanks Supervisor Holmes for touring through our facility and actually getting one of our leftover doses so we didn't have to waste it. Yeah, as far as the question of when the what the vaccine means for your ability to to pass COVID on, we just really don't know. For sure, we know that the vaccine decreases your likelihood of getting really sick. But as far as the vaccine preventing you from being infected at all, it's probably less likely. It probably has some benefit of that. But the studies really were designed at looking at the vaccine's efficacy for keeping people from getting really sick. And then the next step of does the vaccine prevent you from passing along? We think that it has some value at that, but again, it's not to be known. As we actually, the initial safety, the studies done by the drug companies and monitored through the Food and Drug Administration look at safety and efficacy. But as we get more data over the coming months, I think we'll better be able to answer those questions as far as what does the vaccine mean for the spread of disease. I think it's reasonable to assume that it provides some protection. I know from Dr. Parsonet's discussion, helping us move towards herd immunity, and maybe better than actually being infected. The vaccine might probably provides better protection and gets us closer to herd immunity than even being infected. But as far as to the extent that, as far as numbers on that, we still don't really know. And I'll turn over to Mike Romero to see if he has anything else to add on that.
Just to highlight, Rob, we know the vaccine will reduce mortality. We know that it will reduce morbidity in terms of illness, and the question mark is what degree will it impact transmission? And that part, we're going to have to wait for science to tell us what that answer is.
So I still have to practice the protocols and wash my hands and social distance, etc. Okay. All right. Well, I won't go running around just in case. Thanks.
Cindy.
I had a couple questions. First, going back to ICU, Dr. Oldham, and capacity. I've had a number of questions from the public that I have yet to be able to respond easily to, and that is, when you look at our chart of people in ICU in Placer County hospitals, we could say there's 32 beds occupied with both Placer County residents and someone else on, say, January 8th, and we were at 12.2% ICU capacity. And then if you go back a month, we had 32 beds occupied in ICU, and we were at 23.8%. ICU capacity. And it's very confusing to the public when they're tracking those numbers. Can you go through that one more time so I can hopefully try to explain it to public that are watching that very carefully?
Yeah, well, I'll try to. But I mentioned before, it's not, the ICU bed capacity is a new metric for us, and it's not really very standardized. I think with time, we're getting better at all kind of comparing apples to apples on this one. And you mentioned the differences between now and a month ago. I think one of the things that drives this, it is confusing, but one of the things that makes it confusing is the distinction between available beds and staffed beds. And so really staffing is the issue. And so the denominator on that ratio changes frequently. So the number of staffed ICU beds we have at any one time really can vary from day to day and even from shift to shift. And so it is challenging to make sense of some of those numbers. And I think that's the idea of trying to regionalize this. Maybe there's less variation from hospital to hospital and county to county when we have a larger group but there's still some variation that's difficult to explain.
Right.
But Mike, anything else you'd say on that? Sorry.
I would just say that we're very fortunate. Our hospitals have been very good at reporting that to us. It's an extra step that they do every morning. They've got to figure out how many beds, not just ICU, but the total beds. And reporting to that it sounds really simple. It's just not. And so the numbers that I send out daily, they're always a point in time. So they may change throughout the day. So I really appreciate our colleagues who go the extra mile, and they've been giving us this data really for a long time, right? So we recognize it's an extra effort. We think it's worth it to stay informed, and hopefully there's some value for them as well. But it's an additional ask of healthcare when they have got too much to do as it is.
Yeah, and the other thing, before we take another question, I'll just add, and I mentioned before, is this distinction of critical care beds versus ICU beds. And so I think what we're seeing is the hospitals are flexing more and providing more critical care in kind of standard beds than they have in the past. So that also makes it difficult to kind of tell what's going on that ICU bed metric. It's a lot more critical care. A lot sicker patients are being taken care of. Patients who previously probably would have gone to the ICU are being taken care of on a general acute care bed.
Well, thank you. I appreciate our healthcare providers providing that information. I do think that the public who are anxiously awaiting to be able to open their businesses and provide a living for their families are watching those numbers and wanting to believe there's hope. And then when they fluctuate so much with the same number, but just varying percentages, it's hard for them to feel confident in what's happening. And I know that's not either of your responsibilities. It's just, in providing all this data, which we're doing a great job, it confuses the public, and they're wanting their kids back in school. They want to see us out of this regional closing and moving forward. And then I do have a number of questions on the vaccine. I heard on the news this morning, and I believe it said that California was the slowest state in the union at getting the vaccine out. If not the slowest, one of the slowest. And of course, my inbox and voicemail is inundated with people wanting that wanting that vaccine, not wanting that virus as soon as possible. And so, I stand, and I know my colleagues feel the same way I do. We want to get this out as quickly as possible. We want to provide you the resources and all the options that we can use, whether, and I know you're doing that. I want to hear about that. I also wanted to ask specifically, the public wants to know how they best find out. And when it says it's coming in a couple of weeks, they're not taking that answer lightly. I mean, they want to know more specifics, and they want to make sure that where they are, or we know where they are, and that they can opt in. And I happened to watch 60 Minutes Sunday night. I think it was 60 Minutes, where they were showing an elderly woman in Florida trying to navigate how to get a vaccine and get an appointment from somebody who's not really computer literate and really couldn't. and was having her son help her through it. And it was, you could see the frustration and the anxiety caused by people not knowing when and how to get that vaccine. So if you could speak to what our public outreach plan is and how people can ensure they're notified and have the most up-to-date data so that we can educate them, I'd appreciate it. And then we can talk more about what other ways we can support you in getting this vaccine distributed as soon as we have it.
Great. Yeah, I'll start, and then I think I want to hear from Mike. First, the question of California relative to the other states, and so I think I've talked before. I have family back on the East Coast, including a mother who's over 80 and still hasn't been vaccinated yet. Has been in line many times, and so I think we're seeing some different approaches in different states. Some that's a little bit more chaotic. Right now, all of our appointments, again, Mike has said, right now it's primarily focused on employment-based, and so we've been doing outreach specifically to employers and point of contacts. All of our appointments have been scheduled, so they're appointments, and to avoid kind of the mad rush, the lines, and then having people standing in line and not getting vaccinated. And then also, again, to reiterate, the vaccine handling is really complicated, more complicated than for flu shots, especially for the Pfizer vaccine. And so it's important that we not waste vaccine as well. So we have an organized response. The other thing that's slowed things, I mean, lots of things have slowed it down. Probably the biggest has been the federal partnership with pharmacies to vaccinate our skilled nursing facilities. And so that was delayed by a couple of weeks. And initially, the belief was that we had to finish tier 1 of 1A, which would be the hospitals and long-term care facilities and a few other very high-risk groups before moving on to tier 2 and 3. So as soon as the state sort of said we could move on, we did. And we continue to vaccinate tier 1, but also all the tiers 2 and 3. So how we've been notifying people for the employment base is going to be different than as we move to other kind of age-based and other demographic-based. We'll be doing more public messaging. We've already started with public messaging for healthcare workers. So initially we were reaching out through employers. We recognize that there's probably, there are independent healthcare workers who for whom we don't have employer contact information. So you've probably seen some of our social media and others, even starting to do other media. So what you'll see, expect to have more of that as we get to other groups, particularly the big one is going to be adults, 75 and older, and then 65 and older, and we'll be using a lot more public messaging for that. So Mike, anything else you'd like to add there?
I was just doing the math and thinking about, what's going on today. So today we've got 17 locations giving vaccine out, and it roughly, and that's interesting, right? But again, as targeted vaccine isn't seen very well by the general public, right? I think the employer-based strategy is a pretty good one. We've reached out to known contacts, we've developed new contacts. I think all of us are getting bombarded with the requests about, hey, what about me? You haven't reached me. It's hard to reach everyone, working with the different societies who manage such lists. So, we're not at 100%, but with each day, the word sort of spreads. And Rob mentioned the scheduling. So the scheduling is really important to me. Public health knows how to run vaccine clinics. Flu clinics is one thing. Back to school vaccine is the biggest challenge when you've got 8 different vaccines at a clinic. So we've learned our lesson about the value of schedules. But to your point about, what about those who are struggling with, and who will struggle once we start promoting it on our website, specifically for the 75-year and older, who may not browse our web very often. To be honest with you, I was just texting with Mary George in the libraries and said, Mary, what do you think? And Mary has texted me back saying, we're all in. So I can imagine a partnership with our library system where we promote to those 75 and older, saying, hey, if you struggling to make the appointment, contact a loved one, say, hey, help me with this. But also our libraries will be a wonderful location to help people sign up. Again, the campaign for the general population will be those over 75. And then at some point, it'll open up to those over 65. So we utilize all of our typical tools. We're very fortunate to have a very strong public information team between our website, social media, press releases, and existing partnerships, thinking about the equity work we're doing with Latino Leadership Council, the Sierra Community House, support from the Placer Community Foundation will help get the word out and provide resources so people have some assistance in making a schedule. I'm hoping we can keep them scheduled as possible. Those national images of long lines, to some degree, they're unnecessary because, and Rob and I both done this before, where we've done a clinic and had to tell half the people in line to just go home, right? So we want to avoid that. And as vaccine handlers, we need to have a sort of a predictable amount of vaccine. The other challenge I'll mention is, we receive an email once a week from the state indicating what our allocation is going to be. And from the chart we saw earlier, you see how much it varies. Last week we were allocated 100 doses. So it's hard to plan from week to week what you're going to administer, not knowing exactly what you're going to have. That delay isn't going to last forever, right? More vaccine will be available, more pharmaceutical companies will get their vaccine approved, and I believe there'll be more vaccine, and we'll have sort of an additional challenge. To meet that challenge, I mentioned existing vaccine administration sites. So this is why we like the pharmacy model so much. Safeway has been a phenomenal partner. In fact, Placer is the first county in their northern division to partner. 8 sites. Well, we're negotiating with Walmart as well. Walmart told me they have 7 sites where there are Walmart pharmacies in Placer. So imagine once we get that going, we can get quite a bit done on any given day. And so that's the way I see it: increasing number of partnerships, increasing geographic opportunity, and then adjusting as we have opportunity to get more vaccine.
Yeah, and I'll just the final answer for the question, because I think that, around communication and what can people do to sort of get their information available. Monitoring our website, and we have all the as far as where we are on the tiers there at it's placer.ca.gov/coronavirus/vaccine. But also, as Mike says, I think more and more, especially as we move into the 1B and subsequent tiers, we're going to be relying upon these partnerships on healthcare providers and pharmacies. And so for people to make sure that their provider has their most up-to-date contact information so that when the time comes, I think that's more the strategy that we're going to see as time goes on, a sustainable response where most of the vaccine is actually going to be administered through people who usually administer vaccines and not these kind of mass vaccination clinics. For now, they're a part of the equation, but the more we push out, right now, our biggest limitation is our vaccine allocation from week to week. And so the more we distribute through mass vaccination clinics is less we have for partners. And I think the partners really want the reliability of knowing how much vaccine, because, nobody wants to have a clinic and then have to cancel it, and build up expectations and then not have the vaccine available.
Absolutely. Well, I appreciate it. I know how hard you are all working. On the 17 locations, Mike, what number of vaccines have they been able to provide?
Yeah, so off the top of my head, I don't have the answer for all of them. Again, I'll give you just an idea of what can Safeway, a single Safeway store will do 60 doses in a day. Looking at the allocation that we kept for ourselves to administer at our South Placer location, by Friday, we will have administered 92%. Again, if everything is scheduled as planned, we'll have utilized 92% of our first dose allocation.
Well, I appreciate the great progress we're making in the partnerships we're building, but as you can see, unfortunately, I'm in an age group that's a little ways out, but we're talking months, years to vaccination if we don't expedite this. So is there anything we can do as the Board of Supervisors to help you with the state to get more allocations, 100. And I see they're sitting on 1.4 million according to the chart today. I mean, if we're ready and able and have these partnerships, let's get this out. And what can we do to help at the state level?
Yeah, and I think the good news is that was the 100 was just a 1 week, and I think lots of people were in that boat. But looking at our allocations, and we'll know later this week, but I think we're expecting those to go up pretty dramatically, kind of scaling up. So again, initially almost you look at those Pfizer doses; those were all to our hospitals, and so I think anticipate that our Moderna allocations will likely go up. But also we'll be able to start utilizing some of the Pfizer as well. So before those were going directly from the state to our hospitals, the multi-county entities, or what they're called in vaccine distribution. But that was to vaccinate their healthcare workers, their staff, hospital-based healthcare workers. So going forward, I think those Pfizer vaccines, we now have cold storage capability with the county, I think, and so we'll see. I think we'll see the numbers go up. But we appreciate, and I know we have our lobbyists joining next. That if we need help, we know we can get some additional support in making sure we get more vaccine. Particularly, I think developing these partnerships. We'll be able to. We're talking about maybe 5,000 doses a week right now, but quickly scale up to much higher than that, because you're right, at 5,000 doses a week, that's a long time before we reach herd immunity. But I do think as we spread the vaccine allocations out to lots of different healthcare providers, not only does it provide us more geographic, and the other is just from an equity perspective, making sure that all of Placer County has an opportunity to be vaccinated. And so it's going to help for lots of different things, including just having a sustainable response. So that would be the ideal, is to get to 10, 15,000 doses per week on a sustainable basis.
Okay, and one final question. I'm sorry to have asked so many, but has there been any evidence of the new strain in Placer County?
No, I don't think so. Mike, you can confirm. Yeah, no, we've heard some talk about other counties, but nothing so far from Placer County.
Great. Well, thanks to you and your team. I wanted to echo the other supervisors in thanking you for the tremendous work since last February, March, when we entered this. And Mandy, I'm sorry I didn't have any questions for you, but keep up. Your team is doing tremendous work as well. Thank you.
Great, thank you.
Thanks, you guys. Maybe to Cindy's point, something that might be useful to the board is if periodically you could start getting us the number of people in Placer County vaccinated. And that would give us a good gut feel as to how that's going forward, and we can share that also.
Yeah, and I'll just say on that, because we thought about creating a dashboard. The visibility into most of the vaccine, again, has been allocated to the hospitals and to the pharmacy chains to vaccinate skilled nursing facilities. And so we're trying working with the state, all the counties in the same boat, to get more visibility so we can get that real time data that people crave. Right? They like that. I know with the confirmed positive, same thing. Like, people really like to go to the website and see that. We just aren't able to do that yet for vaccines. We can provide that for the county administered. So that's something that we can begin sharing. But that's the goal, and hopefully I'm hearing from state, we'll be able to get the data more. So I think people want to see the transparency of where the vaccine is going.
Yeah, great. Okay, so now we'll open it up to the public.
Jeffrey, go ahead and give your comments for the record.
Yes, good morning, Chair, and welcome, Supervisor Jones. This is Jeffrey Hentz with the North Lake Towers Road Association. First and foremost, appreciate the outstanding work and communication Dr. Oldham and his entire team has been providing our community throughout the pandemic. And I also want to recognize them both Dr. Oldham and Michael Romero, for taking the time to join our many virtual meetings that we have up here in North Lake Tahoe, and for them participating. I just wanted to bring up one important point on behalf of our North Lake Tahoe business region that has been adversely impacted by the December 11th stay-at-home order. If there would be any probabilities, projections of when that could be lifted, knowing that we still do not have any certainty. And we certainly would like to share that with our businesses as they are all anxious to understand when that potential opening will happen from the stay-at-home. Now, that is it. Thank you very much for your time and fantastic support.
Lisa Larkin, go ahead and unmute your mic and give your comments.
Yes, hi, Lisa Larkin. First, I want to say that your instructions for speaking are inconsistent on your website. On the main page of the Board of Supervisors, where it talks about the meetings, it says to call by 8 a.m., but on the agenda, it says to call by 8:30 to get on the callback list. I did call at 8:09 this morning based on that agenda and was not given an opportunity to speak due to it. So I want to address that with you. First, I'd like to point out the complete disregard for the health and safety for fellow supervisors, staff, and others in the room. I watch all of you not wearing masks or taking them off to speak. When you take them off to speak is when you're more likely to spew your droplets into the room for others to become infected. We can hear you speak when you have a mask on. So I ask you to please set an example. I'd like to reiterate some points from Dr. Parsonet. 2% in the study. Though that's not the result I know you were hoping for herd immunity here in Placer County. Somehow we are above and beyond being infected. Above 80 to 90% is needed for herd immunity. That means we have not yet begun to see the hospitals overflowing or the number of deaths that are going to occur here. That means that everyone in this community is at risk of not only becoming infected, but those people will become spreaders, which will kill other people in the community that they infect. It was commented that if everyone in the community becomes infected, that's 3.5 million people will die. And in Placer County, I'm just guessing based on the 2019 population, that's 24,000 people. As was also said, this is not the flu. 6 to 7 times higher death rates than the flu. So this does look a lot like the Spanish flu if we don't get a handle on it. The question was also made about people being surprised that they had been infected. And Dr. Parsonet said, yes, they were all surprised that they were infected. This shows the importance of wearing masks. Again, asymptomatic spreaders, spreading it to other people in the community who then spread it to other people in the community who then people die from it. Again, why aren't you wearing masks? Let me just remind you that in 9/11, that killed almost 3,000 people in one day. There was a huge, huge concern and roar. People came together, right, at that event because so many people died. We're now losing more than that every single day. A 9/11 every single day. Where is your sense of urgency? Why aren't you cracking down on the businesses not following safety precautions? Why are you not demonstrating by example wearing masks? I watched Supervisor Gore get up from her seat and change seats earlier with Supervisor Wygant that was sitting and spewing droplets all over his desk because he was not wearing a mask, where you are now sitting with no disinfection process.
I'm sorry, could you please wrap up your comments? Your 3 minutes are up.
Absolutely, but since I didn't get to speak earlier, I'm a little frustrated. You may or may not die if you get infected, but if you do get infected and are asymptomatic spreader, you may very well and likely spread it to others in the community. I would think you would care more about that. Thank you.
Thank you for your comment.
Kathleen Crawford, please go ahead and unmute your mic and give your comments.
Good morning, Board of Supervisors. Thank you very much for the presentations that we've heard from staff, and a welcome to Supervisor Jones. My concern today is that there is another super spreader event scheduled for January 22nd to 24th in Placer County, and that is at Courtside Basketball Arena, where they are again holding a large basketball tournament that will be bringing people from outside our county into our county, and then having lots of sports activity, obviously over a 2.5-day period, with prizes and all kinds of incentives for participation. And apparently, we're just going to look the other way. This bothers me tremendously. There is no excuse at this point in time for coddling people who refuse to follow the public health guidelines. I would recommend that both Rockland Police and the Placer County Sheriff post several squad cars in that parking lot, and every 5 or 10 minutes make a bullhorn announcement that this is an unlawful assembly, that they are not abiding by public health guidelines, and that they should return home. And let's keep that up for 2.5 days and try to shame some of these people into understanding that this is a contributing factor to our increased infection rate and our increased death rate. And it will prevent businesses from reopening. This is the reality. As a senior citizen with a certain amount of disposable income, which I am not spending in our local businesses because too many of them are not abiding by the guidelines. So this economy will not recover until there is confidence in the safety and public health in our communities. So I please ask you to drop your previous hands-off stance and to start enforcing these guidelines before this problem becomes even more difficult and more dangerous to our community. Thank you very much.
Thank you for your comments.
Hans, go ahead and unmute your mic and give your comments.
Is it unmuted now? Yeah. Hans Geyer in Loomis. I would like to start with the same complaint about giving the public access to comment. I tried to do it via Zoom. Supervisor Weigand said, I'm now opening it for the public. I pressed raise. I was never called after Mrs. Parsonet's presentation. So something has to happen to give the public a better opportunity. My comment is a bit going back to the presentation from Mrs. Parsonet, and then leading into the current situation. We have wasted $250,000 on the study that Mrs. Parsonet now told us is what was pointed out by numerous contributors in the main meeting. The infection rate is extremely low. We will never get to herd immunity. Supervisors were spreading ideas and about 20 to 25% herd immunity rates, which was not supported by anything. It seems we continue to do exactly the same thing now. We are not taking anything serious. We should have used the $250,000 to communicate to businesses how important it is to get safe for everybody. Otherwise, we won't spend the money. And I do not get the impression that the board is taking anything serious. And I can only laugh about Supervisor Holmes's comment that he was by accident in a vaccination site and they had a vaccine over. Is this a recommendation that all of us should by accident drop into vaccination sites and hope they have a few doses over? This is not leading by example. This is not the role models that we would need from the Board of Supervisors. You guys have to change or you should resign. Thank you.
Thank you for your comments.
No further public comment.
Okay. Thank you very much. We will now move on to.
I just want to let the caller know that I waited there for a good hour and I didn't get the vaccination until everybody else got their vaccination. And as Dr. Oldham said, there are always 2 or 3 left over, and that's why I was able to get the vaccination. Otherwise, that vaccination would not have been able to have destroyed it. So I wasn't accidentally there. I was there ahead of time, and I waited for a good hour until everybody else got their shot.
We will now move on to our 10:30 timed item, which is update from our legislative advocates. For the public, we have both folks with the state and with the federal advocacy group, and I get the opportunity to wish Rich Gold a happy birthday, which is, I understand, tomorrow. So Rich and I has always referred to me as the old man, so I guess I'm a little bit older than Rich, but we met over 20 years ago, so I'm thinking we both were extremely high achievers. So you're what, Rich, 38, 39 years old now?
Hi, can't.
Exactly, Supervisor, and you'll be happy to know that it is also Big Bird's birthday tomorrow.
Big Bird.
Excellent. So with that, I will turn it over to Joel Joyce, who will put us back on track.
Good morning, Chair, members of your board, Todd, Karen. My name is Joel Joyce with the County Executive Office. I am joined today by Rich Gold and Michael Galano of Holland and Knight, our advocacy firm in Washington, D.C., as well as Paul Yoder and Karen Lang with SYASL Partners, our advocacy firm in Sacramento, to provide an update to your board. Before that, I do want to say the draft legislative platform before your board today serves as the basis for the county's advocacy efforts with the executive and legislative branches of state and federal government to sponsor, support, or oppose legislation, address policy, rules, laws, and regulations, as well as defend county local authority and resources. Placer County, working with our contracted advocates as well as our state member associations, have been very successful over the years in advancing the county's priorities and protecting our ability to have local control over our own governance and land use decisions. With the COVID-19 pandemic over the past year, the state legislature was severely limited in the number of bills it could vote on due to mitigation measures put in place, as well as laws governing the timelines of legislative activity. On the federal side, the pandemic shifted focus from what would be the normal order of business to address various issues that the pandemic caused. Due to this, staff believes that 2021 will be an overly active year in Congress and the state legislature. The main topics staff will focus on includes forest management, fire mitigation efforts, affordable housing, homelessness, transportation, and associated infrastructure. The legislative platform is approved at the beginning of each year and is a culmination of hard work by much of the county staff and department heads that begins in the fall of the prior year. The platform is intended to be a living document as it is not always possible to anticipate additional legislative, regulatory, and/or budgetary issues that may arise further into the legislative session. Thus, the board may review and modify this document during the legislative session as necessary. The platform also provides general direction to the county executive office, county departments, legislative advocates, and our state and federal delegations members, and the public on positions of support or opposition to key policy initiatives which impact the way county does business. Staff will continue to include any formal positions the county takes on legislation, regulations, rules, etc. on our website, and will also periodically update the specific pieces of legislation the county is following throughout the legislative session. With that, I first want to turn it over to Rich Gold and Michael Galano to provide you a federal update.
Thanks very much. I appreciate it, Joel. And if it pleases your board, thank you for letting us appear before you today. We greatly appreciate our ability to work with you on your Washington priorities and see improvements to Placer County from the work we do out here in terms of federal funding and regulations and the conservation plan, et cetera. I'm going to just open up with a general overview. As you know, it's already been quite an unusual year in Washington. Capitol Hill staff, members of Congress, and senators are kind of grappling with what happened last week with the March on the Capitol and storming of the Capitol building. That's an ongoing investigation and discussion ranging from the protesters themselves on up to the Capitol Police and reportedly several members of Congress as well. So that's going to be going on for a little bit. Obviously, in addition, as has been reported in the news, the House is scheduled to move forward on a single article of impeachment of the president tomorrow. The Senate is expected to take up that article as early as next week in a trial. The precedent of this will be the first time a president is tried after leaving office, but the Constitution does allow for that. The Senate has a number of different alternatives, including censure of the president, sort of moving forward from there. More importantly, sort of as things sort of move into transition, the House and the Senate really are going to be focusing on organization. And obviously we have a transition in the Senate to a Democratic majority, probably on January 22nd, with Senator Schumer taking over the gavel from current Majority Leader McConnell on the Republican side. The first order of business will be to process President-elect Biden's nominees for Treasury and Defense and the other national security agencies. In the Trump administration, half a dozen cabinet nominees were all confirmed within the first 2 weeks. So you can expect that, that will be sort of the main focus of business. And because the Senate is going to be a 50-50 split, we are going to be organizing in a very bipartisan way. The committees will split evenly with the same number of members on each committee. That is likely to produce, as you would expect in that situation, a situation where in order to vote something out of committee, it will need true, strong bipartisan support. In addition, the House has the narrowest margin we've had since about World War II, with about eight more Democratic members than Republican members. And so the House is actually expected, if we can kind of move past the events of last week at some point, to be more bipartisan as well. So it will be somewhat ironic, given everything that sort of happened over the last few weeks, to end up in a situation where we might actually have the prospect for bipartisan efforts on a range of issues. Obviously, virus response, vaccine distribution, contract tracing, and other issues. And we expect to see more funding coming to state and local governments for all of those issues, as well as COVID response. In addition, the president-elect has promised a major stimulus bill, his Build Back Better plan, which may, at this point, given the Senate majority, include a price on carbon similar to what you have in California, and other mechanisms for raising revenue going forward. And then finally, sort of the other 100-day item, if you will, is bucking up the Affordable Care Act, which has been weakened over the last few years, given the 12 to 15 million new formerly insured through their employer workers who no longer have that insurance because they are no longer employed. So those are really going to be the first 100-day items. Mike's got a few things to talk about that are more on the Placer specific agenda, and then obviously we can take questions.
Thanks, Rich.
Thanks, Rich. Joel asked us to touch on a few specific items of interest to the county. The potential for additional federal COVID relief, potential sources of funding for a body-worn camera program, obviously forest management and fire mitigation, the outlook for federal infrastructure funding, and just in general, what local governments should expect during the Biden administration. So as to additional COVID relief, you recall the CARES Act, which was passed at the end of March, contained directed funding for state and local governments. I believe Placer County was scheduled to receive about $40 million of that CARES Act funding, and I know that's working its way down through the governor's office. The COVID package that passed in December a few weeks ago did not contain another round of targeted funding for local governments, but it is expected that the next package, which the president-elect is expected to unveil on Thursday, will contain another round of targeted funding for state and local authorities. It's expected that his proposal on Thursday will closely mirror the HEROES Act, the $3.4 trillion HEROES Act that the House passed in May, and will likely include a bump to $2,000 for individual benefits, additional funding for vaccine distribution and school reopening, rental relief, aid to small businesses, and many other items. That will be his opening offer. Obviously, the Congress has the power of the purse, and it's up to them to consider that proposal. But the most recent bill that passed in December, for the most part, expires in March. So there is the expectation that Congress will act before the end of March to provide the country with additional stimulus funding and extend some of the expiring deadlines. So that's COVID. In terms of body-worn camera funding, there is existing programs at the Department of Justice through the Bureau of Justice Assistance to fund body-worn camera programs. Currently, they are limited to purchase of just the camera themselves. You cannot pay for the storage for the data, which is usually the more expensive piece. And the current program has a one-to-one match in terms of local cost contribution. We expect that opportunity to open up again in the springtime, and we will get that to staff to consider as a potential source of funding for you all. But obviously, given the events over the summer with law enforcement and the incoming Biden administration, it's likely that that program will be plussed up and made more robust. So we will keep the county apprised of any changes to the existing program as we move forward. On forest management and fire mitigation, obviously there's probably no issue more important to Placer County than forest management and fire prevention. To try and combat that issue, we've been working with staff. We're in the early stages of examining the potential for a strategy to streamline funding and permitting for forest management, somewhat along the lines as what you all have been able to accomplish under PCCP. We thought that's a good model, and we are evaluating options to do something similar on forest management. Obviously, with the change in administrations, there will be a change in philosophy for forest management versus under the Trump administration. We anticipate the Biden administration will have a more of a focus on climate change and the role that plays in wildfire. And obviously, coming from California, we would expect the Vice President-elect Harris to be the thought leader in the administration on wildfire. The last time I checked, there were not a lot of wildfires in Delaware. So I expect the administration would lean on her for her thoughts. So one thing we're doing to get smart on that is now Senator Harris does have one of three proposals in the Senate on wildfire. It has a focus on the role that expansion of residential communities into natural areas has on wildfire, and the role of climate change on wildfire. So we are reviewing that proposal so we can continue to have a conversation with her staff next year on her views and the administration's views on wildfire. There are two other proposals on wildfire that we are reviewing. Senator Feinstein, your senior senator, has a leading proposal in the Senate. It is bipartisan and received a hearing in September in the Senate Energy and Natural Resources Committee, and the county did deliver a support letter for that legislation. In addition, Senator Romney has his own proposal, which we are evaluating for best practices as well. And then, as Rich noted, the confirmation process for the cabinet secretaries will begin, starting in February. We'd expect the Secretary of Interior nominee and the Forest Service nominee will be further towards the back end of the process, but they will those hearings will provide an opportunity to ask questions on issues of importance to the county, and we will work with staff to make sure questions are submitted both for the record and for in-person confirmation hearings. Next, the outlook for infrastructure. Obviously, the existing infrastructure programs at the federal level will continue going forward. You know, for example, the DOT build program for roads and bridges, and the infra program for freight-related funding projects will also be available starting in the spring. On water and sewer, the EPA WIFIA program, the Water Innovation Financing Act, which is a low-interest loan program, will also continue. And then on top of that, on top of the regular annual grant programs, the Biden campaign over the summer released a $2 trillion infrastructure investment package with a focus really across the board from roads and bridges to ports and airports, electric grids, broadband, even school and affordable housing. So very ambitious proposal, as is the case in DC. How to pay for it has been the stumbling block, but we will have to wait and see. We'd expect the infrastructure proposal may be pushed further down the queue given the COVID crisis, but the current transportation reauthorization law expires in September, so it is expected that that will be seen as a potential vehicle for a broader federal infrastructure package. So we will continue to work with staff to identify opportunities as that proceeds. And then lastly, you know, what can we expect as a local government from the Biden administration? You know, on the campaign, he had a very ambitious domestic policy agenda, from healthcare to the economy to housing. He really proposed a more robust federal role in the priorities and operations of local governments. But again, you know, any legislation that he proposes will have to make it through the Congress. So it's there are no guarantees his agenda will move forward. But really, if you look at what he has proposed, there's three major themes that jump out. You know, one is the increased federal spending on health, education, and social care programs. He pledged to invest $775 billion over the next decade on child care, housing, and free public college. That's obviously going to require a funding vehicle from Congress. The second theme in his platform is obviously a massive commitment to combating climate change. And a big component of that is going to be that $2 trillion infrastructure package that I mentioned earlier that will support the use of clean energy in power, transportation, and building. Again, that's going to require cooperation with Congress. And then the third theme is a concentrated federal effort to combat racial and social inequality. You know, one of the proposals potentially could be like a department for like DOJ could take a more active role in the oversight of local policing and prosecution. In addition, some federal infrastructure funds may be contingent on the enforcement of fair housing policies, and access to infrastructure funding could be contingent on being carbon neutral. So those were really the main three themes coming out of the campaign. Not very granular at this point, given that control of the Senate was just achieved less than a week ago. No specific details, but we will work with staff as those are unveiled to make sure the county's voice is heard and you're able to compete for infrastructure funding in 2021 and beyond. So that's the end of my prepared remarks. We appreciate the chance to appear before you, and we're happy to answer any questions. Thank you.
Thanks, Mike. Do we want to have questions regarding our federal platform now, or wait till the very end, or does anybody have any questions at this point? I see no questions at this point. So Joel?
Oh, yeah. We'll turn it over to Paul and Karen with SYASL Partners.
Hi, thank you. Good afternoon, supervisors. I'm Karen Lang with Shaw Yoder, Antwi, Schnalzer, and Lang. I wanted to welcome our new supervisor to the board. It's a delight to have you. I'll start off with just a as quick as it can be, a review of the governor's proposed budget that he released on Friday. If you could imagine, it was over a 2-hour-long press conference, and from front to back, including charts, the summary of the budget is 380 pages. So we were in a flat-out sprint on Friday to get you everything you needed as quickly as possible as far as what was in the budget. Notably, we're a lot better off than we thought we were going to be, and it is entirely attributable to a couple key things going on in California. Our capital gains taxes that came into the state general fund exceeded any other point in history where the stock market was doing very well. I believe the number is 17 billion, almost $18 billion in unanticipated capital gains taxes going into the state general fund, which, if I understood the way it was characterized, is actually about 10% of the total amount of capital gains that was realized is about 10% of the state's general fund, which is not going to occur again, I don't think, anytime very soon. But it will give you context as to why you're going to hear about how the state has more money than we thought, but there are still out-year deficits, and it's because of these one-time events, like very specifically Airbnb and DoorDash having their IPOs in 2020, and what that does to the state's general fund based on how we tax people in the state. So it was good news. More money is better than less. The state is making some very bold investments, or proposing to. The governor's proposing to, and notably for Placer County, a very robust package on wildfire prevention, tree thinning, reduction in tree mortality, tree diseases, things that threaten your communities, from one side of the county to the other. Some of your staff were involved in some of the initial review of those things before they were daylighted, so we were hoping to see that actually be included in the budget, and it was. So our next steps there will be to engage through the budget process and continue to coordinate with with CEDRA, your department there, to continue to advance Placer's interest in that funding. There's less expenditures in certain places because people aren't showing up in the emergency room, so there's a reduction in the cost of some of the healthcare related programs that the state has. There is additional money once again for child support, which was a positive bit of news because it was definitely scheduled for a reduction in the trigger ups budget that we had last year. And I think I'll hand it over to Paul at that point. It's just, there's going to be a lot of work coming up in the next couple of months as we wade through the budget negotiations, and there are some near-term actions that Paul is going to cover for you. So I'll hand it off to Paul and then wait for questions if you have them.
Yeah. Thank you, Karen. Good morning, board members, staff, members of the public, Supervisor Jones. I also welcome you to the board. Look forward to meeting you in person, hopefully someday soon. So since we are in the beginning of the next 2-year legislative cycle, typically we wouldn't expect a lot of action in the first month of the first year of a 2-year cycle. Generally, the governor, whoever that is, releases their proposed budget, as Governor Newsom did on Friday, as Karen discussed. And then it's really just sort of chopping that up more and more and more and more, getting ready for budget subcommittee hearings and bill introductions. However, because of COVID, almost exclusively, we do think we're going to see some legislative action possibly by the end of the month. We already expected, because the eviction moratorium that was put in place by Assembly Bill 3088 by Assembly Member Chu, because that is due to expire on January 31st, and in talking to legislators, hearing them express an interest in extending that and extending it all the way through calendar year 2021, and probably using Assembly Bill 15 to do that, we were already aware that there was legislative interest even prior to the holidays in coming in and getting something done, at least on that in January. But lo and behold, on Friday, when the governor released his budget proposal, not only did he concur with that sentiment, he noted that because of the most recent federal assistance package, that there is a sizable amount of money coming from the federal government, not just for renter assistance, but potentially for landlord assistance, which is obviously also very, very important. And the number there that we're expected to receive is somewhere around $2.6 billion. Getting that money from the federal government is incredibly important, again, just because if landlords are going to be expected to, I'll say, hang in there even longer, keep renters in buildings, in apartments, in houses without them paying rent. There's just been discussion for a long time now in Sacramento about how to somehow provide relief to landlords as well as tenants. And so that, again, that new federal money coming to California is going to be very, very helpful in that regard. And so we do think that there is a high likelihood of seeing the appropriation of those funds with the extension of the moratorium and having that occur. I think if nothing else happens by the end of January, we do expect those things to occur. However, the governor went even further and proposed about $5 billion in spending. Now, about half of that would be that federal assistance for renters and landlords. But the governor also wants to appropriate $2 billion, wants the legislature to appropriate $2 billion to try and get public schools open and sooner, and including in-person instruction in California, and $2 billion towards that. In addition, there is good news, I think, for counties such as yourself, businesses locally. The governor's proposing that the legislature appropriate close to $600 million in small business and not-for-profit relief. That would be in addition to the $500 million that went out prior towards the end of the last calendar year. So, like I said, the governor's calling for $5 billion in more immediate spending. Now, we've already had one budget committee in the legislature, the Assembly Budget Committee, meet yesterday. And it was interesting in that members of that committee actually expressed some reservations about certain elements of the governor's proposal to spend that $5 billion sooner than later. Similarly, we've had our first 4 sessions of the year, and during those 4 sessions yesterday, members also expressed reservations about spending with respect to some of the parts of the governor's proposal. And so, I don't want to leave out, the legislative analyst has also weighed in and said some of the things probably ought to wait. Most notably from the legislative analyst, the $2 billion that the governor's proposing to reopen the schools. So exactly what will happen by the end of the month, again, we're not totally clear, but we do think we're going to see some action regardless of what happens. Because we are, again, first month, first year, 2-year legislative cycle, we think after they do appropriate some money, they do possibly pass a bill or two, we think the legislature and legislators are going to return to their districts. They're going to wait for more people to be vaccinated. The governor's saying 1 million vaccinations through the weekend into early next week. We'll see if that happens. But we do think legislators are going to want to return to their districts, not necessarily shelter in place, but lay low and wait for the bill introduction deadline at the end of February, and also budget subcommittees to start ramping up again more in the February, early March timeframe, when we will really see this legislative session really kick off substantively in earnest. So I'll stop right there. Thank you again for having us present to you. It's always great to present with your federal lobbyists. We've done a lot in tandem to the benefit of the county and its residents. Just really glad and honored to be part of this team. Thank you.
Thanks, Paul and Karen. Joel.
With that, I open it to your board for any questions you may have.
Start with Bonnie.
Thank you very much. Appreciate it, the report, folks. Just a quick comment, which is if there is any additional funding that comes from the federal government to the counties, as much as you can allocate for direct allocation to the counties or a direct pass-through from or to the state directly to the counties, that would be appreciated. It was very frustrating to have our $41 million held up over a number of 6 months, so that we were able to actually utilize it and get it out to our nonprofits and our business community and our healthcare organizations and et cetera. So direct allocation, much better than having it go through the state of California and the governor's administration. One item for my colleagues in the proposed ledge platform, item 16E, which is on page 21 of the staff report. I spoke with Joel and Dr. Oldham about this one. It's supporting the existence of clean syringe access programs to reduce the spread of communicable diseases. We have not taken a policy decision about that item, and so I would prefer if we did not advocate for that item until a future date if we want to have a conversation. But I think I'd like to strike that from our ledge policy, please.
Thanks, Bonnie. I would enthusiastically endorse the direct payment part. And Cindy.
Great. I had a couple comments. Thank you all. I know you're doing a lot of work, and Joel, great job on the whole platform. I just wanted to reemphasize a couple points. Obviously, fire, and we've talked about wildfire, but I want to throw in their homeowners insurance. Anything we can do to ensure that these companies have to provide homeowners insurance and we can expand those markets. I've had a number of constituents again this year be non-renewed and dropped in outrageous pricing to get back into the market. Obviously, we need to expand the markets and reduce the risk to these insurers to get competitive rates. So whatever we can do there. Housing, obviously, we know that the governor is a high priority on housing, but looking at the missing middle and getting our young families able to afford some sort of down payment assistance, some of the things we're talking about as a county, but any help in those areas that don't necessarily qualify for a lot of the programs the governor's talked about. We need the whole range. And the more we free up for missing middle, the more there's opportunity at the lower end as well. So it benefits everybody. And then transportation and infrastructure. As the I-80 corridor, obviously we understand the significance of transportation, but that rail corridor is critical, and anything we can do to look at opportunities to use that rail corridor for both freight as well as passenger service up and down the mountain and over to Western Nevada, and how we can work collaboratively with our counterparts in Nevada so that we can really have maximize the use of that rail. So, and then the final item is more an operational item in these budgets, but as we've seen the impacts of greater and greater tourism and use of our rural areas that are often state and federally owned lands, but not seeing a commensurate investment in trash and restrooms and parking enforcement, and it falls on the local county, and people complain to us, and yet it's state and federal land. So anywhere that we can augment those budgets and force these folks to deal with their lands, we'll deal with ours, but we need them to deal with theirs. We're getting spread way too thin on trying to pick up everybody's garbage and providing restrooms. So really appreciate all the work you're doing, and just a couple key things I wanted to further emphasize. Thank you.
Thanks, Cindy. Jim.
Yes, thank you all for presenting to us. Governor Newsom in the last 2 years has been had some very robust funding for forest health and forest fire protection. Is there some more funding coming through the state in the budget for forest health and watershed management?
There is. Thank you, Sue. Through the chair, thank you, Supervisor. And I really appreciate the question because it gives me a chance to commend your staff. There's a tremendous amount of work that's been done to educate a lot of different elements of state government on what Placer has done, what it is doing, and what it could be doing with even more money. And so the governor's budget proposal even goes so far as to specifically talk about creating potentially as many as 60 new major significant fire breaks. And we do expect a lot of those to be targeted in Placer County. So that's great. In addition to that, it's close to $1 billion of new investment that the governor's proposing for resilience, for forest management, for home hardening, and for the fire breaks, as I just mentioned.
Very good, thank you.
Thanks, Paul. Is there anyone from the public who'd like to address this item?
Michael Garbedian, go ahead and unmute your mic and give your comments.
Thank you. Good morning, supervisors.
Good morning.
Mike Garbedian, Placer County tomorrow. 2 points I want to address. First of all are the funding efforts for Placer Parkway. This advocacy will undermine the county's credibility on transportation, if not other things. The people in Washington understand transportation issues, and you can't pull the wool over their eyes with the ways this is promoted by the Placer County Transportation Agency. That's, I think, says enough about that. The critical forestry issues we have and we need are evident to everyone, but to wrap them in the mantle of the Placer County Conservation Program is a mistake. The PCCP is an anti-natural resources program. I think the forestry needs can stand on their own without using that argument that you have in the papers, and I hope you will drop PCCP as some kind of a wedge to try to help get forestry. Thank you.
Thank you.
No further comments.
No further comments. Okay, so unless County Council disagrees with me, I'm presuming from the way this was worded that we don't need a motion, you just need direction given to us verbally. So with that, Supervisor Gore had requested that we drop item 16C on page 21 of the staff report. So is there any comment or direction amongst the five of us? And I think your request was specifically, since we haven't discussed it in detail, that you would request that it be deferred until such time that we can. So it appears to me that there's concurrence in that regard. And with that, then I want to thank all four of you. It's been great working with you over all these years. Look forward to some great success as we go forward. Thanks.
Thank you. Thank you. Take care.
I would like, if it's acceptable to the board, to jump to item 7A, which is the at-large planning commission seat, because we have several people in the audience. And if we don't do that now, they may be here for quite some time. So for their convenience, if that's okay, we could go right to that item. And it looks like it's okay. So Leah, are you going to present that for us?
Good morning.
Good morning.
I am going to take my mask off so I can read.
You're welcome to do so.
That's all I got. Thank you so much, Leah Rozaska with the Board of Supervisors Office. I'm here this morning to ask you to take action to appoint a representative to seat 7 of the Planning Commission. As you know, although not everybody in the public may know, the Planning Commission is the principal hearing body on planning and land use matters related to land use projects and long-range planning efforts here in the county. The Planning Commission is comprised of 7 seats. Seats 1 through 5 representing each of the 5 supervisorial districts, seat 6 representing the county at large east of the Sierra Crest, and seat 7 representing the county at large west of the Sierra Crest. And again, I'm here today to ask that you appoint a representative to that seat, seat 7. There are 6 applicants for your consideration, and I will read their names in alphabetical order by their last name. David Butler, Christine Johnson, Richard Johnson, Jeffrey Moss, Wayne Nader, and Paul Richardson. You should have received an application for each of the applicants, and I believe some of them also submitted a resume. And you also should have received several pieces of correspondence on this item as well. That concludes my presentation, but if you have any questions, I'm happy to answer them for you.
Thanks, Leah. Are there any questions of Leah at this time? I see none.
Okay.
So what we've communicated is that we're going to allow each of the applicants 3 minutes to make a presentation if they so chose. Don't have to. We've got a lot of data, but you're certainly welcome to do that. And why don't we just, if you do, why don't we follow the alphabetical by last name order that Leah mentioned. So Dave Butler, I see you're here and you're up first.
Mr. Chair, members of the board, thanks so much for taking the time to listen to all of us and to consider our applications thoughtfully. I thought I'd just focus on two things, just highlight some of my, I think, hopefully relevant experience, and then also my approach to governance. And over the years, I've had the opportunity to work with all of you, really, in one way or another throughout my career here in Placer County. Starting as a legislative district aide for State Senator Tim Leslie. I worked most of Placer County on his behalf, and then went to work for the Sacramento Metro Chamber, where I was Senior Vice President of Public Policy and Economic Development, and focused on a whole host of policy issues at the local, state, regional, and federal levels, including local and regional land use, and was engaged quite significantly on the Regional Blueprint Initiative. Locally, I did chair the Government Relations Committee for the Rockland Chamber and also chaired the Board of Directors. And under my tenure, we started the Joint Government Relations Committee. And that led me to the City Council in Rockland, where I spent quite a bit of time on land use and planning, including helping to establish the architectural standards for the Quarry District. Also served as chair of the County Economic Development Committee, and most recently chair of the county's Charter Review Committee with Wayne. And over my 20-year career in organizational management, I've worked with boards of directors and with staff to achieve consensus and achieve success over the years. I have a strong commitment to hear and learn from everyone who's involved in the issues that come before a body, in this case, the Planning Commission, including the applicant and the public. I want to ensure that all voices are heard equally, committed to studying the issue, the policy, and the precedent, and committed to not make a decision until all the voices are heard. And after that, achieve consensus in a congenial manner with the fellow board members. And then once the decision is made to move someplace or make a decision on a project, commit to support that decision, even if I don't happen to agree with it. And always recognizing that this board sets policy and we're an advisory group. So with that, I thank you again for your consideration and look forward to your deliberation. Thank you.
Thanks. Christine Johnson. Okay. Rich. Oh, I'm sorry. She's calling in, zooming in? Yep. I apologize.
Christine, go ahead and unmute your mic and give your comments. Christine, go ahead. There you go.
Okay, can you hear me now?
Yep.
Yes. Really good, thank you. Good morning, commissioners. I want to thank you for allowing me a few minutes to speak to you regarding my application to the Planning Commission. And now I just realized that I'm a new face applying to this commission. Richard, David, Paul, Wayne, and Jeff have all served on planning or charter or other commissions, so I guess I am the new kid. I applied to this position in hopes of serving my own district, number 4. I've attended many planning commissions, board of supervisors, and MAC meetings over the past 5 years, and I have a pretty good sense of the planning issues in our county, and particularly in my district, which is comprised largely of unincorporated Granite Bay and a little tiny bit of East Roseville. So for residents in Granite Bay, the county is our local government, and we have a community plan that's supposed to guide development and other decisions, but we don't have a city council or a planning department like Roseville, Lincoln, and the other cities in our county. So representation is extremely important to us, especially as it relates to the community plan. Our residents, we interface with the county through our supervisor, and we have a new one now you've met today, Suzanne Jones, and through our MAC meetings. They're very important to us. Our homeowners provide significant tax revenue, so it's only fair that their voice is heard on matters that impact our community and our county, things like traffic, housing, and planning. In recent years, there have been a lot of variances and use permits that were issued that are really not in accordance with our community plan. And this is the main reason that drove me to apply for this position. In general, there's a lot of social and demographic changes impacting our county overall that require a reset on our thinking and our planning for land use for the future. For example, just ahead of the COVID virus pandemic, commercial real estate was starting to slump, already somewhat overbuilt, and we have lots of long-term vacancies in my district. Post-pandemic, which hopefully we will soon see, a lot of companies are already saying they don't need as much office space or retail space. So we can expect the need for commercial real estate to maybe continue to decline. But another outcome that we have going on in our county because of this ability now to work from home is we have a big wave of Bay Area professionals who can stay in the same time zone and work from home that they can afford to buy here in Placer County. The county just approved a very large suburban tract home development, Sunset area, Placer Ranch area, where thousands of higher priced homes will be built for these Bay Area professionals and other people who want to move here. But as mentioned by Cindy Gustafson, we have no significant effort in making sure that we have affordable housing that's built for the thousands of workers who are needed to serve this expansion. Teachers, like my daughter, healthcare workers, transportation workers, all vital workers, they can't afford to live here and they already travel a long way to work in our county and significantly add to our traffic gridlock.
Christine, I apologize, but could you wrap up your comments, please? We're allocating.
I am.
Yeah,
Let
thank
me
you.
finish. Thank you. These are my priorities. I applied to this position because of my past experience as a housing redevelopment professional, an engineer, and a business founder. That being said, I've decided to withdraw my application for this at-large position, and instead I want to recommend that Wayne Nader be reappointed to this position. In the many meetings I've attended and observed, Mr. Nader came the best prepared to the meetings, asking the most important questions and casting his vote based on the answers he got from the petitioner. I believe he's an excellent choice and would not want to displace him. It's a new day in Placer County. We've got a new supervisor. We've got new and bigger challenging problems than we ever had. If you ever decide to form a commission on housing, transportation, or traffic, I will be delighted to apply for that. Thanks again for your time and your consideration.
Now, Rich Johnson.
Yeah, well, my name is Richard Johnson. I go by Rich.
Richard. It's good with me.
Yeah. Okay. I've served on the Placer County Plan Commission for going on 14 years now as a District 3 representative. And so I guess you might ask, why am I applying for the at-large position? Well, I live actually close to the boundary of District 3, but I actually live in District 5 out South Auburn. And so at any rate, with the census coming up and the likely redistricting that's going on, it makes sense for me to apply for the at-large position. And so that's why I'm doing it. I see the Planning Commission as a very important body. It's a citizens committee that reviews land use proposals and conducts public hearings. And for the more complex projects or policy issues, forwards the recommendation on to the Board of Supervisors for you folks to make a decision. Let me see, first of all, let me talk a little bit about me. As I mentioned, I spent 14 years now going on 14 years on the Planning Commission. And I think there's a lot of value in having some senior tenure to help the new members come in, which could be a very complex process at times. I'm the second most senior member of the Planning Commission right now, after Larry Sivison from Lake Tahoe. Let me see, before I went on to the Planning Commission, I spent 15 years on the Placer County Agricultural Commission. Much of that time, probably half that time, I was a chairman. I'm a registered professional forester, and I retired as a district ranger from the American River Ranger District after 20 years of service. That's 200,000 acres of Placer County land, part of the Tahoe National Forest. In that role, I interacted with many of the county staff as well as the Board of Supervisors and the Placer County Water Agency. About half of the Middle Fork project is on the American River Ranger District. In addition to that, I interacted with many folks and officials at the state and federal level. Let me see, I served on the Auburn Chamber Board of Directors for several years, and I was the chairman of what they call the Meddlers, the Auburn Chamber Forum, for 4 years. And I also spent many years on the Government Affairs Economic Development Committee for the Chamber, and that group really reviews problems that are coming up with the business district in the greater Auburn area and makes recommendations to the board. Let me see, in addition to that, I was a founding member of the Placer County Visitor Bureau and served on that board for many years and spent 2 years as the chairman. I also was a founding member of the Forest Hill Fire Safe Council, and I got to hurry up here. And so at any rate, that was the first fire safe council in Placer County. I have to mention that I'm a member of the Auburn Host Lions and served as president of that group for 2 years. I guess in closing, what I'd like to say is I've enjoyed my time on the Planning Commission, and I think I bring value or have brought value to the Planning Commission as well as will in the future. And I would appreciate your approval of me as your at-large Planning Commissioner. Thank you, and thank you, Board.
Thanks, Richard. Next is Jeff Moss. Is he?
I don't.
No. After Jeff then is Wayne Nader.
See, I guess it's still morning. Good morning, Chairman Wygant, supervisors, and special recognition to Supervisors Gustafson, Jones, and Holmes for their this morning for their swearing in process. My name is Wayne Nader. For many years, longer than I'd like to think, I recall that Western Placer County was made up of very small cities. In my early years, I believe Lincoln only had a population of about 3,000 people. I remember driving to Sierra College when there was nothing but vast grasslands between Lincoln and Rockland. Now it's just a sea of rooftops. Change is inevitable, but we must assure that it is measured in how it comes about, and that it's best accomplished with a thorough vetting process of all possible implications, which can then better prepare our communities for change. Since your agenda came out, I have been overwhelmed and humbled by the many letters and emails that have come from around the county in support of my reappointment. I think you know me well enough to know that I'm not anti-growth. I am for sensible growth. That is why I critically analyze every potential impact. Can we avoid all impacts? No, we can't avoid them. But we have a responsibility to make sure that those impacts do not significantly adversely have adverse consequences to our residents. For decades, I've been serving on various boards, committees, and councils in the county with a dedicated view of protecting and enhancing the quality of life in the county. My position has always been to take something good, make it better, and from broken to workable. I do not accept face value of anything that comes before the Planning Commission, digging deep into researching all aspects of projects and issues by meeting with applicants, opponents, and experts in order to ferret out the best decision is just part of the investment in time that I take to assure prudent outcomes. I believe that my extensive experience and diverse background in development, transportation, agriculture, finance, and planning is critical to understand the complexities that come before the Planning Commission. I'm confident that the probing questions that I ask make for better results for our communities. I'm not in this for prestige or power or money, and with $100 a meeting that doesn't come close to compensating for the multitude of hours I put in to be fully prepared to render sound determinations. I love this county, and And in whatever capacity I serve, I am firmly committed to boldly standing for what is best to ensure that it continues to be a wonderful place to live. I would like to share a quote from Kimberly Stossel, who is with the Wall Street editorial board. Quote, "Our country is best when it is engaged in vigorous debate. The framers of the Constitution envisioned a multiplicity of interests that would argue their way to a common good. We succeed with more voices, not fewer. And we should have enough confidence in our arguments to hear out our opponents," unquote. That is truly what I believe. We are stronger when we challenge each other to seek the highest ideals and to strive for the best outcomes. I would ask for your vote to allow me to continue to do this good work. Glad to answer any questions, or if you have something specific on a project, a decision that I made, I'd be glad to talk about that as well.
Thanks, Wayne.
Thank you.
Paul Richardson.
Well, good morning, Chair Wygant, members of the Placer County Board. I'm Paul Richardson, and first of all, I want to say thank you to all for at least considering my application. I also want to thank Supervisor Jones for advancing the application for Planning Commission. I do know some of you, but just for brief background, I moved to Placer County, Tree Lake Village in Granite Bay in 2002 to accept the position of Planning Director for the City of Roseville. I served as the Planning Director for the City of Roseville from 2002 until I retired from public service in 2013, and I retired as the Planning, Housing, and Redevelopment Director in 2013. Since that time, I've been a private consultant in Placer County, and I do have a business license in Placer County, and I provide planning, community development, and economic development consulting for a variety of clients in Northern California, usually municipal agencies. As a practical matter, you know, I understand general plan, I understand zoning, I understand the California Environmental Quality Act. I've been around boards and commissions for pretty much my entire career of 40 years. So I'm not going to have a steep learning curve in terms of the Planning Commission, and I also think I can add a lot of value in that regard. But I think it's important, having been around commissions and boards and bodies, the most important thing is kind of transparent decision making. You know, people that are in favor of an application and those that are opposed to an application need to understand why the decision was made, whether they agree with it or not. And I think it's important to be a good steward of the community. I know you're not asking other candidates questions. I would open up for questions, but if not, I want to at least thank you for your consideration. Thank you, Paul.
And is there anyone from the public who'd like to make a statement?
There is. Ann, go ahead and unmute your mic and give your comments.
Yeah, thanks. Ann Nichols, 50-year resident, North Shore Lake Tahoe. I can't say enough how much I appreciate Wayne Nader's transparency and thoughtful decision-making. He has no conflicts of interest, and I just hope you will seriously consider him to be reappointed. Thank you very much.
Thank you. Yes.
Hi, my name is Jan Ferreira. I'm here with my husband, Patrick Ferreira, business owners and one of us lifelong residents of Placer County in Auburn. We came here to support Wayne Nader. I'm not sure I can speak as well as he got from Christine Johnson just there. We also wrote in a letter, but we wanted to come in support of him. We've gotten to know him. We have been attending many Planning Commission, MAC, supervisor meetings, either by Zoom or in person. Over the last few years, getting much more involved, have come to realize how much it takes to research each and every project that is brought before the Planning Commission board, but even more so to be organized, have done the research and bring the hard questions to the table, really ask questions that need to be answered, and then still be gracious enough to accept the answers, whether you agree with them or not, but accept the answers that are brought. We have found Wayne Nader has been able to do this. We have not caught him off guard on his preparation. We feel he asks very, very specific and detailed questions to each and every project. sometimes the hard ones, but also gracious enough to accept the answers that are brought to him or ask more questions. We just came here to show our support for him and hope that you re-elect him to the Planning Commission. Thank you.
Thank you.
Robert, go ahead and give your comments for the record.
Good day, Commissioners. My name is Robert Hines. I'm a 23-year resident of Tahoe City, and I would also like to garner support for Wayne Nader. I have attended many supervisor and council meetings. I'm familiar with his background of projects. He's smart, experienced, a former commissioner, and I just want to offer my support for your consideration for Mr. Nader. It's as simple as that. Thank you.
Thank you for your comment.
Ellie, go ahead and give your comments for the record.
Thank you. Ellie Waller, you have received my written comments. I just want to reiterate the support for Wayne Nader. During this time of restrictions during COVID, travel won't be as readily available to some people, and he is very familiar with the Tahoe area as well as where he lives in the western portion of the county. I would appreciate your board support for Wayne Nader. Thank you.
Thank you.
We have no further public comment.
Okay, with that, I'll bring it back to the board for discussion and a decision. Jim, do you want to start?
Yeah, thank you. Well, we have a great selection of candidates here. Wayne, I know you've been a long time contributor to Placer County. Rich, you've got a great background as well, and I worked with David before. And then Paul, you've got a great background as far as planning director, and so it's going to be a tough decision for us. And I think they're all well qualified to be appointed, and I think they could probably form their own planning commission with their background, to be honest with you. But just our last item that we heard was about our legislative platform and the forest, health, and fire concern that we are all concerned with. And let me just quote from the staff report. Few matters are of greater urgency to Placer County than forest management and fire protection. It goes on to say that the foothills are one of the most high-risk areas in the state to experience a major wildfire and structural losses. And one of those areas that is most at risk is, of course, the Forest Hill Divide. It was not very long ago that they were threatened with a major wildfire. So wildfire is a threat to those who live in the wild-urban interface. Our Placer County Fire Chief has told us that Placer County has the highest population in the state of those that live in the wild and urban interface. So forest health is also, it's really critical to protecting our watershed, the American River watershed. And there's only one candidate who is extremely qualified to represent those important issues on the Planning Commission, and that's Rich Johnson. Mr. Johnson served for many years as a district ranger for the American River District and has extensive knowledge of the serious threat of wildfire in Placer County and indeed in Northern California. And so it's my considered judgment that it would be our best interest to appoint Rich Johnson to the Western Slope C. And I'll make that a motion.
I'll second it for discussion.
A motion and a second to appoint Rich Johnson. Bonnie.
Thank you. A couple of comments. So first of all, thank you all for applying. I really appreciate it. And there's just a great wealth of experience and backgrounds. Several of you have served for many years, and we appreciate that. I wanted to share with my colleagues some thoughts about commissions and boards of commissions that I've been starting to have with staff about how we structure just the county board assignments, commissions, and committees that we have. And I came from a city where when I served on city council, we allowed folks to serve for 2 4-year terms, whether that was the Transportation Commission, Planning Commission, any of our city commissions. It was 2 4-year terms. And part of that was to allow for a number of people to participate, but bringing in new ideas and new thoughts and just a different perspective. Because I do think that after you serve on a board for 10 to 12 years, sometimes not means nothing against my colleagues here, who I appreciate very much. Gotta watch myself, right? But I do think that having diverse views are helpful, right? And I think our board has just now changed over the last couple of years, and we've got a more diverse board, which I think is just terrific. And we've got some senior members and folks who are a little bit newer. So with that, I've been thinking about that for all of our county boards and commissions, and that's a conversation I wanted to have this last year, but we got preempted by a little disease, and so we haven't had an opportunity to focus on some of those other items that I wanted to bring forward as chair. But I do think that serving a good 8 years is terrific, and we've got folks who have served for 12, 14, 8 years, and I am interested in bringing in some new perspectives. I have worked with both David Butler, David for many years. Since I moved to Placer County, he's got a great experience of policy as well as understanding planning as an elected official and balancing that. I know David to be a person who really listens to perspectives and does his homework. I really appreciate that about Dave. And then I know Paul Richardson, as he served as Roseville's planning director. And I think he's got a great background as well. But I'd like to consider either of those two. And I think I'd put my support a little bit before Dave. And Paul's got this great planning background, which I love. But I think I'm looking for a little bit more of a broader view of how we balance issues. And I know Dave to be that type of person.
Cindy, do you want to?
Suzanne.
Suzanne.
Yes,
All right. Sure.
Thank you. I do agree that forestry is important, and I do agree that rotation of people in positions is important as well. But at the same time, we received a packet of letters today. I believe there's between 15 and 18 letters, along with all of the comments that we received, were all highly encouraging us to reappoint Wayne Nader. And far and above any of those other aspects that we're discussing, I think listening to our constituents is what part of my campaign was, a promise to listen to my constituents. My constituents all the way from these letters, they're all the way from Newcastle, Auburn, Lincoln, Granite Bay, Loomis, all the way to Kings Beach. There are constituents in every one of our districts here that are asking us to reappoint Wayne Nader. And I would urge you all to please, I would listen to my constituents way before I'll start putting out things like, well, I think this, or I think you should do that, or, setting a platform for why we should do something different. So I would support Wayne Nader, give him my support today.
Thanks, Susan. Cindy.
Great, thank you. Well, I want to thank all of our applicants, and I've had the pleasure of working with 3 of you for many, many years, and knowing you, and then the others that have applied were excellent qualifications. Paul, I thought that was great, and Christine, appreciated your comments, even though you withdrew. And this is a really challenging decision, but I had to sit back and for me, look at what is an at-large appointment. Each of us get to push our agendas if we wanted to by appointing our own commissioner. But when we look at large, we need to look at those people, in my mind, that can balance a variety of thoughts and balance our political perceptions as well. And so in thinking all of that through, and certainly looking at the new changes with 2 new commissioners and the variety of really important decisions that have long-standing history coming into this, I have no doubt that any of you would do an excellent, excellent job for us. And I do think we could almost have an expanded commission given the quality and interest in applying for this position. So I thank you, sincerely thank you all. The three that I've worked with and had long conversations with, I really appreciate all of you, especially, approaching me and taking the time to talk about this. And with all that, I know you know how difficult a decision this is for us because you know us and you know we care and we want to do the best for our constituents. But looking at that and looking at the knowledge of the West Slope of my district, as well as the entire West Slope, and that at-large position being somebody who I think should be representative of all viewpoints and moderate in their approach, I'm going to stand by my second of Rich Johnson. Not in any way to say that that's a decision that, that makes him better by any choice for any of your expertise and experience. I appreciate all of that very, very much. But I think Rich is a really good choice for us in this situation at this time and with his knowledge and experience. So I'm going to stand by that.
Okay, I think it would be remiss if I didn't express my views, and I'll want to state, first of all, thank everybody for submitting their applications. When I look at these kinds of appointments, I think in the context of the whole, and I'm sincere in saying that when I consider the existing commission that we have with our new appointee, any of you would plug in to our commission and provide good service to the county. So that's a great position for the board to be in. It's not all that common necessarily. So we have a motion and a second. Obviously, there are different perspectives. I think I'm going to see how that vote goes.
It's not fair.
I know. The perspective that I will provide before we do that is I've been on the board so long, and I was on the planning commission for 4 years before that, so have been around for a long, long time, and perhaps too long, but
I never said too long. I never said too long.
That's actually, it's okay. When I came to the board and when I sat on the planning commission, I held one of the at-large seats, and there was no county designation for where those seats came from or for whom they represented. When I came, it left a vacancy out there, and Pete Hill actually filled that seat for a couple of years before he ran for council and Roxanne was reelected. And after that, the board discussed having specific representation for the at-large seats. So one is for the east side and one is for the western slope. And I agree that forestry is a very high priority to the county overall. There is an east side at-large position and then your individual appointee. But to me, the west slope is much more complex than just the Forest Service, as important as that is as a priority to us. It includes a lot of urban types of project proposal that will be coming forward. All of the Sunset area, of course, the Placer County Conservation Plan is in the mix of all that to offset the mitigation and do higher level of conservation. And I'm frankly just going to leave it at that and ask Megan to do a roll call vote for us, see what we look like here.
Gore?
No.
Holmes?
Yes.
Jones?
No.
Gustafson?
Yes.
Wygant?
I'm going to vote yes to conclude this item, and I endorse Richard. I'm comfortable with him. I know he's done a good job, but I think at this particular point, that would be a better outcome than having us reslice this decision who knows how many different times and end up maybe with not such a constructive and positive outcome. So we have a 3-2 vote. Richard Johnson is the at-large planning commissioner. Thank you.
Thank you, everyone. Appreciate it.
Thank you very much.
So We have a 12:30 item coming up, and I want to take the temperature of my colleagues and Suzanne, particularly since we've had lengthy meetings this year that are unusual, not rare, but unusual in the sense that we've been going late into the day, and this one looks like it's going later than I was hoping for. So that's probably on me. But so we have a 12:30 item, which I think we should stick here and listen. We typically break and go into lunch and have closed session at the same time, and really don't get much of a break except we get a chance to stand up. But Megan has indicated that for items 5 and 6, those folks are happy to wait. We have about an hour's worth of department items after that. So I think we should at least do something until 12:30, hear that item, then go into closed session and work through that and come back and probably take up what's left or all of the.
I would suggest a break.
A break right now?
10-minute break and then.
Well, that's why I was checking in, so
Yeah.
thank you.
She needs
So we're
a
going to
break.
take a 10-minute break and then we're going to come back and hear our 12:30 item. Thank you. Okay, we will reconvene Placer County Board of Supervisors meeting, and we will take up our 12:30 timed item, which is an update on the evaluation of body-worn cameras. And Becky, are you going to kick that off for us? Thank you.
Good afternoon, Chair Wygant, members of the board. Welcome, Supervisor Jones. I'm Becky Riggin here from the County Executive Office to provide an update on the evaluation of a body-worn camera program here in Placer County. We are here today for an initial conversation with the board about the merits of these programs, to discuss the approach under consideration by the Sheriff's Office, to review anticipated costs, and to seek your direction on next steps. I'm joined today by Captain Jeff Swearingen, who will review the planning effort conducted by the Sheriff's Office over the past year. From conversations with members of the Criminal Justice Policy Committee, we heard how beneficial body-worn camera video footage can be to the broader criminal justice system in facilitating timely case resolution. So we have invited the District Attorney, Morgan Geyer, and Dan Kokel from the Public Defender's Office to speak with you directly on some of those aspects. There's quite a body of literature on the growing use of technology in law enforcement agencies, most notably around the increasing use of body-worn cameras. In what may be a rare example of policy alignment these days, all stakeholders from law enforcement to civil rights groups seem to agree that body-worn cameras can be a vital tool for improving accountability and transparency between law enforcement officers and the citizens they serve. As of 2019, nearly half of the nation's 18,000 law enforcement agencies have developed body-worn camera programs. Last October, the Department of Justice announced that they will be deploying body-worn cameras in collaboration with state, local, and tribal partners in the hundreds of joint federal task forces across the nation. In California, we found that 74% of city and county law enforcement agencies and 62% of sheriff's offices have deployed use of body-worn cameras. These programs all look a little different. Some agencies choose to equip only patrol officers with cameras, while others require all uniformed staff to wear a camera, including correctional officers and even executive staff. These determinations are based primarily on the jurisdiction's financial capabilities. Some of the most comprehensive information we came across was from the Bureau of Justice Assistance and the U.S. Department of Justice, findings from a 2014 Community-Oriented Policing Services Forum attended by over 200 police chiefs, sheriffs, academics, and federal justice agency officials, concluded that well-constructed body-worn camera programs can provide numerous benefits. They can increase accountability and transparency when questions arise following encounters between officers and members of the public. They can significantly reduce citizen complaints and help bring resolution to officer-involved incidents. Agency officials attribute this to the fact that the mere presence of a camera seems to result in more civil interactions and to elevate behavior on both sides of the camera. They also noted that having video of an encounter discourages filing of frivolous and unfounded complaints, saving time and money spent on lengthy investigations and lawsuits. Agency officials also noticed that video footage can be used to evaluate performance of new officers in the field and to develop specific scenario-based training in addressing performance issues. Video evidence was also found to be of tremendous benefit in civil and criminal court proceedings, along with internal investigations. Prosecutors participating in the forum reported that video evidence is particularly helpful in domestic violence cases that can be difficult to prosecute when evidence is insufficient for trial. They report that when suspects are shown video of the incident, they often plead guilty without even going to trial. So while there are many notable benefits to body-worn cameras, there are critical policy issues that must also be considered prior to implementation. New technologies, particularly body-worn cameras, can have public privacy implications. Decisions on when to record, how to respond to the media and public requests for video footage, and whether recording should be discretionary or even prohibited in certain situations, particularly those involving victim interviews and other sensitive situations require thoughtful consideration. All of these decisions must be balanced with the ever-changing state law around these programs, the transparency goals of the jurisdiction, and the evidentiary chain of custody requirements. Another key consideration is that body-worn camera programs require considerable financial investment. Data storage is often the most expensive aspect of these programs and is directly impacted by the retention and storage policies. Additional costs include initial acquisition costs, which our federal advocates indicated, we may be seeing some grant funding for in the next several years. These grants often can come with fairly onerous reporting and data collection requirements. So we'll be happy to take a look at some of those and return with some findings on that. But additional costs also include costs for staff to review, categorize, and manage the video footage, to prepare video for the public or for court proceedings, and to provide training and general administration of the program. Best practices suggest that jurisdictions considering a body-worn camera program should develop comprehensive policy, funding, and implementation plans, and engage a broad group of criminal justice stakeholders to consider video capture and use, public release of video, retention and storage requirements, training requirements, audits and internal controls, preparation and use of video evidence in court. In 2019, the Placer County Sheriff's Office created an internal working group to research alternatives and address many of these policy issues that I mentioned, and to develop preliminary agency policy for the program. So unless you have any questions for me at this point, I'll turn the presentation over to Captain Swearingen to review the results of those efforts.
Thanks, Becky. Any questions? I see none at this time.
Good afternoon, Chairman Wygant, and congratulations and welcome to the family, Supervisor Jones. As Becky said, I'm Captain Swearingen with the Placer County Sheriff's Office, and I'm here to present some information on a body-worn program that we'd like to bring to the office. So the importance of video evidence for law enforcement has never been more significant than it is today. Body-worn cameras and other audio, video, field recording technologies have been shown to increase transparency and credibility, as well as reduce erroneous citizen complaints and reduce financial risks. With more and better quality evidence, deputies can spend more time on patrol and less time in court. After several discussions, both internally and with other experienced agencies, we identified specific technological functionality that we required in order for the system to be beneficial to users and important to include in the evaluation of a new system. For evidence purposes, as well as ease of use, it was important to us to integrate the body-worn camera with our current in-car, or if we go with another company, a chosen in-car program, where they would be able to, for lack of a better term, talk to one another. With some systems, an integrated system also facilitates the auto activation of the camera. So for instance, if a deputy were going down the street, decided to make a traffic stop, they throw on the light bar, that light bar would then activate not just the in-car camera, but would also activate their body camera. This removes any, as long as the technology is working, it removes any erroneous, I guess, in the middle of an activation or a critical incident, them not remembering to turn that on. It takes that out of their hands. Also, some of the cameras did not have a full shift of battery life. So our patrol deputies mostly work 10-hour shifts. Our correctional officers work 12-hour shifts, unless they're on some ancillary duty. And having to have them take a camera out, put it in the dock, and then try to remember to put it back in, especially if a critical incident were to occur, could cause some issues down the road. Some of the other cameras did not allow pre-event recording. It was very important to us that we had pre-event recording because the camera is basically always in record mode, but as long as you don't have any manual activations or automatic activations, that video stays on the hard drive until it's written over at some point down the road. And I believe one of the systems we looked at that we really liked was about 128 gigs of memory. So Those can be configured. A lot of the companies that we looked at, there were 6 different ones we looked at, they have some version of that. One company stood out because it could do a full shift of pre-recorded events. So if you were to walk by somebody on the street who maybe had a warrant, you didn't know it, but then someone told you, you could go back and look at that video and go, oh, hey, I saw that person at the 7-Eleven. So we created a committee to lead and guide the evaluation of the body-worn camera system and craft an agency-wide draft policy. The committee consisted of the administrative captain, the patrol lieutenant, the jail lieutenant, the Tahoe lieutenant, and a PSU professional standards unit detective, a fiscal supervisor, an evidence technician, an IT analyst, and a representative from the Deputy Sheriff's Association. The committee, along with the administration, determined the needs of each unit related to the project. They looked at areas such as technological requirements, video storage option, and impact on staffing needs going forward. The committee, with the help of deputies and sergeants, evaluated 6 leading vendors and the equipment and software they offer. This included soliciting references and real-time feedback from other agencies, as well as extensive hands-on testing of the cameras and software, which we did in a fairly static environment. We did not deploy these cameras out in the field. We created scenarios that were based on real-life incidents where we were able to do traffic stops and things of that sort, just to kind of mimic and simulate those. So based on the key factors of technical features, ease of transition, cost of ownership, vendor reliability, and stability, we did a lot of evaluation and determined that we really preferred one system, which we currently have in our cars, the WatchGuard system. They have a body camera called the V300. We know that company, we know the commodity. We've had their technology for several years now. The technology is sound. Transition to that system would be fairly minimal. But one of the real features of that record after the fact and automatic camera activation were some of the benchmarks we determined would be required for our organization. So along with the cost of hardware and software needed to implement the project, we took into account cloud-based storage needs, our computer-aided dispatch data integration, training, lease fees, and professional services. We explored both options of on-prem and cloud storage and determined cloud storage to be the better option. We took into consideration the added workload this would place on staff. It would be significant. In determining through our analysis what that would require, it would require 3 full-time positions. Professional standards unit detective. With the passing of legislation, especially in reference to Assembly Bill 748, whenever a critical incident occurs in the field and it's captured on video, we have a very short window of time to release that to the public, 45 days roughly. You might be able to push it to 90 days depending on the investigation's going. And so that causes a lot of work on the detective to redact and watch that video. So you can imagine if you had 10 deputies in the field on a critical incident and each of them had their camera on for, let's say, for an hour while the incident kind of resolved itself, that's 10 hours of video. Every minute of that has to be watched. And in order to do that, the detective would have to go through manually redact a lot of that software, the video footage. We determined an evidence technician would be required. With the increase in video volume, there'd be corresponding increase in stored video evidence that would need to be managed and shared with the DA's office. And an IT analyst. The project's going to add nearly 400 pieces of new equipment, integration points, upload servers, video transfer stations across 7 locations that will need to be supported. They'll provide technical support for both the existing and new equipment, as well as software system administration and support for user accounts, security settings, video sharing, and reports, as well as managing the cloud storage environment. The district attorney office, in talking with them, determined that they would need at least 2 investigative assistants to help manage that data coming into their office. So along with the hardware and software needed to implement the project, we estimated the cost, taking into account warranties, training, lease fees, and professional services, as well as the increased staffing allocations. We estimated it to be about a 3.8 million, just under 3.8 million for a 3-year lease, and that includes the staffing. As Becky stated earlier, 74% of law enforcement agencies in California have a body-worn program. Now, when we did that study, we took out special districts such as transportation police, port authority, schools, any of those, and just focused on general law enforcement entities and came up with a number of 74%. We broke out sheriff's offices because sheriff's offices tend to be a little bit larger, a little more costly to support those programs. 62% of sheriff's offices had those. And the largest sheriff's office in the world, the LA County Sheriff's Office, is now exploring a body-worn program. So we did present to our Sheriff IT presented as a courtesy to the IT Leadership Committee in November. They suggested out of courtesy that we present to the IT Steering Committee to let them know what we were working on. Upon board approval, we worked to develop an implementation plan and also work with our finance manager to devise a funding plan. The body-worn draft policy was reviewed by County Council. We're still working with them. We'd also work with our other criminal justice stakeholders and County Council to develop a policy for video use and sharing. And after contracts would be executed, we would begin the process of constructing the infrastructure to support the body-worn camera system, including staffing, software, and the server to manage it. And if you have any questions for me, I'd be happy to take those. Other than that, I will turn it over to District Attorney Morgan Geyer.
Thank you. I don't see any questions this time. Thanks.
Okay, thank you. Thank you.
Good afternoon.
Good afternoon, Morgan.
Thank you for allowing me to speak on this issue, and welcome and congratulations again to Supervisor Jones, and nice to see everyone. I will echo the comments that were made, Morgan Geyer, Placer County District Attorney. I will echo the comments that were made by Becky and Captain Swearingen. Quite frankly, when a case is submitted to our office for the filing of formal charges, it begins a search for truth. And anything that gets us closer and more accurately to the truth helps us. Body-worn camera footage does just that. It increases the accuracy of the events. It provides a perspective that you can't get through the description of words or even photographs. It provides as close as it gets to the real experience. From the district attorney's perspective, it assists in the investigation and determination of filing of charges. We get to see what occurred. In the negotiation and settlements, and as Mr. Kokal will explain as well, it helps us resolve cases. It isolates those issues that need to be litigated and those that don't. The issue becomes relatively clear, and we can avoid needless litigation on issues that are apparent in the video. As our Chief Assistant Dave Tellman says, it's hard to argue with a video, and that's as simple as it gets. Quite frankly, there's an expectation on behalf of the community as well. From a forensic perspective, we have what's called the CSI effect with all of those fun TV shows. We have jurors that expect that we can do sometimes things we can't even do forensically in a courtroom. But the least of which we can do is record digitally the events that occur between citizens and our law enforcement. And that ultimately helps law enforcement. It helps the community. It helps restore faith and trust in the community members who get to see what happened during the interaction. And it helps protect law enforcement, as Captain Swearingen said, from some of those frivolous complaints that often occur as a result of interactions between law enforcement. And I think as the events over the last year or two have shown, from a social perspective, there's an expectation on the part of the community that these interactions are recorded. So we are in strong support. In an ideal world, we would have a unified, everyone uses the same system approach within the county. We have attempted and had those discussions with our Placer law enforcement agencies. It's difficult with the amount of independent municipalities involved and the amount of hurdles that each agency would have to go through. It's rather unworkable. And quite frankly, we would rather see each agency develop what fits best for them, even if they are different companies, and get them going than to wait for a sort of a longer approach. At the end of the day, the district attorney's office will receive that footage from each agency, regardless of what vendor or company they provide. We will turn that footage into discovery that we will turn over to the defense, and we will turn those into workable video formats for both the defense and for the presentation of evidence in court. And I'll end with the impact that these videos have on the jurors can't be understated. That expectation is very real. The absence of that footage becomes an issue that otherwise should not be an issue. Sometimes the credibility of witnesses, sometimes the credibility of our officers are called into question, and the video helps bridge that gap and make those issues clear. So we were in strong support, and we pledged to work with each agency as well as our other justice partners in Placer County to make sure that there's a smooth transition. It's expensive. It comes with more people that have to work on it. But in the end, it'll save time. Cases will resolve quicker. There are issues of liability, I think, that can be avoided with the use of this footage. And ultimately, it is a wise investment that I think we need to do. And I'm happy to answer any other questions. Otherwise, I'll turn it over to Mr. Kokal for sort of the defense perspective.
Morgan Bonney has a question for you.
Good afternoon. Thank
Good
you,
afternoon.
Morgan. Nice to see you. Just a couple of questions. First of all, does your office utilize images from the police departments that currently have body-worn cameras? So Rockland, Auburn, Lincoln, do you utilize those? And you've seen that?
Absolutely. And those are critical parts to the cases that we file from those agencies. The footage is played in court, and sort of the things I just described that we would use this footage for with the sheriff's department, we are currently using with those other agencies.
Great. You made a comment about the challenge of coordinating with other agencies, right? Like Roseville PD does not yet have a system. I think they're looking to see what we might do here in Placer County. And I know you don't want to wait necessarily for another jurisdiction. That being said, I do think there could be an opportunity for some, and I guess I'm looking at the sheriff's office as well, some opportunity to, like, if a large agency like Roseville worked with Placer County, there might be a way for some cost savings, right? Economies of scale type of thing. And I think that that's something really worth even still having those conversations with our local jurisdictions. We may not want to wait for them, but as they're looking at it, I think it's worth having some conversations. Maybe there's some dollars that can be saved. And then my other question, and that's, since I'm at it, as far as the workload, right? I know there's need for more staff, and I certainly understand that. Based on maybe fewer complaints or fewer cases, or you're able to resolve things a little bit more quickly, is there any opportunity to reduce the workload on some of these other positions that you currently have so that we wouldn't have to scale up to, I think, 5 new positions?
We would hope that a reduction in cases, a reduction in the number of cases that are filed, or earlier resolutions would result in sort of a larger, at least some sort of tangible result in a lower workload in terms of cases of our individual lawyers. What exactly that might look like is probably hard to predict at this point. There's always that hope, along with other efficiency measures that all of our agencies are taking, like case management systems that are paperless and things like that. We are redefining how we do our job. The workload is always there. We, especially from the district attorney's perspective, we always pray for the day we have nothing to do. And although we hope for that, we know that's not realistic, but we are always trying to find ways that we can reduce workloads in traditional ways and redirect those to be more efficient. We'll certainly continue to do so with this system as well.
Thank you very much.
Thank you.
Thanks, Morgan.
Good afternoon, Chairman Wygant and members of the board. Welcome, Ms. Jones. My name is Dan Kokal. I'm the public defender. And I can really just reiterate most of the points that were already made. From our office's point of view, body-worn cameras would be tremendously useful. We're dealing with investigating factual disputes daily. We have a team of 7 investigators that spend their entire day determining what the actual true facts are in a case. And the more video footage we have, the less we need to do that. Likewise, we spend a lot of time with clients, talking with the clients about what they recall happened. And video footage is incredibly useful in getting everyone on the same page in terms of what actually happened during an encounter with the police. This will be especially useful in cases involving resisting arrest or obstructing justice, because the police officer's interaction with the defendant is really what the issue is, and that will all be recorded. So that will be very helpful. Also in driving under the influence cases, performance on field side tests, we'll see exactly how that worked out. Domestic violence cases, we'll hear statements that were made at the time of the incident accurately, tremendously valuable. So in summary, body-worn cameras to the defense will increase the quality of the justice that we provide. It will also increase the speed at which we can get to resolution, which places our clients in a situation where they can get their counseling if they need it more quickly. And we will just be more efficient. Right now, we're running about 6.2 court appearances per case. If we can cut to the chase, we can maybe reduce that. We're running at 108 days for an average case. We may be able to reduce that. So it will increase efficiencies for us and it will increase accuracy for us. So we're in support and really hope the board adopts the body-worn camera program. Any questions?
I don't see any at this time. Thank you.
You're welcome.
So that does conclude our presentation. And again, we were just here seeking initial guidance from your board if you would like us to continue with this work. Continue to work with counsel's office on reviewing policies, but then begin to pull in some of our other departments such as human resources, IT, procurement to conduct technical reviews of the work done thus far, and then start to explore possibility of putting an RFP out for these services. We would also, again, recommend that we develop the detailed funding and implementation plan for consideration with your board later in the spring, if you would like us to proceed.
Thanks, Becky. And again, as per this morning's item, we don't necessarily need a motion, but you're interested in comments from us and direction, obviously, if there's consensus. So thanks. So is there anyone from the public who'd like to comment on this?
Lisa Larkin, please go ahead and unmute your mic and give your comments.
Thank you. Yes, I just want to state that I am in favor of this proposal. I actually presented it to the Roseville City Council, asking them why we didn't have body cameras in the city of Roseville back in July, and came back later to hear that they are or were looking into it, but are looking for federal funding for that. So I just wanted to comment that now more than ever, this is a necessary feature to implement. And I also like the idea of the automated recordings and not relying on officers to manually turn it on. Often we miss the information that takes place before the camera is turned on. And it would be helpful to have the full picture of what's going on between the constituents of our county and the officers on any given case. So I would love to see this implemented and appreciate you guys considering it. Thank you.
Thank you for your comments.
Kathleen Crawford, go ahead and unmute your mic and give your comments.
Good afternoon, Board of Supervisors. I also am speaking in support of body cam and car cams for Placer County Sheriff. It's an important feature. As a resident of Roseville, I am also urging the city of Roseville to get on board with this quickly. I think that the arguments made by both the county attorney as well as the public defender are extremely compelling. We need to have that transparency. We need to be able to move things through our court system on a more timely basis. And it's one way that nowadays everyone expects that there is some sort of video coverage. And instead of relying on people on the sidelines who maybe drive by or are near where an officer is involved with a member of the public, this way the officer's statement is actually, the officer's video is actually available and would give the best perspective as to what was happening. So I urge you to consider moving expeditiously on this matter as a matter of both public safety and just good presence to increase the confidence that we have in law enforcement in this county. Thank you.
No further public comment.
Okay, why don't I then just open it up to my colleagues to offer up their comments. I'm going to start on this side because I've been starting this. I must be leaning the wrong way or something. So Cindy gets to speak first.
Oh, thanks. Excellent presentation and great work on all of your parts to evaluate this and bring this forward. I'm strongly in support of this, obviously, and I think that's a lot of the issues that we're struggling with as a county, as the fiduciaries. We, of course, want this. It's how we look forward to funding it and balancing many issues with the county. But I think I'm very strongly in support. I did have two questions. One is on the in the staff report where we talk about the funding for the positions. Those are fully loaded, meaning salaries, benefits, incentive pays, all of those things are loaded into that. Does it also include pension and a contribution to pension for whether it would be a classic employee or a PEPRA employee?
I believe we factored all those costs into the calculation.
Okay, so it's a very conservative estimate. It could be less if depending on the person's tenure with PERS. Okay, and secondly, have you thought through, or could you come back, when you come back, talk about how we would track those results and efficiencies achieved? Because I do believe strongly that there will be, and we're hearing a lot of testimony on that, and I'd like whatever we do for this to be tracked. And I had one more. Third one is, it's a 3-year because of a lease program. Is it anticipated then that third-year cost would be continued out with CPI and salary costs included?
Yeah, it would be a 3-year lease program with WatchGuard. As far as salary goes, obviously we're going to see some increases on that for sure. But that number that we gave you is just the 3-year, what it would cost.
And the cameras then would have to be replaced?
Yes.
Okay.
Yeah. And so what we determined is, we believe, just based on the way technology is, how quickly it's moving, is those cameras will continue to get smaller, a little less cumbersome. They're improved vastly just from several years ago. So battery life will get better, data storage on the device will get better. So it didn't make sense to purchase all these things and then have them just go obsolete in 3 years.
Right.
Yeah.
Great. Okay. Thank you.
And I forgot to share a short story. We did have an arrest, I believe it was last year in Granite Bay, where the arrestee fought with the deputies, and it was a pretty good fight. And they were out of view of the in-car camera, and they had to ask a private citizen to start taping because the allegations the arrestee was making of being raped and things like that. So, it just really demonstrates the importance of something like that when you capture it in kind of a real life scenario.
Absolutely. Thank you so much.
Suzanne.
Yeah, I was just going to add that, I've experienced some criminal law defense, public defenders with my study buddy in law school who went on to be a public defender down in Amador County. And from all I've known and learned about body cameras, this would be huge, not only to the district attorney, but to the public defender's office. And I think, I know Sac County Sheriff, they kind of were fighting this for a while. I still don't think they have them, do they, Sac County? No.
They are moving forward right now.
Good. I think it was the cost really that kind of kept them away from it. But it sounds, people don't realize how much manpower it takes because you have to redact a lot of stuff. You're going to get PRA requests all the time, and you can't just release a raw video. And so, yeah, that's going to be a huge demand on your employees. But also in light of the unreliability of hearsay and eyewitness testimony, it can be huge for both sides. But the fact that you're all here in unison, the sheriff, you're not, one wants it, the other one doesn't, kind of a thing. The fact that you're all here and you're all supporting it, you would have my support in the future for this.
Jim.
Yes, so thank you. There's just so many reasons why we should do this. It's, there's no discussion about not doing it. Just want to make sure, and I have full confidence in the sheriff's office that they'll do this and get it right. But I'm comfortable moving forward and trying to get more information so that we can put this into place.
Bonnie?
Thank you, and I'm supportive as well. Just a clarification, Becky. So it sounds like the Sheriff's Office will work with our IT department as well as our procurement department. And I know that y'all have looked at one agency, but you'll open it up
Yes.
and look at, who's out there and what would fit our needs the best, as well as looking at the fiscal analysis of it as well.
Yes, absolutely.
Great, thank you very much.
And then I'll just throw in my support also, a couple of short comments. One, it's expensive, but to me, it's clear value. And one of the things that really hasn't been mentioned much, but it's might as well highlight it, is that as we've seen and over the years that I've been in this business, sadly, there's an erosion of confidence in our institutions. And for Placer County, we're usually on the leading edge. And whereas I have full confidence in our public protection partners and other agencies, this is just another step in that direction. And with that, then, as we move forward a year or so from now, if you folks would be willing to come back and perhaps give us some examples of benefits and or experiences you had, I think it would be good for the board and for the public.
Happy to do so. All right.
Okay, thank you. I think that's your direction. And with that, we're going to adjourn to lunch and closed session. So with County Council, please.
Thank you.
Thank you. Nice to see you.
Good to see you.
The board will now adjourn to closed session to consider one item of existing litigation, one item of anticipated litigation, and one item of labor negotiations.
Thanks, Karen. And County Council will report out. Closed session.
The board met in closed session to consider one item of existing litigation. In the matter of Arcio versus the County of Placer et al., the board heard a report, authorized defense of named defendants, and authorized retention of outside counsel. On the one item of anticipated litigation, the board heard a report and authorized the retention of outside counsel. On the item of conference with labor negotiators, the board heard a report. No action was requested and none was taken. This concludes the report out of closed session.
Thank you. So we will now take up our 11 o'clock item, Brady Vineyards annexation to the County Services Area 28.
Mr. Chair, sorry to interrupt. Todd, could you announce the announcement that came in while we were on break?
Good.
And the reason I say that is apparently the news conference didn't cover this. And so if you would be so kind.
Yeah, so
good thought.
Yeah,
Sorry.
great points. I received a message from our Director of Health and Human Services, Rob Oldham, following the COVID update, that the state has lifted the regional stay-at-home order for the greater Sacramento region, so effective immediately. So we're going to work on some messaging. We'll get that out to folks in the community. What that means is we'll move to our purple tier status that we had previously prior to the more stringent stay-at-home order. So
That's
effective immediately. Yep. So we'll have that information out to everybody, but that just came through just prior to noon today.
Yeah, thanks, Todd. Thanks, Cindy. So
Mr.
with item 5, Sarah
Mr.
Gilmore.
Chair? Mr. Chair?
Yeah.
I wonder if I could add one more thing
Oh, sure.
to closed session, is just to note for the record that Supervisor Holmes was absent. Thank you.
Right. And he will be returning sometime this afternoon soon. So we're ready to go. Sarah.
Okay, you ready for me?
I am, yes, thank you.
Okay, excellent. Well, good morning, Chair Wygant and board members. My name is Sarah Gilmore, and I'm here on behalf of Environmental Engineering Division to present the Brady Vineyards annexation. As stated in your board memo, we're requesting that the board open a public hearing to adopt the resolution, which is included in the staff report, to annex Brady Vineyards property into the boundaries of County Service Area 28, Zone of Benefit 173, Dry Creek. Vineyards is located in the northwest corner of the intersection of Vineyard Road and Brady Lane in West Placer. The development is consistent with the Dry Creek West Placer Community Plan land use zoning. The proposed subdivision is for 118 lots on approximately 32 acres. The mechanism for payment of fees in the Zone of Benefit 173 is via reimbursement agreements with the developer property owners for construction of sewer facilities that serve the area. This project is not within the boundary of the reimbursement agreement and will not benefit from sewer facilities contained in the reimbursement agreement, and therefore no reimbursement payment is owed. Staff supports this request, and in order to move forward, we request the board open a public hearing and adopt the resolution in the staff report to annex the Brady Vineyards property into the boundaries of County Service Area 28, Zone of Benefit 173, Dry Creek. And if there's any questions, I'd be happy to address them.
Thank you. I see no questions. Are there any questions from the public?
No public comment, Chairman.
Seeing none, I will open up the public hearing to hear and consider protest. Are there any?
None have been received by the clerk.
Thank you. Now we will tabulate the. Yeah. Well, tabulate the written protest, Megan.
No protest received, and without a majority protest received, you guys may move forward with this action.
Thank you. Now we, for the board, consider the resolution before.
I'll go ahead and move approval and just ask Sarah, do you know when they anticipate starting any activity in that area? Because I want to know how long I can keep walking my dog in the field behind my home.
You know, I have not seen an updated schedule, but I would expect that they are raring to go like many developers, and it would be when the weather gets good. That's just a guess.
Thank you. I guess I'll do a little bit of walking this weekend before
Okay.
we start bulldozing.
So we
I
have
made a motion.
I'll second.
Moved and seconded. All those in favor say aye.
Aye.
Opposed? Motion carries. Thank you, Sarah.
Okay, thank you.
Now we'll take up the 1110 item, which is Brady Vineyard Annexation County Service Area 28 Zone of Benefit, Dry Creek Park for Park and Trail Services. And Ted Rowe.
Yes, good morning, Chairman, members of the board, and welcome Supervisor Jones. I'm Ted Rell with the Department of Public Works, Parks and Grounds Division, and I'm riding on the tailcoats of Sarah. I'm here before you today to present the proposed annexation of the Brady Vineyard subdivision into the boundaries of County Service Area number 28, Zone of Benefit 169, Dry Creek Park area, concluding no written protests have been received. If approved, this annexation will levy an annual assessment of $611.83 per parcel, which will result in an overall savings of almost $54 from the previous assessment of $665 with the addition of these proposed 118 lots. Brady Vineyard is located on the north side of Vineyard Road, about a quarter mile west of Foothills Boulevard and adjacent to Brady Lane. This zone of benefit is providing funding for the maintenance of public recreation amenities in the Dry Creek Park area. This area includes several miles of Class 1 paved trail along the Dry Creek, which includes 4 exercise stations at intervals along the trail that were installed last year. Additionally, there are 2 public parks, Doyle Ranch Park on the west side of Olerga and Dry Creek Community Park on the east side. And these parks provide tot lots, basketball and tennis courts, soccer and baseball fields. And these recreation amenities are located approximately 2 miles to the west of the Brady Vineyard project. The project is proposing to provide additional public recreation amenities to the zone of benefit, including a separated multi-use trail along frontage of the project along Vineyard Road. And they're also proposing a 3rd-mile public multi-use trail on the west side of the project adjacent to a proposed open space. This particular trail, this 3rd-mile trail, will provide an important component for future trail connections to the communities on the north side of Vineyard Road, connecting them to the public trail system along Dry Creek. So that concludes my presentation. I'll be happy to answer any questions your board may have.
Thanks, Ted. I don't see any questions. Any questions from the public? So with that, then we will open a public hearing to tabulate votes and see if there are any protests with regards to the question at hand.
No protests were received by the clerk. The board may move forward with action.
Thank you. Now we will determine whether or not the written protests have been received by a majority of the property owners.
No, Chairman.
So we can consider the resolution.
I'll move approval.
Second.
Moved and seconded to approve the resolution. All those in favor say aye.
Aye.
Opposed? Motion carries. So
Thank
now
you.
we'll, thank you. Take up our first department item, Health and Human Service Psychiatric Health Facility Amendment, North Valley Behavioral Health. Amy.
Okay, good morning, Chair Gore. Wigand. First day. Sorry about that.
Oh, that's okay.
All right. And it's afternoon, so I was wrong all along. Anyway, good afternoon, Chair Wigand and members of the board. I'm Amy Ellis, the Director of the Adult System of Care. I'm here with an action item to approve an amendment with North Valley Behavioral Health to increase the contract by $600,000 for an overall contract amount not to exceed $1,326,000 from November 1st, 2019 through June 30th, 2021. And authorize the Director of Health and Human Services to sign the agreement and to sign subsequent amendments not to exceed $100,000 consistent with the agreement's subject matter and scope of work with risk management and county council concurrence. So Placer County began a contract with North Valley Behavioral Health in 2018 to provide inpatient psychiatric services for our residents experiencing a mental health crisis. And your board approved an amendment with the same company when they added a location in Yuba City, making their total facilities now 3. One of those is on our Kirby Hills campus. And this is the highest level of non-voluntary treatment It's meant to be short-term, often with a discharge back to the community or to a longer, long-term locked facility. A PUF can be no more than 16 beds in order to be able to bill federal and state funding for the service. Our local PUF, ran by the same company, is often at capacity, particularly over this past 6 to 9 months, since our placements have increased by over 6%. Therefore, utilization at these 3 facilities has been higher than initially anticipated and requires this amendment. Having additional bed capacity with this neighboring PUF is a cost-saving strategy because it reduces placements at facilities that do not allow this Medi-Cal reimbursement. The amendment includes the $600,000 in this fiscal year, 2021, and it's 89% in state federal funding and 11% in county general funds, all of which have been appropriately budgeted. Happy to answer any questions.
Thank you. Bonnie?
Oh, no, I just didn't turn it off.
So it looks like we do not have any questions by the board. Anyone from the public?
No public comment, Chairman.
Or the public. So what is the pleasure of the board?
Second.
Moved and seconded. All those in favor say aye. Aye. Opposed? Motion carries. Thanks, Amy. Next is item 10, employment agreement for the county exec. Kate.
Thank you, Chairman and members of the board. Kate Sampson, your HR director. Today, I'm requesting authorization for a new 3-year employment agreement with your CEO, Todd Leopold. Mr. Leopold joined the county in 2018 and will be completing his current contract this month. The proposed new agreement reflects standard advancement to the next and top step in the published CEO salary range, with a current value of $299,312 annually. Each year, the board may also determine whether the CEO may be eligible for an additional amount up to 5% of his salary based on exceptional performance in specified categories. The agreement also provides for accrual of 160 hours of vacation per year, as well as other standard benefits consistent with his date of hire and classification. The full agreement is in your packet of materials for today's meeting, and I'm available to answer any questions.
Thanks, Kate. Any questions? I see none. Any questions, comments from the public?
No public comment, Chairman.
No comments from the public. What is the pleasure of the board?
And I wholeheartedly second that, and just really want to publicly say thank you, Todd, for your hard work, especially this last year, which has been quite a year to navigate. You've done a very good job leading your team and working with our board. So really appreciate your hard work, and I'm glad you're going to be with us for another 3 years.
I'll ditto that and say that we have a motion and a wholehearted second, which I've never heard before.
Well, a wholehearted motion.
A motion and a wholehearted second. All those in favor, please say aye.
Aye, aye.
Opposed, motion carries. I'm sorry, yes, Suzanne.
I want to abstain only because I was not privy
Right.
to all the discussion and preparation, but I am in full support of Todd, so I hope
Thank
I
you.
can support him.
Yeah. Thank you, I apologize. So,
It's fair for me to cast a vote
Yep.
on something I wasn't participating in.
so
Well, thank you, board. It's amazing how 3 years goes by so fast, but I do think we've done some really amazing things as an organization. And I kind of look at this as we have a lot of foundational building things that have gone on for a number of years that we're now into the implementation phase. And I think the next 3 years, what you see is a lot of development coming out of the ground and a lot of things I think we put in place as an organization. So I'm just excited, appreciate the support as a board, and look forward to the coming years.
thank you.
Thank you.
Item 11 is procurement fleet card fuel services. Brett.
Good morning, Supervisors. My name is Brett Wood. I'm your purchasing manager. I'm here today to request your board's approval for a renewal of a cooperative contract with U.S. Bank, National Association of Minneapolis, Minnesota for credit card fuel purchases as needed in the amount of $500,000 for the period of January 1st of this year through June 31st of this year. The funding will be by the Department of Public Works and the Sheriff's Office 2020-2021 final budgets. As a little bit of background for your board, these services are used by the Public Works Fleet Services Division and the Sheriff's Office when their vehicles are not within a range of a county card lock facility or the county fuel station on site. Staff may purchase fuel at most service stations nationwide using this card, and the card company consolidates that information and provides it back to the department for ease of administration and payment. They also remove the federal excise taxes that were not applicable to the county. So the current U.S. Bank contract was extended through June 30th of 2021. The state of California has signed an amendment with this company to authorize that extension, which makes those services available to the county. Our purchasing policy allows for this cooperative procurement. With that, I'd be happy to answer any questions and respectfully request the board's approval.
Thanks, Brett. Bonnie?
I'm not used to turning off my microphone because I kept it on all last year, so I apologize. I'll work on that one.
Not a problem. Are there any questions from any other supervisors? Anyone from the public?
No public comment.
What is the pleasure of the board?
And I'll second.
Moved and seconded. All those in favor say aye. Aye. Opposed? Motion carries. Next, item 12, Public Works Franchise Area, amend the Placer County Code for mandatory garbage collection and exemptions. Jared.
Good afternoon, Chair Wygant, members of the board. Special welcome to Supervisor Jones. My name is Jared Deck, Program Manager for Environmental Engineering. I will be presenting the item for you. This will be introducing and waiving the oral reading of the ordinance amendment. Placer County Code, Chapter 8, Article 16, Section 8.16.220 requires all occupied residents to have refuse collection within Franchise District Number 3. Franchise District Number 3 is generally defined by the area within Placer County from Donner Summit to Lake Tahoe. Over time, public trash cans and commercial bins have become a primary dropping point for household trash within the district, creating a public nuisance and wildlife safety issues in the Tahoe area, in part due to the residences without the appropriate waste disposal service. Placer County has assisted with this effort by ongoing outreach to the public and by even providing reserves to pay for additional trash service within Kings Beach and Tahoe City downtown areas, adding large dumpsters along the major locations coming from the lake to help assist with that. But unfortunately, there's still been an ongoing issue. Currently, the ordinance allows for property owners who will be not using their property for one entire calendar month or longer to stop their service while it's not in use. Surrounding jurisdictions like the town of Truckee do not allow any exemptions, but Placer County is proposing to amend the ordinance to a quarter-based exemption period starting April 1st, 2021. Those wishing to claim an exemption will be required to complete an exemption form certifying the property will not be occupied in any form during the requested quarter, and the owner must notify the disposal company as required by the ordinance. If, however, the property is found to be occupied at any period during the quarter, the hauler will be billing the property owner for the full quarter that it was found that they were actually occupying the property. The specific exemption periods will have standard quarters, the first quarter being January through March, second quarter April through June, third quarter July through September, and the fourth quarter October through December, with periods before those quarters where they can actually apply for their exemption request. Those will be defined as November 15th through December 15th for the first quarter, February 15th through March 15th for the second quarter, and then May 15th through June 15th for the third quarter, and finally August 15th through September 15th for the fourth quarter. During this time period, it will allow Tahoe Truckee Sierra Disposal more time to plan for the upcoming routes they have during that upcoming quarter. So give them kind of that appropriate time to really get their plan together. And looking at the whole district, there are about 24,000 properties who could potentially have service in this area, so quite a few. And within that 24,000, there are 15,000 residential parcels that most likely will be taking advantage of this at some point if they want to. So as a note, the proposed amendment will not be affecting the current waste collection rates. And since this is an introduction of the ordinance amendment to Placer County Code, there's no request of the board at the time, but we're returning in January 26th for the actual approval of this. So at this point, if you guys have any questions, I'll happily answer those.
Yeah, thank you. Bonnie.
I do have a question. So, and I'm a little bit new to this, but tell me how it's affecting the larger public, right? So if trash isn't getting picked up at a home, and they got exempt, but it's not being picked up, how is that affecting the local jurisdiction, the local areas? Are they depositing their trash in the trash can down in Tahoe City or at Kings Beach? Is that the problem?
Yeah, so that's a great question. So what we have seen traditionally and over the past few years is just a bigger issue of trash kind of accumulating at those public receptacles. So within downtown areas of Kings Beach specifically is a kind of a larger issue, in downtown Truckee as well. I mean, downtown Tahoe City. We have seen just household residential trash being put in those dumpsters themselves, and then they're overflowing, and there's trash along the street alongside of those dumpsters and those public receptacles.
And is that anecdotal, or is that you've seen that?
So we've actually seen that happening already for quite a while.
So the concern is that because trash isn't being picked up and somebody, exempts themselves, right, and doesn't have trash pickup, then they're utilizing the home, and then they don't have trash pickup, so they're taking that trash and on their way leaving the basin, they're dropping it off someplace, and it's adding to the trash. And so the intent is to reduce that in the community.
Absolutely.
Okay, thank you.
And so, yes, so those people can apply for that exemption, and then if they don't have service, then that trash has to go somewhere. And so they find outlets for it, exactly as you mentioned.
And Jared, if I could just, you just said it's been happening for a couple of years, increasing it. I had it in my head that it was a COVID-related thing, as per a lot of other issues we've seen up on the side.
So COVID definitely amplified it, just with the amount of residents coming up and visiting. There was a larger issue that we saw, but it had been going on for a while, just seeing those issues of household trash in the public dumpsters. So it had been going on for a little while, but absolutely the pandemic definitely amplified that.
Yeah, thank you. Cindy.
Oh, I can attest to that because I used to be at Tahoe City PUD and 64 acres Forest Service property was our route. And that's where a lot of West Shore garbage was deposited as people left the basin who weren't using their homes. And it was definitely household garbage, because I would ask my staff, is that, how do you know? Well, it's all bagged up in a nice little bag, and it has a variety of things that, and it's the middle of winter, so And I don't know if my fellow board members understand that the town of Truckee did this several years ago, where they mandated, they don't even allow an exemption at all anymore because of this growing issue before COVID, amplified by COVID.
Right. So I don't know the exact implementation date of when town of Truckee did that, but they do that. So they don't have an exemption at all for that service. So everybody's mandated to have trash continuously throughout the year, and it's put on their tax roll for that.
Right. And it's on your vacation home as well as your primary, those of us that are primary.
Exactly.
And approximate cost, I was looking up my property tax bill today to see what it was. And if I'm right, I'm around $26 a month.
Yep. So for
Placer standard residence.
Yeah. So for Placer County, just for a 32-gallon container, for the full quarter, it's about $61. The town of Truckee is at $97, and then the county of El Dorado is around $87. So the county's really tried to aim at keeping those costs as low as possible.
I just must have had more garbage, because it was a little higher than that, but I do have a lot of bottles. Anyway. Need to when you're in this job. Sorry, it's in the blue bags. I had to have a little humor today, but it is reasonable in light of trying to, maintain our environment up there, protect our environment, and take away any excuses for people. They still have an opportunity to be exempted.
Mm-hmm.
I know we've received some emails and correspondence of people being frustrated about this, but this was a joint effort with many other efforts. I mean, we're also have increased the county pickups at our public spaces. The public utility districts have picked up their frequency, because no doubt this year with COVID and takeout packaging, we have experienced record numbers of visitation and trash, but this was already happening, and this is one of the many steps we're taking to try to address it. And I think we need to keep educating our public up there. Erin's nodding her head in the back because a couple of the emails we got insinuated that we weren't doing a much broader approach. This is only one thing we're doing. We did talk about also the large item pickup.
Yep.
Do you want to talk about that a bit more?
So currently there is a large item pickup that TTSD offers. You have to schedule that and you have to pay for it. We are looking, exactly as you mentioned, we are looking at possibly incorporating that into the franchise agreement, so it'd be open to everybody. So each resident would have, Town Trucking does it currently, they offer two large item pickups per year. And so we're in negotiations with that right now and trying to see if that's an option to move that forward within the franchise agreement.
We have some great local advocates for a number of these efforts who send me pictures routinely. Almost, gosh, it was like every morning all summer long of dumpsters in Kings Beach, both with large items and household trash before the visitors arrived, what was going on.
Yeah.
So they've been part of us building a solution here, and I really appreciate all staff's time and effort on this.
Yeah, and just to reiterate, it is currently available now for residents if they do call.
If they do call and pay.
Yep.
Yeah.
Suzanne?
Yeah, I just wanted to add that in addition to just the expense of garbage and stuff that people, I think the ones that are traveling from out of town maybe don't live in an area like we do where you have a lot of wildlife and everything. The big city dwellers don't realize the significance of just throwing trash anywhere because it really affects our wildlife. And when I met with the director of ag, who was telling me about the problems with when they get bears that they can't, that start breaking into cabins and houses, that they can't relocate them. A lot of people think, we can just relocate them 1,000 miles away. He says they'll always find their way back. That's if they don't disrupt the environment where we put them, number one, but they'll always find their way back, and they can't change them from doing what they do and ultimately have to euthanize them. So, anybody, if you don't want to see the cute bear get euthanized, please don't leave your trash out.
Yeah, absolutely.
So I'll open it up to anyone in the public.
No public comment, Chairman.
No public. Pleasure of the board.
Move approval to introduce and waive the oral reading on this ordinance.
I'll second.
Moved and seconded. All those in favor say aye. Aye. Opposed? Motion carries. Thank you.
Thank you guys very much.
Item 12B is a budget amendment, transient occupancy tax funds approval and appropriation of park dedication fees to the Martis Valley Trail.
Mr. Chair, I'm going to recuse on this one and excuse myself and join you on the next item.
Thank you.
And it's because my husband is under contract to design parts of this trail.
Yeah. And Andy is going to kick this off for us.
Thank you, Chair Wygant, members of the board, and a warm welcome to Supervisor Jones on behalf of the County Parks Division. My name is Andy Fisher, County Parks Administrator. The action before you today is to approve funding in the amount of $475,000 in North Lake Tahoe transient occupancy taxes and $275,000 in park dedication fees from Recreation Fee Area Number 1 for the Martis Valley Trail Project. The funding request before you today, the way we're requesting the funds is related to the next item in front of you as well. So I will have somewhat of an interrelated discussion about both items as we go forward and talk about that funding. The Martis Valley Trail is a paved trail that's going to be constructed in phases. It'll be a 10.2 mile paved pathway that will connect the community of Truckee into Placer County through Martis Valley, through the North Star community and up to Brockway Summit. And while it is an important project by itself and has been in the works for a long time, I want to zoom out for just a moment and talk about it in even its larger context, because it's part of even larger regional trail projects, one of which we call the Resort Triangle Trail, sections of which have already been constructed over several years. And that trail will connect the communities of Kings Beach, Tahoe City, Olympic Valley, Truckee, Martis Valley, and North Star, and then back to Kings Beach in a great big loop trail around North Tahoe. And then an even larger initiative for a regional trail around the entirety of Lake Tahoe, which we call the Tahoe Bikeway. It's very hard to have a discussion about these regional visions without Supervisor Gustafson's name coming up pretty rapidly. because in her tenure with Tahoe City Public Utility District, she was very instrumental in the portions of the trail that have already been built along the west shore of Lake Tahoe, from the El Dorado County line all the way up through Tahoe City to Dollar Point, already constructed from Tahoe City out to Squaw Valley Road. Very popular trail segments. So it's exciting to see this regional vision gain momentum, to see us reaching milestones. Our own Tahoe Engineering Office was able to construct a couple miles of trail a couple years ago from Dollar Point going northward. They're working on sections of trail along the Highway 89 Truckee River corridor between Squaw Valley Road and Truckee, and along the North Shore into North Tahoe Regional Park. The state of Nevada has built some impressive sections along their east shore. So seeing all of this regional vision come together that began back in the 70s, pretty exciting. And then to zoom back down into the project at hand, which is the Martis Valley Trail, a segment of that. The first 1.25 miles of trail have been built from the town of Truckee limits going out into Martis Valley to the edge of the Martis Creek Lake recreation area. On the eastern side of the Martis Creek recreation area, we have bid out, we fully funded and bid out a project that will go to construction next year. So as you're driving out along Highway 267, as you pass the golf course on your right, that segment from right there by the golf course, generally along Highway 267 up to North Star Drive, fully funded, has been bid, ready to start construction. So those sections are happening. The sections from North Star Drive up to Brockway Summit, a little further out in their development, but specific to today's request is that section through the Martis Creek Lake Wildlife Area. It's a property owned by the United States Corps of Engineers. And as Supervisor Gustafson mentioned earlier today in her comments, we reached a really significant milestone yesterday in that they completed their federal environmental review of the project through their property. And for some context, the California environmental review was completed in 2012. The North Star Community Service District took the initiative on Project E. They adopted that EIR. The county was a responsible agency during that environmental review. So we have been working with the Corps of Engineers for a number of years to get to that milestone yesterday. One of the considerations that took the Corps some time to work through was the cultural resources in the area of Martis Valley through that property. During that time, we were able to sit down with the Washoe tribe. We spent really a great deal of face time with the tribe. We began to understand what their concerns were, and I think we were able to build into that project both protections of cultural resources and also understanding the story of the tribe's history out in Martis Valley and interpreting that part of that history that they have, that rich history in Martis Valley. And I think that has gone a long way to help bring the tribe along to agreement with this project. And so that all culminated yesterday with the federal environmental review, the signing of that document. They will follow that with the real estate license, which is essentially the Corps' term for a trail easement for us that they'll be working on for the rest of the month. That segment of trail, 1.6 miles through the wildlife area, is a $3.9 million project. It already has been funded, previously allocated funds of just under $1.5 million from park fees, just under $1.5 million from tranche and occupancy taxes, and then some smaller grants. So the funding today, we believe that we're requesting will make up the completion of funding for that segment through the Martis wildlife area. We're requesting $275,000 in park dedication fees. In November of last year, the Park Commission recommended $750,000 in park fees and recommended $350,000 in park fees for the other recreation project that's next on your list. And in October 27th, your board recommended or authorized $475,000 to the North Tahoe Regional Park project, the next item on your list, in tranche and occupancy taxes. What we're recommending today is a swap for park fees for tranche and occupancy taxes recommending a reallocation of those transient occupancy taxes to the Martis Trail project and backfilling the North Tahoe Regional Park project with park fees. The reason for that, it would make both projects whole and complete their funding that they need, but it would streamline administrative burden for the project proponent of North Tahoe Regional Park, which is the North Tahoe Public Utility District, and make it easier for them to deal with one source of county money rather than two. And so it's a money swap, but the effect of both projects would be the recommended funding that they both were seeking. With that, I will turn it back to your board for any questions about this project.
Thanks, Andy. I see no questions. Any questions from the public?
No public comment, Chairman.
Thank you. So I'll bring it back to the board for consideration.
And I'm happy to make a motion to approve, irregardless of Supervisor Gustafson's participation in any of the trails projects. So in case there's any concern about there being a conflict of interest, I am supportive of this project regardless of her past participation.
Moved and seconded to approve the just discussed budget amendment. In that this is a budget amendment, it requires a roll call vote and 4/5 vote to pass. Megan.
Gore?
Yes.
Holmes?
Yes.
Jones? Gustafson recused herself. Wygant?
Yes. Thank you.
Thank you.
So item 12C, Andy, North Tahoe Regional Park Field and Pathway Improvements.
Thank you. So this item before you recommends $825,000 in park fees from Area 1, the North Tahoe Martis Valley area. I'll mention, and it is for the North Tahoe Regional Park Field Number 4 renovation and paved pathway through the park. I should mention park dedication fees are development fees paid at the time of land division or building permit. They are intended to provide recreational infrastructure in relation to increased population. Those fees are kept in geographic areas close to the people that pay those fees so that they can be invested in projects that benefit the people who paid the fees. And in this case, Martis Valley, North Tahoe is that representative area that we call recreation fee number 1, fee area 1. North Tahoe Regional Park is a 124-acre park in Tahoe Vista off of National Avenue. It's a major facility in North Tahoe for youth and league sports facilities. There are soccer, basketball, tennis courts there, picnic pavilion, a treetop adventure course up there. So all kinds of just a major recreation facility for all of North Tahoe, enjoyed by organized leagues as well as just individual families as well. Their field number 4 is an artificial turf field. It's 12 years old. It's currently 72,000 square feet. And the project that the North Tahoe Public Utility District, owner and operator of that park, are proposing is to enlarge that field. It has exceeded its life, so the turf needs to be replaced. And at the same time, they'd like to enlarge that field to 112,000 square feet. That would allow for additional sports, a greater number of sports. It would allow for tournament opportunities. And in addition to that project, they are proposing a 1,100-foot paved path through a portion of the park. The North Tahoe Regional Park will eventually be a hub and trailhead for the Resort Triangle Trail that we were just talking about. So each of the paths that they put through that park become part of that trail network over time. Again, this is part of the, your board recommended in October, $475,000 in transient occupancy tax. Again, we would recommend, and you just approved, that that goes over to the Martis Valley Trail, that we backfill that with park fees and have one complete funding request to make up their funding package of $825,000 in Area 1 park fees. This is for a total project cost of $1.7 million. So county money would be $825,000. The utility, North Tahoe Utility District, has come up with the rest of the money from their own independent sources to complete the funding for that project. And so with that, I will turn it back to your board with the recommendation of $825,000 in park fees for both of the field and the trail project at North Tahoe Regional Park.
So Andy, does that cover both the authorization of the agreement as well as the budget amendment, or do we need to take those separately, Karen? Or we We can take them together.
I didn't read the
we're set,
item,
Andy.
but the item formally requests each of those items.
Got it.
Included, yes.
So any questions, Bonnie? Robert? I see no questions from my colleagues. Is anyone from the public have a question?
Jeff, go ahead and give your comments for the record.
Thank you. Hi, everyone. Jeffrey Hentz, CEO, North Lake Tahoe Resort Association. Again, board chair and esteemed board of supervisors, I wish to comment in support of agenda item 12C and really also ties in with 12B for the North Tahoe Regional Park Field and Pathway Improvements. NLTRA is a co-chair with Placer County of the CAP committee, which is capital expense project, and we are fully supportive of this agreement to fund this project. Very excited about it and couldn't be happier. That's all. Thank you.
Thank you.
No further public comment.
No further public comments. I'll bring the item back to the county, and it is to approve the discussed agreement as well as the budget amendment.
Move approval wholeheartedly.
Moved and seconded. We need a roll call vote, please.
Gore?
Yes.
Holmes? Jones? Yes. Gustafson?
Yes.
Wygant.
Yes.
And I just wanted to say, great job from staff as well as North Tahoe Public Utility District. This is such a well-used facility. Great for our community.
Thank you very much.
And item D is Crosby Harold Road over Doty Ravine Replacement Project.
Yeah, that's right.
Matt.
I'm the Public Works cleanup hitter today. Happy to be here. Matt Randall with the Public Works Department, Senior Engineer. Thanks for having me. We have three interesting action requests for you to consider today. First is to adopt a resolution to approve an update to the Placer Central District of the countywide capital improvement program to add the project, this Crosby Harold Road at Doty Ravine Bridge project, with no net increase to the fees. The second action is authorizing the Director of Public Works or designee to request advanced construction authorization from Caltrans and to use local funds to construct the project until federal funding is available. And then finally, the last action is to adopt a resolution to approve the plans and specifications for this project and authorize, the Director of Public Works or designee to advertise for construction bids. So just want to hit some main important details with this project. Crosby Harold Road, rural road out on the western side of portion of the county. There's a 75-year-old bridge which is deteriorating. It's had a history of scour issues, and it's really at the end of its service life. So we're proposing to replace this bridge with a single-span concrete bridge on approximately the same alignment. We have some roadway geometrics that we're proposing to improve. The road is kind of on a kink, so the roadway geometrics we're proposing will improve safety, lanes and shoulders. It's a rural road. It's a smidge over, I would say, like a one-lane bridge, so that we'll be putting in a two-lane bridge, and which meets all current standards. So the project is ready to advertise for construction. The estimated cost is $4.1 million, which normally would be reimbursed 100% with federal funds as we complete the project. But unfortunately, federal funding is not available for us to proceed right now because the bridge program, which really we use in all the districts to build our bridge projects, is oversubscribed. So really the purpose of these actions is to allow the department to proceed with construction using local funds, minimizing any potential for cost increases if we waited for federal funds, which could be a significant amount of time, and shelved the project. And also it prioritizes funding for this project over other agencies who don't use advanced construction. So a couple more details here. I just want to, because there's a lot in this action request. The Placer Central Benefit District update attachment 2 shows all the changes in bold. And so you'll notice we're adding the project to the CIP list, and then we're actually and the costs that are associated with the Crosby Harold project are offset by a reduction in cost for the State Route 193 project. So there's no increase in the net in the associated traffic fees. The second action, as I mentioned, advanced construction. Basically, it allows us to proceed with the construction phase, federally reimbursable work using county costs or using local funds, fronting the money essentially until federal funds become available. And at that time, we'll be reimbursed. We've used advanced construction on many projects in the past. There's several listed in the board package and the board memo. And as I mentioned, the main advantage, if you want to get into the details, we actually included as the attachment the Caltrans policy of how they prioritize funds, but advanced construction funds are always the first to get reimbursed. And then the final action is, as I mentioned, asking you to approve the plans and specs and authorize us to bid the project. So after we receive bids from contractors, we'll come back during just using our normal process and request your consideration to award the contract. At that time, we'll present details of the construction loan. And what we're basically anticipating, the worst case scenario would be $4.1 million borrowed from the countywide traffic mitigation fee program and then reimbursed in the worst case in January 2024, so 3 years. So the details of the loan, which district we borrow from, those types of items, we'd come back and provide those when we ask for your approval of the construction contract. So with that, happy to answer any questions.
So since this is in my neighborhood, when do you expect to start and finish the project? Because I'll get some questions on that.
Yeah, right. So we would advertise the spring, start construction this summer. The goal would be to finish by the end of the year. The end of the calendar year. It could extend into next year, but at that time the road would be closed with the detour. So
thanks. I'll just give a quick shout out. Thanks to Public Works generally for we've just had huge value from the federal bridge replacement program over the years. And
yeah,
this one we have to front the money, but it's what a valuable project it has been to us in Placer County.
Yeah, thanks. Yeah. Appreciate that.
Any other questions or comments? Anyone from the public?
No public comment, Chairman.
Public comment. What is the pleasure of the board?
Second.
Moved and seconded. All those in favor say aye. Aye. Opposed? Motion carries.
All right. Thank you.
Item 13 is an ordinance amending the Placer County Code entitled Parking.
Yes. Hi. Good morning, Chair Wygant, members of the board, Mr. Leopold and Ms. Schwab. I'm Melissa McGee, Staff Services Analyst with your County Executive Office, and I'm here today. Sorry, technical difficulties here. I'm here today to ask your board to introduce an ordinance which will amend Placer County Code Chapter 10 to enact certain parking restrictions on county roadways and properties, which I will outline later in this presentation. With me today online to support are members of the committee, including Becky Riggin, your Deputy County Executive Officer, Lori Morse of Facilities Management, Amy Ellis of HHS, and Sergeant Kevin Griffiths or Lieutenant Connie Smith of the Sheriff's Office, who will all be available to answer any questions your board may have. I would first like to note that there was a small change made to the ordinance on Friday, which affected page 4, section 5, part 9C, where the words "on the Placer County government campus" were deleted. The version online has not yet been updated, but you should have the current version in front of you in your hard copy.
The version online was updated Friday. It's under additional documents on the website.
Thanks, Megan.
Okay. All right. Thank you, Megan. The proposed ordinance before you today is the solution agreed upon by a work group, which included representatives from several county departments that formed to discuss concerns related to vehicles being parked overnight on certain county properties. These concerns included the negative impacts overnight parking has on public, vendor, and employee access to county buildings, as well as those vehicles being a target for vandalism and presenting a threat to public safety. The proposed ordinance would prohibit parking between the hours of 10 p.m. and 6 a.m. at several county properties, including the PCGC campus at DeWitt, the Tahoe City Administrative Center, and the Kirby Hills location, among others. The full list of properties will be included in the resolution, which will be brought to your board on January 26th with the proposed adoption of this ordinance if your board chooses to take action to introduce this ordinance today.
A draft copy of the resolution was included in the board packet for today's item. However, additional properties are still being considered by staff. Exemptions to the restrictions of the proposed ordinance would include county vehicles and emergency vehicles, as well as certain staff, vendors, and other authorized parties who may receive permits allowing them to park overnight on the affected properties. These permits would be issued at department head discretion as needed. The proposed ordinance will also prohibit parking between the hours of 2 a.m. and 6 a.m. at 2 park and ride locations at Ophir and Meadow Vista Clipper Gap, and will forbid parking at any time along 2 parcels on West River Street in Truckee. They're referred to as the Henriksen parcels. Enforcement for this proposed ordinance will not occur until signage is in place. Staff are currently working on the final list of properties to be included in the resolution, which will accompany the adoption of this ordinance. Once all affected properties are known, staff can determine the cost of signage, enforcement, and parking permits. And we will come back to the board to provide an estimate of these costs when we return for ordinance adoption. And with that, I conclude my presentation and welcome any questions you may have.
Thank you. I see no questions, Melissa. Anyone from the public?
We do. We're getting them on the line right now.
Susan, go ahead and give your comments.
Hi, I'm Rabbi Susan Conforti of Placer People of Faith Together. I'm not on the line right now.
You are on the line.
I'm sorry. I have a friend who lives in Chico and works in Placer County and can't afford an apartment here in Placer County. He has to sleep in his car. And I'd like the powers that be to protect him rather than move them along. Our spiritual texts are very clear about this, that you shall not harm a stranger nor oppress him. And you shall love the stranger as yourself. Thank you very much.
Thank you.
We just lost the second caller.
Well, we had a second caller, but we lost him, so I will bring it back to the
No,
board.
we have one more caller on Zoom and one more sign up. Beth Gonzalez, go ahead and unmute your mic and give your comments.
Hello, my name is Beth Gonzalez. I am member of Placer People of Faith Together. And if we are going to prevent people from parking so that they can work here in Placer County and live here in Placer County, then I suggest that there be alternatives, safe places to park. There are other counties, among them Santa Barbara, San Diego, and many other counties, that have safe parking programs. So I would really like to know what the alternative is. You're closing off public parking. I suppose it's probably semi-public parking because it belongs to the county. I don't really know the rules for that, but I think that if the Board of Supervisors is going to prevent people from sleeping in their cars so that they can work and live, period, there's a message you're sending to a lot of poor people. There are many people who are sleeping in their cars because they don't have a home right now, or don't have a home during the week or while they're working. I actually know a person who sleeps in his car. He's a caregiver. He works for 2 different caregiver agencies, and he sleeps in his car before he goes to another appointment in the morning. So we are going to be affecting many people who are out there working. So I'd like to hear an alternative situation. How are you going to protect these people, save these people? Are we saving asphalt? What exactly are we saving? So I'm hoping that you will dig deep into your heart and your souls and think about what's happening here. Thank you.
Joe, go ahead and give your comments for the board.
Isn't someone still talking?
No, go ahead and turn your computer off in the background.
Oh, okay. Just a second. Hello?
Yes, go ahead and give your comments.
Yes, my name is Joe Kellogg, and I'm a resident of Granite Bay, and I'm a member of Placer People of Faith. I would like you, Board of Supervisors, not to accept the recommended ordinance as recommended in full. I would like you to please consider investigating safe sleep options. There are currently in Santa Barbara, San Diego, and Los Angeles more than 20,000 people sleeping in their cars in such safe sleep designated areas. There are lots on church properties and on county properties and on some vacant city lots. Could this study please look into such alternative safe sleep programs that do exist and are viable, and one has been in existence for more than 20 years. This option to me makes a lot of sense, and I hope it will to you. Did you know that 2 years ago, when Sierra College had students on campus, that there were over 100 students sleeping in their cars overnight on the campus itself? Now, as numbers are currently increasing for people to be without jobs and more people moving out of their cars, it is anticipated that there will be an overflow of, for example, such students that will be in the streets or perhaps even in the park and ride areas. I don't know that. I can't guarantee that, but they will definitely be somewhere off campus. So that is just one example of a community of people needing safe sleep areas. And so I ask you to please give a wider study basis to this issue so that the county isn't in the unconscionable position of shutting down locations with to overnight parking with, in this ordinance name. Please,
Thank you.
simply do not stoop so low as to criminalize poverty. Thank you.
Chairman, we have no more public comment. Okay, I'll bring this item back to the board for action and perhaps any comments or.
I had a couple questions. I missed my opportunity earlier, and I know Becky, you're in the room too. So Melissa or Becky, I have heard a lot of concerns about where these folks will relocate to, and I've received these emails about the population that's up there, and I'd like to know if we know more about them. We don't have adequate restroom facilities. The businesses of North Auburn have been reaching out to me since I joined the board about the public hygiene and lack thereof in that vicinity, and the growth has not appeared to be Placer County residents that are working and trying to be there and trying to serve our community. In fact, it's others from out of the area, and that's one of our concerns. Not that we don't care, but this is not a site for them. We're not adequately staffed or have those services. So I guess my question is, first, what are our plans to, if we move forward with this ordinance and start to enforce it, how do we know where these people are going? Are we just pushing our problem onto the city of Auburn's porch, or what do we know about these individuals that are there? Has the task force dealt with that? Oh, Supervisor Holmes probably knows all the answers to this.
Well, I don't know all the answers, but the problem has grown, and Sergeant Griffiths is on the line with Sheriff's Office. They know that some of these people are coming from out of the area. And, we can turn a blind eye for 2 or 3 of these, but now it's grown. It's a whole population. And we have to remember that this is a parking lot for our employees. And now that we're in COVID, a lot of those employees are working at home, but when they come back, they will be utilizing that parking lot. And also, it's a parking lot for people that do business with the county. And so that's a problem there. Again, it's expanding. It keeps growing every time I go out there, and it's something that I have to deal with because I get people calling me all the time. So I don't know where those people are going to go, to be honest with you, but the ones that...
Do we know much about who they are? I mean, we know some of them have come from out of the area, but does the task force interview them or...
And maybe Becky, in addition to that, add on to what problems we have seen, because it's really risen to, there's some problems and we haven't addressed what's happening there in the parking lots. If you could add that.
So Becky Regan from the County Executive Office. We have been having discussions with the broader representation from the departments on this issue for a number of months. And what I wanted to add at this point in the conversation was that one of the things that's really motivating our recommendation of this ordinance for your board is the fact that, as your board is well aware, we have several construction projects that are underway at DeWitt. And this really is a health and safety issue for those folks that are parking there, as we have construction equipment coming and going and things like that too. So that's a large part of the reason for this effort right now. To answer your question, I will turn it over to the Sheriff's Office for a moment to respond in more detail. But yes, our homeless liaison team, which is comprised of sheriff's deputies, health and human services practitioners, and probation department, are very familiar with these folks. Several of us have done ride-alongs with them and spent the morning with them, and they are on first-name basis with these folks. They know where they're from. They know what their challenges are, and we continue to try to reach out to folks and offer them opportunities, programming opportunities that HHS provides. So, is a sergeant on the line? Maybe I'll turn to him to explain some of the challenges. He's far more familiar with them.
Sergeant Griffiths.
Good afternoon, Board of Supervisors. Thanks for having me on the line. This is Sergeant Griffiths. I currently run the homeless liaison team that you guys have so graciously sponsored. We have 4 deputies, 1 probation officer, and health and human services workers that go constantly out with us every week. DeWitt is the priority. We're constantly out there working with the homeless, trying to provide them with services, trying to get them out of the streets, into housing. Mercy Housing is already slotted to take 8 of them off the streets. The shelter is also there. As far as the vehicles, we have multiple RVs, we had a boat, we had a car last week that was up on blocks. Where they are going to go is not an answer that we have. Where we tell them they can go is that there's a shelter and services that are provided by different churches and nonprofits. HHS works closely with us in contacting all those individuals. I can tell you this, that we're on a constant basis contacting them every week, if not daily out there. The people that you see staying in the cars are not the people that are coming out of town to work a job and stay in that job. We have yet to find that here on the DeWitt campus anyways. I'm not saying it's not happening anyplace else, but they are people that are coming and staying. They are offered services as far as the shelter is concerned, where they can go, the help that they can get. Unfortunately, if you drive around DeWitt, you'll see the amount of trash and whatnot that's out there. And a lot of that is the broken down vehicles, and it has grown just over the last 6 months. I remember when we had our first couple of RVs out there, and now I think we have half a dozen just in the B Avenue location. We're not out there to hurt anybody or to overly enforce. It's more of an education. Let us help you get into services. That is truly what our team is here to do.
If I might also turn to Amy Ellis, we recently conducted an update assessment of all the services that we do have available through Health and Human Services. And Amy, I wonder if you might speak to some of those.
Sure. Yeah, I would echo what we just heard, which is these are known individuals to us. We absolutely are outreaching, offering services, not only other alternative locations such as shelters and housing, but treatment options as well for those who qualify. There is a variety of resources that you guys are well aware, because I come to you often with all of our resources through contracts. But then we also have county operated services as well that you might not hear as much about, but we still try to keep you guys updated of all the things we offer. We did comprise a variety of how many actual beds we have, and that it's not a one-to-one ratio of like how many homeless to how many beds, because there are eligibility requirements. We educated this group on that, but we also feel like we're continuing to expand that capacity and working as a team. And related to the DeWitt campus, we're going to be committed to continuing to work with them regardless of where they park their car at night. We'll continue to know them. We will continue to outreach. Many of them do not take us up on our offer for help and treatment. And so I will say that while I have a huge heart for this population and would like to see all of them be able to enter services and get into housing, there is a subpopulation that, even my staff are supportive of being able to have alternative options in working with law enforcement.
I appreciate that. I'm concerned that, we start enforcing this and we push the problem to other partners and community members and community areas, although we are bearing the brunt. The North Auburn area is bearing a huge brunt of this situation right now. I just want us to stay alert to that and help in any way we can, our partners at the City of Auburn, and just making sure that we've coordinated well as we move through this, and keep a watchful eye out that they don't just go into parking lots of commercial businesses and do the same thing, or private individuals. So my main point's there.
You don't see them at Bel Air Market or Home Depot or the other parking lots where there's businesses, because they don't allow it. And we should not allow it because we actually run a business. We provide services for our county, and those that don't choose to partake of them, we can't help them.
And I agree, Jim. I mean, I've come out of evening meetings up there, as you know, and it, for the public or for anyone else, you're concerned, because there are people that are there after hours at dark.
The dumpsters are there for cardboard and newspapers, and they get filled up with everything. And then if they're full, they just throw it on the ground, and it's just not safe. It's not healthy. You just can't let it go on.
Supervisors, if I may interject just for a moment.
Sure.
I just wanted to clarify that the ordinance, while it does impact the homeless populations of folks parked overnight in their cars on the DeWitt campus, that was not the intent, the main intent of this ordinance. This was brought up for a variety of issues in parts of the county that are not seeing the impacts of homeless folks parking their cars. This is a health and safety issue, and also just an access issue at many of our county locations. Like I said, I brought up Kirby Hills earlier. They've had issues with not having enough staff parking because folks from neighboring businesses are using their parking lots and parking early in the morning or leaving cars overnight. So I just wanted to clarify that while this ordinance will, impact the DeWitt campus, it's a broader conversation about the safety and targeting of vandalism and whatnot of vehicles being parked overnight countywide.
And occasionally there's at the park and rides that the county is responsible for, there's motorhomes that camp there overnight and they stay there. And so it's unhealthy for the people that park their cars there.
Well, our admin center in Tahoe City has that in the summer months, especially.
It's a challenge. It's a societal issue. I wish we could do more, but we can't allow it to go on because it just keeps growing.
Right. And I think at some point we have to have further conversation about policies and things that we need to do to address the homeless issue, right? We have a homeless shelter, which is really terrific. And we have services that Health and Human Services provides, Amy, you and your team, all sorts of services. But, we're seeing an increased issue. We certainly have to address affordable housing. And, we've talked a little bit about how do we work with our churches to provide temporary housing on some of our church sites, right? That's an opportunity. What are the different opportunities that we can help address providing places for people to live? I think that's really important. And I think that's something we really have to start taking a bigger look at. We don't want people we don't want to continue to see just piles of people in tents, et cetera. That's not healthy for those folks. Our community doesn't like it. It provides safety concerns. But we do need to look further at what we currently provide and what else we might need to do as we move forward to address this issue.
Yes, I completely agree. And having a comprehensive strategy and thought through strategy will hopefully, all the work and all the knowledge we have and the incredible dedication of trying to assist these folks. I really appreciate that from all our staff.
We're working with the Sheriff's Office. We're working with Health and Human Services. We're working with probation. County Council is involved. Morgan Geyer, the district attorney, is involved now. And so it's a difficult nut to crack, but we really have to, if you push something here, something happens there. So, but this is a critical issue for the people that work for Placer County and the people that use our services, come to use the business. So I move approval of this item.
Second.
Been moved and seconded. All those in favor say aye.
Aye.
Opposed? Motion carries. Thank you.
Thanks, Becky. Thanks, guys.
So our
Thanks,
last item of the day is the 2021 Board Commission Committee assignments. Normally, we focus on those where there might be wanting of change. For the public, most people don't realize we have about 10 to 15 additional committee assignments as compared to just being a member of the Board of Supervisors. So they cover a broad range of organizations and issues. So with that, if my proposal to the board is if we can kind of focus on where there might be a fewer number of issues to focus on changing up as compared to talking about each and every committee assignment. So we're not here for the rest of the night. That would be my pitch. And with that, I think I'll just open it up to my colleagues and see what they have to say. So, Bonnie.
Oh, it's still on, but okay. Thank you. There's a couple of committees that I would, we have open committees because Supervisor Euler is no longer on. There's a couple of committees that I would be interested in serving on that Supervisor Euler was previously on, and I have an interest in doing so. There's also a committee that I'd like to be happy to pass along to another supervisor since it's a timing issue. So LAFCO is an issue is a committee that I've served on this last 2 years, but the timing for me doesn't work that well. So if somebody would be interested in serving on that. I am interested in serving on GSAC, the Greater Sacramento Area Economic Council. My interest in economic development, as well as this year, I am going to be the new chair for SACOG. And the work that SACOG is doing with GSAC, I think it's a really great opportunity for Placer County to be represented. For me, as I serve as the chair of SACOG, also serving with the GSAC board, I would appreciate that opportunity if there's interest in y'all doing that, allowing me to do that. The other is it's no longer PCCP, it's the PCA, the new board. And I'm currently an alternate. And I think I'm interested in serving on that because of all of the growth that's happening in Western Placer County, particularly right alongside my district and partially in my district as well. So that's the reason I'm interested in serving on those two boards. And then the PCA, the Placer Conservation Authority. That thing that Robert and Supervisor Yeller worked on for a very, very, very long time. But those are my interests. And then I know Supervisor Jones that those were currently Supervisor Euler's. There are a couple of committees that, I don't want to hog all the committees because I really do need to share the workload. But there are a couple of committees of flood control committee, as well as the audit committee that I'd be happy to share, but I want to have that conversation.
Sure. And then Suzanne, you had your light on next.
Yeah. Actually, I wanted to say that I did a little bit of homework, and I did look over the past to the newest supervisors. And when Bonnie came on, you assumed all of the boards and commissions of your predecessor, and the same with Cindy. When she came on, she assumed all the boards and commissions of her predecessor. So I kind of saw it a little bit as a precedent setting, number one, sort of assumed that I would be doing the same. So I did my homework on it. And because my constituents elected me to represent them, I feel like it's in the best interest of my constituents to represent them at all levels, not only just here, not only District 4, but on all the boards and commissions that Kirk formerly represented them, because their interests were in replacing my predecessor. So I feel a little bit of an obligation to fill his seats in representing them. And the other thing too is, traffic is a really important issue in my district. In case any of you have traveled down Auburn Folsom Road, Douglas, Sierra College, Eureka, they're all like highways now with all the traffic that travels between Folsom and Placer County. And so my constituents are very interested in traffic, as well as economic development is a particular interest to me and my constituents, who asked me to stay on that for them, because it was one of the main focuses in my campaign to my constituents. So all I know is, when I first came on, I was given the list of boards and commissions that he represented, and I feel like a good fit for all of them. And so, I don't know.
And may I follow up? Because I appreciate
Sure.
that. I do know that when I came onto the board, I did take Supervisor Duran's, but not all. And I also actually asked Supervisor Holmes, and I took something from you. What was it? Oh, CSAC, as well as LAFCO were two boards that I actually asked for because of my interest. So there's a little bit of some of that changing around,
Right.
and especially when somebody's new, there's not as much of an opportunity to give things up. Which
Right. Well, actually, when I joined, just for clarification, we had people that weren't on the board serving on some of those committees, and that transition took over a year for me to assume some of those. So it doesn't happen automatically, and in fact, it's more camaraderie and workload spread, I think, as to the committee assignments, and they change and will change. So I appreciate that both of you are interested in some of the committees, but looking through the committees, I was willing to and was interested in LAFCO when Supervisor Gore said she could give that up. I think there's a lot for me to learn in local government and would be happy to serve on that. But I don't think there's any assumption on committee assignments. If somebody else wants to serve on Tahoe Transportation District. Oh, maybe not this year, but next year.
Be my guest on that one.
No, I didn't mean that.
All
my counterparts up there.
Mr. Chair, if I may suggest.
Yeah, we're going to go through give everybody a chance. And if we can kind of focus maybe on, at the end of the day, a majority of the board members are going to determine who's on each and every committee. And my most important commitment right now is to make sure we don't vote on each and every committee assignment, but maybe almost all of them, and then a few where there may be room for consideration of changing. And I've got a couple that aren't, if I'd be willing to make a couple of changes if everybody's willing, and if not, so we can kind of focus on that first. But go ahead, Jim.
Well, I just thought we'd go down the list and then work it from there. That way we don't get confused. So I suggest we start with the Air Pollution Control District Board, which you and I are on. Kirk Mueller was on it. So I think that would be a good board for Suzanne, unless you want to be on it.
No, thank you.
So air pollution control, you'll take that?
Yes, Mr. Euler had it, I'll take that, yes.
Well, I think that ties a lot to transportation as well. Yeah.
Then we'll move to, okay, we're settled on that one, right?
Yes.
Okay, so now Area 4 Agency on Aging, the primary member is vacant. Supervisor Jones, is that something you'd be interested in?
You know, not really. I served on the Older Adult Advisory Commission for 6 years. And in fact, this Area 4 Agency on Aging has been vacant for about 4 years.
Well, we always have a.
Yeah.
Or
Or is it a county staff member that fills it?
Eldon
So,
was there,
yeah.
I thought, so.
So it would not, like I said, I had a 6-year commitment to the Older Adult Advisory Commission, so I would rather take something more relevant to my constituents. My constituents are younger than me.
Well, I've been on it for 16 years, so I think it's time for me to.
Well, we all take some we want, and some we need to.
I'm the alternate. I don't go all the time because we're busy,
Yeah.
but we do have a
Staff
representative.
takes care of it.
Colby Hyde.
Yeah.
Auburn City Council, that's good. County Audit Committee, you want to
Well,
say?
and I'm happy to serve on it. I'm happy to serve on that one unless there's some, willing to switch and change, right? Because I'm on it now. It's not a problem, but if there's an opportunity to switch out one of the others, like GSAC I mentioned. But we can get to that later.
Okay. Criminal Justice Policy Committee. Now that Supervisor Euler, or former Supervisor Euler was on that. Do you want to take step?
Sure, I'll take it. I feel with I'll just say with my legal background, I'm probably suited for it.
Okay.
And that's one that I would be interested in if somebody wanted to give up that, but if they don't, I'm happy to not, sure.
And I'll go on the waiting list for that too at some point in the future, as we alternate.
Well, I'd like to stay on it for the time being.
Yeah.
So if it, okay, Consolidated Oversight Board, I think this one's good. We're still good with that. CSAC, you still want to do that, right? CSAC? Yeah, and I want to be the alternate. Economic Development Board, Whiteman, and you're both okay on that?
I am. If Suzanne's interested in economic development, maybe this is a good place for her. I would just ask that we coordinate on Tahoe issues because they were happy I was.
I believe that your districts are built into the bylaws on economic development.
Oh, they
Correct.
are.
So,
You
yeah,
are-
sorry.
Darn, see,
You're the
designee.
Correct.
Sorry. Okay.
I actually didn't know that. Thank you.
I didn't know that either. Okay.
That's interesting.
First 5 in Children and Families Commission, I'm fine with that. I've been on that for 16 years. Flood control, that's basically in the lowlands.
And right, and that's the one I serve on that with Supervisor Wygant. It's another I'm happy to continue to serve unless there's an interest in swapping one out.
That'd be one I'd be willing to swap out if somebody wants it. But I'm happy to stay.
Golden Sierra Job Training, Kirk was on that. Is that, Suzanne, do you feel comfortable doing that one?
Yeah, I'm comfortable doing it. Could be a negotiable one if somebody were interested in it, but yeah, I'm comfortable with it.
Okay. Golden State Finance Authority, that's part of RCRC. I'm on that, and so is Supervisor Gustafson, alternate. So here's the one, Greater Sacramento Area Council, Economic Council. Is that the one that you were?
That's the one of interest.
Well, why don't we move Bonnie to the vacancy and put Suzanne as the alternate? Is that
Fine with me.
appropriate? So that because she's already been the alternate and been involved, does that make sense? And that way it gives you a year to be the alternate?
Well, I don't really need a year to get up and running, but the other thing too that interests me is I grew up in Citrus Heights in the greater Sacramento area. And I know it involves a lot more than just Sacramento County. It involves the whole greater Sacramento area. So, I don't know what capacity an alternate serves. I would rather not be an alternate. because you don't have any voting authority or anything like that.
Well, I think what I'm trying to get to is we're all giving and taking here,
Right,
right?
right.
Not, I mean, there's definitely ones none of us really care about. And we have to take, maybe we all have to take, we'll rank them, which ones we have to take versus want to take.
Yeah, I know, but
But
I counted them as well.
Yeah, and so as
Kirk
far,
had fewer than other members.
but as far as the number, it's really the amount of time, I would say, and the
Yeah.
energy put in,
And so Suzanne, I know your interest, and honestly, it's something of very much interest to me. And although it would have been something that I would have served on, and actually what's interesting is I think Supervisor Euler served on it because, I don't know if he was chair at the time or he just is the economic guy. Maybe he wasn't that. In the cities, it's the mayors serve on it, and I don't know about the counties. But I am interested in serving on it, and I do feel like it's a really good marriage between my role at SACOG right now. And I don't have to serve on it forever, but I would like to at least serve on it for the next 2 years.
And how long is the term on as a chair? Is it 1 year at SACOG?
Thank goodness, yes. Just like being
Well,
the chair of the Board of Supervisors.
I can agree that that would probably be the best fit for you since you're chair of SACOG. And there's what, 32 members of SACOG?
A lot.
Well, there's a lot. And I think, it would serve us well if you took that slot, no offense, but I think since she is the chair of SACOG, Sacramento Area Council of Governments, was a handful of being the chair of that.
Right, that's what I'm thinking. It's going to be a lot more workload with being the chair in addition.
Well,
I think on that one, there would be some synergism between the chair and that position, at least maybe for a year. I understand your interest in that, but it's just very rare that those stars align where somebody from the county would end up being the chair. And
I'd be willing to consider it if maybe I could get on it in a year.
well, every year
every year we go back through this.
Yeah, usually, frankly, you're accurate in the incumbents. Typically, we don't make a lot of changes during the year until there's a change. In this case, with you coming in, but that is one that I think intuitively, at least for the next year, seems like the county would benefit potentially with Bonnie's position as chair.
Well, then I'll take the alternate if I can. That way I'll get up to speed in a year.
Right, yeah, and you can attend the meetings as alternate.
And if Bonnie is gone as an alternate, you actually do vote. You do have the voting position as the alternate.
Thank you.
All right. Highway Joint 65, I don't think there's a change there. Local Agency Formation Commission.
I was willing, Supervisor Gore said she would leave and I was willing to join that one, but I don't have to. I'm willing to defer if someone else wants it.
What's your?
I will defer to Cindy if she'd like to have it, if it's open.
And LAFCO, okay.
Let's go with that.
Local RAN, that's me. Mental Health, Drug and Alcohol Advisory Board, anybody want that? I'm good. Middle Fork Finance Authority, I don't see any need to make any changes there.
I've only gone once as the alternate, but.
What?
I've only gone once as an alternate.
Oh, well, you did a good job.
Yeah, I heard you did a good job.
Mountain County's Water Resources, I've been actively involved in that. National Association of Counties.
That's another one, Suzanne, if you're interested in being the alternate on that one. I haven't yet attended anything, but.
Sure, if you want to give it up, I'll take it.
Right.
Alternate.
And maybe there's an opportunity for that one as well. I have not had an opportunity to serve and participate in NACO. And that might be of interest in the future. Yeah.
Yeah, and just for everybody's information, they have NACO as an organization, and then we have a Western Regional group that gets together on an annual basis. If that's something of interest, usually they do it in the spring, late spring, May. So your participation, I think you can get involved even as an alternate pretty significantly if you'd like to.
Okay, that's good.
Yeah, and those, they have generally an annual meeting and then some kind of a meeting in at DC where they have a conference. So, and anybody can go. You don't have to be the delegate. Anybody can go to those.
Okay,
I'm
sounds
waiting for the
interesting.
one in Hawaii, but they haven't done it.
Yeah, then you all want to go.
Let's see, Older Adult Advisory Commission. You don't want to be on that?
Oh,
Come on.
No, Mike, I'm sorry. I
I've
worked,
been on it for
I did a
16
lot of
years.
things on the
You got a
OAAC. I mean,
Yeah, but
I attended every
You're our most
meeting.
representative
Not
supervisor.
just,
Oh, ouch. But you're the dean. You are the dean of the board, so.
I'm right behind you, but you don't ever want to pass up an opportunity like that, I tell you.
yeah.
My husband asked me to let everybody know that the bottles in our garbage are medication bottles.
Oh, yeah.
Sorry. He texted me, what do you say?
Pioneer Energy, that was one of Kirk's, is that,
I'm negotiable if somebody would like to take Pioneer Energy. Any takers?
Well,
Don't
I
say
originally
that.
was interested.
You guys are giving me
The
the-
problem with Pioneer for me is that my district primarily is
yeah.
the city of Roseville.
I
And
see.
I was interested in doing it, but at this point, I have very few residents in my district that are on Pioneer.
Right, and actually, I have a large part of East Roseville, so that's going to put,
You do.
almost half my constituents in the Roseville electric also.
well, we meet, I think at 3:30 on Thursday. And it's difficult for Supervisor Gustafson.
I'll stay with it.
Okay, good. You owe me one. Conservation Authority, you're going to be on that, right?
Well, that's the conversation. I mean, I just look at it and it's not so much of like I have to, because it's more of the area I represent is closer to all of these projects, right? They're in our backyard. City of Roseville butts up on it, and so that's the interest. It's not so much about like I have to do it. It's more of thinking about locations. Like I serve on the Wapanem board because
Right,
the dump is near the border of the
right.
city of Roseville.
Yeah. No, I agree. And my district goes all the way up to Blue Oaks. And it also crosses over. It's on both sides of 65. It's a big chunk of Roseville that I have. And, I have probably most of the environmentalists in my district, not in my district, very vocal about things. And so that's why I would have an interest in serving that, but we can arm wrestle after the meeting.
And Robert, you're the one who's sat in on this, and so I'm okay either way.
Well, maybe a little bit of background that might help.
Yeah.
I feel it's important that I'm on it because about 85-ish% of the reserve area is in District 2, and that won't change dramatically even with redistricting. But about the same amount of new development covered under the conservation plan is also in my district. So I think whoever is in this position should, unless those boundaries change dramatically, have that seat. So the coverage, so the conservation is going to occur mostly on the valley floor, somewhat up into the foothills for the conservation. The development that's covered is in the city of Lincoln and in the county out on the west side. So if that helps, and this is an important year because it's a startup year for this new business startup. Essentially, it's the implementation of this conservation plan where the authority will essentially be putting in place our organizational structure and doing transactions that focus mostly on delivering the permitting that requires the mitigation, the conservation, and then taking that conservation into custody under the conservation plan. So, but it's a foothills and valley floor perspective for sure, if that helps with either one of you.
Well, I mean, if
That's
it's,
okay.
I hadn't thought about
You
it.
can take it. I'll let you have it.
I mean, I hadn't even thought about the fact you're right. Roseville, your district comes up like that. It'll be even interesting to see what happens after.
You have to redistrict.
But
yeah.
either
That's
way,
okay.
it's fine.
You go ahead and take it.
Thank you.
You'll thank me later.
Yeah,
Well, then, Suzanne, do
I'm
you want to be the alternate? Would you?
Sure, I'll be the alternate.
And then, of course, it's 20 years of detailed negotiations, so there's definitely a lot of technical stuff to learn. And I would encourage you, if you can attend the meetings.
I will.
There's a ton
I
there,
will.
and it'll be helpful just to be able to backfill for one of us.
We'll learn together.
Okay, sounds good. Like a plan.
So where did we land on that?
Gore, alternate, Suzanne.
Me.
Okay, good. Indian gaming, we hardly ever, I don't think we met in quite a while.
We're actually supposed to meet every quarter, I think.
Yeah, we haven't.
Or is that the other one? That was the one that distributed the state
This is
funds.
the state
That might be
grant
one
fund
we
one.
could disband.
Yeah, I think that was gone.
If we could look into disbanding any of these. So there was a time based on Native American gaming in the state of California where the state was getting funds and then redistributing them. And that's what that committee did. So I was confusing it with the, and there just hasn't been any state money for some time now.
Yeah. That's the one where we all met and made a decision, and then the tribe went in the back room and told us what they were going to do.
The tribe had veto authority.
What we're going to spend the money on. Okay, fine. All right. PCTPA, I'd like to stay on that. And Suzanne, you want to
Sure.
do that one? Okay.
I'll
good.
stay there.
Transportation Planning Agency Countywide Steering Committee. Oh, have you ever met?
Is that a thing?
No, that might be one.
Let's look at this one as well.
Yeah. If you would, please. Yep.
Okay, Roseville City Council, Placer County Liaison. You want
Yeah,
to
since
serve?
Roseville's my district,
Yeah.
sure. Bonnie and I are probably best suited for that.
Okay.
And then there's two of you.
Yeah.
Lord Jones would be that committee, right?
Yeah. Bonnie and I can share Roseville.
Rural County Representatives of California, I'd like to stay on that. And since Supervisor Gustafson lives in much of the
In a
rural,
rural area?
yeah, 75% of the county. You're okay? Okay. SACOG,
Probably need to keep that one.
yeah, please. You've already had it changed. And I don't mind being the alternate unless you'd like to be the alternate for SACOG, Sacramento County.
Sure, I'd like to try it if
Okay.
you're up to
Yeah,
letting
that's
it go. Sure.
All right. Sewer Maintenance District 1, Lincoln Regional Sewer. I think I should be on that, and I think Supervisor Gustafson should be on that.
We thought about doing it that way.
Because we represent the ratepayers.
Somebody else.
It's SMD1.
Actually, that's one I mean, whatever the board decides, but I think it's important that I'm on there because I represent all of Lincoln. And frankly, Bonnie was very
Okay.
helpful. I am indebted to her for
I'll leave
assistance.
it
But
to my esteemed
Yes,
colleagues.
but Supervisor Wygant, the ratepayers in SMD1 are not happy with you.
And that's fine, but the job's not supposed to be easy. But it is negotiations directly with the city of Lincoln, which I represent
Yeah,
every
but
citizen. And
but there'll also be someone from the city of Lincoln representing. So that
Wait, it's SMD1, but it's also
that's in North
the,
Auburn. North
but it's also just the Lincoln, or is it just SMD1? Because SMD1 goes into Lincoln.
Yeah, and just for clarity purposes, the SMD1 ratepayers have no reason to have any gripes with me. The rate increase that occurred several years ago before the project was done it was necessary. It was recommended by staff to approve it, whether we rebuilt the plant or a pipeline to Lincoln. Didn't change a thing. Their costs haven't changed one penny one way or the other. The reality is we're going to be going through negotiations and evaluation of the agreement that led up to the construction of that pipeline. And we're going to have some rough spots, and the tough love to Lincoln from a county supervisor, I think is a critically important component of that, which is what?
He's tougher than me.
No, I appreciate the perspective, but there's an opportunity there for us to help Lincoln and ourselves, and it's going to be intimately involved in looking at the city of Lincoln's operations and how they're doing business, and it gives us an opportunity to collaborate with them and manage together something for which we have a common interest. And again, they can be as mad as me as they want. Their rates would be the same had we rebuilt SMD1 or a pipeline.
No, we had to raise the rates $14 a month to build the pipeline.
Not because of the pipeline. We would have had to do it either way. It's exactly the same amount.
So my thought about
but
my thought about this one though is that it's up to you, Cindy, as well. But Robert has now spent this last we spent a year and a half. I don't know, talking to the city of Lincoln. There's that, and he's seen it up close and personal most recently, and really understands the work that has to continue to be done with the city of Lincoln as we navigate,
as we go forward,
as we move forward with the challenges that they have as a city and the relationships and the partnerships that they have with the county.
I'm good with that, and I can stand by as an alternate to either one of you, and happy. I know decisions are going to be coming back here to the board, and I'll have a chance to weigh in on behalf of my ratepayers down here.
Well, and I would encourage you to participate. I mean, if you would attend the meetings, it would be a great thing, and we could.
I have to sit quietly, right?
No, not necessarily.
Be the referee.
So what we'll do is we'll add an alternate to this. This is one of two new committees we've added for this year. So what we'll do is we'll add Supervisor Gustafson as alternate, and then Supervisor Holmes, Supervisor Wygant. Is that the direction I'm hearing? Okay.
Okay, Sierra Nevada Conservancy.
This is one, I'm on the California Tahoe Conservancy Board representing us, so I could easily share this with somebody else if they'd like it. Right now, I think El Dorado County is the representative. We alternate the counties, so haven't been to a meeting, but the counties are, every once in a while we do a conference call between the three, so.
My gut is that I served when it first started. I served the second term for our region, and personally, I think it's a good assignment for your district. The boundaries, as you know, come all the way down to the valley floor, essentially, so it covers almost all of us at some level. But the vast majority of the geography in the Sierra, in Placer County, is in your district, and to the extent that you're actually not
trying
active.
to be flexible and share.
And it only meets 4 times a year, so.
Okay.
Okay.
Happy to stay there.
Sierra Sacramento Valley EMS, I'd be glad to stay on that. The South Placer Regional Transportation Authority, Sparta. Since I'm on the Placer County Transportation Planning Agency, I'd like to take that on. It hasn't met very often, but it always meets right after the Placer County Transportation Planning Agency meeting.
So would it be appropriate to have Suzanne, or, because you and Suzanne, either the member or the alternate? I don't need to be the alternate.
Yeah, because, it's South Placer. You don't get any more south than me. My district bumps up to Sac County too. So I would be willing to serve as your alternate.
Okay.
If you let me go with you.
All right. It's just more convenient since I'm already here, and it frees you up a little bit. Okay, the subcommittee, what the hell is that?
I didn't even know that was something.
Well, you're still on it.
And it doesn't make sense to be on the Sparta subcommittee if I'm not even on Sparta.
Right.
So,
Okay.
Right.
Well, then I'll take that.
Okay, and can I stay on it as well?
Yeah. Okay. South Placer Regional Wastewater Authority, that should be pretty straightforward. Tahoe Conservancy, straightforward. Tahoe Regional Planning Agency, yes. Tahoe Treasurers Review Panel, been on there, Robert, since the creation, so I don't see any need to.
If somebody wants it, it's available.
The Tribal County Advisory Committee.
That's the one that I was originally thinking of. That's the one I think is supposed to meet 4 times a year. We might take a look at rekindling that just to make sure we're current with the MOU. The good news is it was to meet as a part of the MOU negotiations, to reach out to the community, to make sure that the two parties to the MOU, the United Auburn Indian Community and the county, were aware of and could address early any issues that were unforeseen as a result of this massive amount of work. The good news is we never needed it really, but it was a good opportunity to keep everybody up to speed, and it became more opportunistic as problem oriented, but I think we should rekindle it just because it's part of the MOU.
And if I recall, every time there's a new chair, don't they have a meeting with the sheriff and the?
Yeah, so the meeting was with public protection and somebody, board representation, representation from the tribal council, which was really good because oftentimes there are several of them, but always the tribal chair.
Yeah.
And then our staff that was involved with, we've had a lot of dialogue and negotiations, very constructive activity with the United Auburn Indian Community, most lately the collaborative funding on the parkway. So those kinds of things are just an opportunity to take a second look at things and help hopefully build continued good relationships.
Right. Okay. So Turkey Airport, you're on that.
Yeah.
And the Veterans Hall is self-explanatory. And West Placer Waste Management. I think we're good.
Okay, so Todd, staff,
So
did you
just
guys?
on the West Placer Waste Management, then Supervisor Jones, are you interested in being the alternate there or the secondary alternate? Because we
Oh, you can be the alternate. or you-
Supervisor Euler was the alternate previously.
That's fine.
And Suzanne, that's, there's a lot of stuff going on there too. So I would encourage you if you wanted to come to the meetings, but also really good staff, I think. And we're doing a master plan. We're completing that, but it connected intimately with the Sunset Area Plan update.
Yeah.
So there's a lot of jobs, landfill management things that are going on that we'll need. Kirk really had to go to work when he served as an alternate the last couple of years, so that'd be a good one.
I'm up for it.
Okay.
And so just a quick question for you, Suzanne. Are there any of those, are you interested in serving either on the flood control or the audit? And you certainly don't have to, but, and I can continue. I just wanted to.
Oh, yeah. No, I don't think I would have any interest right now in flood control. I don't currently live in a floodplain, so my district isn't too much there. But as far as the audit, I don't know. Let me learn more about it before next meeting.
Yeah, we generally meet
Now?
Every quarter, right after the Board of Supervisors meeting.
It's 4 times a year, so it's not a huge lift, but you certainly get to learn about what's happening in the county and all the finances and.
Yeah, you can see how the county, the assessor's office or the county auditor does all the auditing for all the departments. And then we have outside auditors that come in. So it really gives you a good understanding of what, all the stuff that goes on that we don't see all the time. It's good stuff.
Right.
Okay.
Okay, Todd, do you have any questions or do you have the list or?
I think I have everything put together. We'll make adjustments. We've got a couple boards looking at whether we continue those or they're terminated. I guess my only question was, do we come to resolution on the Criminal Justice Policy Committee? I know, Supervisor Jones, you mentioned that. That's what we.
Her and I are.
Okay, Supervisor Holmes. All right. So we'll make that correction. But how about I just clean this up and I'll get it out and I'll speak with you individually. Our intent is to have this back in a formal discussion on the 26th for a formal adoption.
All right, great.
Okay.
Thank you.
Thank you.
Well, with that, we are closing the meeting today in memory of Ken Addison, who spent 22 years with the Placer County Sheriff's Office. He worked in special ops, criminal justice officer, dealt with fugitive tracking, information management, threat assessment, served as a member of the Foreign and Domestic Terrorism Task Force, and he leaves a wife and 2 sons. So we are closing today in his memory.
Is there any public left for public comment?
There is none.
There-
I want to announce that.
And we're going to be bringing it back, so we will have 2 public comment periods during the next time we consider committee assignments.
Well, maybe we could take a minute of silence and then close the meeting.
Yeah.
Okay.
Okay, thank you.
Thank you.
So
Thank
with
you,
that,
Sheriff.
we are adjourned for the day.
All right, good work, people.
So are we still having our audit committee